Chair, members of the board, good to see everybody today. It's 2:00 p.m. Today's Tuesday, June 23rd, and my name is Brian Zumwalt. I'm the director of the county's Office of Technology and Innovation. I'll be playing the role today of technology moderator for the virtual meeting. On the panel with me is Don Crow from the county attorney's office, who will be serving as process moderator. Before we start the meeting today, I'd like to do a quick roll call as usual and ensure that we've got communications for each commissioner. And we'll start today with Commissioner Eggers.
Good afternoon, Brian. I'm here.
Thank you, sir. Commissioner Seal. I'm not seeing Commissioner Seal just yet, Madam Chair, so we'll go skip her for now.
She'll be on in just a second.
Okay. Commissioner Welch.
Good afternoon, Brian.
Good afternoon. Commissioner Long. Got to unmute, Commissioner Long.
I'm here, Brian. Good afternoon.
Excellent. Thank you. Commissioner Justice.
Good afternoon, Brian.
Good afternoon. Commissioner Peters. I think Commissioner Peters, she appears to be on. Commissioner Gerard, can you hear me okay?
I can.
All right. So we're waiting on Commissioner Peters and Commissioner Seal, but I don't know if you want to get started.
Let's go ahead and get started.
Okay.
Okay, so the first item on the agenda, we have added back public comment, but I want people to know that this is for items that are not on our agenda today. So if you're here to talk about the state of emergency or wearing masks or any of that, please wait until item 20. This is just for things that are not on the agenda or that are on the consent agenda. So Brian, do we have anybody?
At this time, if there are any members of the public that wish to speak on the citizens to be heard, go ahead and raise your hand virtually in the Zoom meeting or hit *9 if you're on the telephone. And Madam Chair, we do have two speakers that wish to be heard. Our first speaker is Mr. Dave Waddell. Mr. Waddell, if you go ahead and unmute, you'll have 3 minutes to address the board.
Thank you. I do want to make a overall statement, and I would also like to speak to items 20 and 21. Honorable Chair and the Board of County Commissioners and staff, thank you for the opportunity to be heard here today. My name is David S. Waddell. I reside at 4835 164th Avenue North, Clearwater, Florida. I want to commend you for guiding the community and providing a sense of certainty in these uncertain times. I have come before you to provide a real-time account of the events that led to my being knowingly exposed to COVID-19 and the exercise in dealing with what do I do next. It is clearly apparent that masks and social distancing have all but disappeared. Pre-pandemic mentality. Some of this is due to the virus becoming a political hot potato and wearing a mask, some sign of some sign. Thank God I wear a mask in public always. I am a cancer survivor and a caregiver to a cancer survivor with other pre-existing conditions. We did everything right as he received his radiation treatments for 6 weeks ending on April 28th. As a society, it is our civic duty and responsibility to contribute to minimizing the spread of the virus by wearing a mask. I propose a civil first offense, a free mask and a warning. Thereafter, a $50 fine for each occurrence. We really have no choice. Common sense has lost to the uninformed or downright selfish ignorance. The bigger problem is that businesses that interact with the public have no requirement to report an employee positive test unless they are a human medical related business, which in my case led to my exposure at a veterinary clinic, for which, like all businesses, is voluntary reporting of employee exposure. Anyone got a match because this will set this virus ablaze like we've never imagined. We also need to dramatically increase our contact tracing and testing availability, which based on my experience with the Pinellas County Health Department has left me unsure and with no real direction. I need a test, I don't need a test. I was actually discouraged about getting one test. Were the other employees tested? How do we know what was voluntarily reported is accurate? Why were they allowed to remain open? Confirmation of contact tracing. HIPAA laws tie our hands on the valuably needed data. So this is a match and lots of fuel. Time is of the essence. John Wayne, the federal and state and lack of leadership and aid ain't coming. We are on our own, as it's always been said, all politics is local, and everything we do begins and ends here. We are only going to get one chance at this. We are on the verge of losing all the ground we have gained. You thought that was tough? This will be much more difficult. We are the next epicenter, it says on the news. Please, no refrigerated trailers in Florida. More than likely, we will have to walk back our openings. I have an attached document that was forwarded to the board, emergency management, and the health department, and I would like to go over that later.
Mr. Waddell, your time has expired, sir.
Okay, I thank you so much, and I would like to speak on agenda items 20 and 21 as well, please.
Well, how about if you save that? Because you just did. Again, if somebody wants to speak about COVID or wearing masks or anything to do with what we're going to be talking about today, please wait until item 20. Thank you.
Madam Chair, our next speaker is Michael Fox. Mr. Fox, if you'll go ahead and unmute yourself, you'll have 3 minutes to address the board. And for the record, please give us your spelling too. Spelling, first name, last name, and address. And you have to unmute, Mr. Fox. Hello?
I am so sorry. Technological challenges. I will be brief. First and foremost, I want to thank the commission for its focus on the health of our community. Kudos in many respects up to this point. We'll discuss health later on down the road. And my apologies for my ignorance. When I go to a physical meeting, I know how to find an agenda. Unfortunately, I don't have an agenda in front of me, so I'll simply ask that at some point, commission address the sheriff's approach to the arresting of peaceful protesters. Likewise, any evidence of non-peaceful engagement, video preferably, would be greatly appreciated. My name is Mike Fox from St. Petersburg. Thank you so much for the opportunity.
Thank you.
Thank you, sir. Madam Chair, our next speaker is Patricia Cox. Ms. Cox, if you'll go ahead and unmute yourself, you'll have 3 minutes to address the board. And give us your name, spelling, and address, please, before you address the board.
Yes, my name is Patricia Cox. It's Patriciacox. I wanted to speak to the masks, and I know you want to hold off on that. So I will back out again and wait for that time and speak then.
Okay, thank you.
Madam Chair, our next speaker is Anita Holyfield. Ms. Holyfield, if you can go ahead and unmute yourself, give us your spelling, address, and you'll have 3 minutes to address the board.
Hello, my last name is spelled Holifield. My address is 1125 2nd Avenue South, 33715. Commissioners and fellow citizens, in December 2015, Mario Woods, 26, was shot 20 times by San Francisco police officers. In response, San Francisco football player Colin Kaepernick began kneeling during the national anthem. The purpose, as stated by Mr. Colin Kaepernick, was to bring attention to the murder of Black and brown, usually unarmed people by law enforcement. Some, under the mistaken assumption that they have agency over Black man's mind, pushed the false narrative that this action was disrespectful to the military and veterans. That's laughable. Where were these patriotic Americans when my father, after wearing a U.S. uniform in Korea, returned to an America where he was legally required to sit at the back of the bus? I digress. That is not my purpose here. Although today I do wonder if these Fox politicians have any comments about a police officer kneeling on a Black man's neck until he dies. Should protesters, upon seeing this again, start reciting the anthem so that the police officer will rise? Off track again. Florida doesn't allow no-knock warrants, so armed intruders that happen to be police officers won't get met by a hail of bullets by a lawfully armed citizen. Regrettably, these actions by Kenneth Walker couldn't save Breonna Taylor, executed by police in her home, the result of a no-knock warrant served at the incorrect address. It is naive and dangerous to think that these type of tragedies couldn't happen in Pinellas. Even no-knock warrants can be served by federal officers. The sheriff's office offers concealed carry weapons classes for free at his office, far away from South Pinellas on Ormilton Road. My purpose today is to request verbally and follow up in writing that some of the free CCW classes be offered at SPC Allstate, where a law enforcement academy is located. I expect the sheriff's response to be no. I will request a written response, and I'm asking the Board of County Commissioners to find money in the CARES Act to pay a trainer to host a free series of CCW classes in the southern part of Pinellas County. I have no faith that the Pinellas County Sheriff's Office will protect my life. What's important is that I get others and folks like me the opportunity to protect myself. And I want to thank my commissioner, Kathleen Peters, who blocked me on social media, or because this request would have been made to her directly. Thank you.
Thank you.
Madam Chair, we have one more speaker that wishes to be heard, Mr. Robert Ameo. Mr. Ameo, if you can go ahead and unmute yourself, give us your spelling, address, and you'll have 3 minutes to address the board.
Yeah, hi, this is Robert Ameo. Can you hear me clearly?
Yes, sir.
Yeah, last name's A-M-A-I-O. Address is 14869 Mockingbird Lane West, Clearwater, Florida, 33760. First of all, I want to thank the sheriff, and I want to thank the members of his department for their professionalism and for the fact that they are honoring their oath to the Constitution, particularly during the COVID crisis. We as citizens do not need your directives. We do not need your orders. You have no right to do so. They are unconstitutional, and you are trying to do so under the color of law and under the 10th Amendment of the Constitution for the police powers of the state. Individual rights trump everyone's safety, and I am adamantly opposed to any directives or any orders through this council. And there are about 11,000 members behind me and the various Trump squads that are looking to go after the qualified immunity and go after the county commissioner board for multiple felonies that you have committed in the violation of the constitutional rights of our citizens. And I don't particularly like the looks of some of your face when I'm saying that. You are in service to us. We do not take your orders. We do not obey you. You work for us. You need to remember that, please. That's all I have to say about this.
Thank you.
Madam Chair, we have 2 other hands that went up. Our next speaker is John Benincasa. Mr. If you can go ahead and give us your name, first and last spelling and address for the record.
Yes, my name is John Benincasa.
Mm-hmm.
Spelling last name is B as in boy, E-N-I-N-C-A-S-A. My address is 125 Camphor Circle. I am in Unit D in Oldsmar, Florida, 34677.
Thank you, sir.
First of all, I want to applaud you for the courage that you're having this discussion today. I know you're going to be asked to make some pretty unpopular decisions, and I am pleased that you have the courage to do these things. Secondly, I think that in addition to some of the things you're going to discuss right now, I would encourage the City Council to take a hard look at our taverns and our bars, not our restaurants, because clearly there's evidence that they are struggling to keep a COVID-safe environment for the people in this county and in this region as a whole. So I would encourage you to maybe take a look at that, maybe ask them to take a 2-week break from their activities, maybe put some regulations in place that would only allow them to operate outside. I'm not really sure what, but I do know that before this situation gets out of control, that might be a good place to start. That's it.
Thank you,
Thank
sir.
you. Brian, you know what? Let's just go ahead and do the consent agenda and come back to public comment because
Okay.
nobody's paying attention anyway
Okay.
to the guidelines I put out. So we have the consent agenda items 2 through 19. Does anybody need to pull anything for discussion?
Move approval, Madam Chair, of
Second.
consent.
Okay, we have a motion from Commissioner Long, second from Commissioner Welch. All in favor, please raise your hand, say aye.
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 Thank you so much. Okay. Now we can talk about the local state of emergency. Item 20, Mr. Burton.
Good morning or good afternoon, commissioners. Item number 20 is an extension of the local state of emergency. For the purposes of discussion, this has nothing to do with masks or any additional requirements. This is simply extending the state of emergency from June the 23rd until July the 3rd. So this action, that's what's requested out of this action. The next item is the issue that we're going to talk about, which is a local ordinance.
Move approval.
Second.
Second.
Okay, we have a motion from Commissioner Justice, second from Commissioner Welch.
We do have three hands up, Madam Chair. Do you want to go to those, or do you want to wait till the next item?
Well, I guess I need to, but I
Okay.
will ask again, if this does not have to do with the local state of emergency as opposed to masks, please wait. One more minute.
So we have 4 hands up, Madam Chair. I'll go ahead and take the first one. It's a caller coming in on the phone line, last 4 digits 5054. If you can give us your name, address, spelling, and you'll have 3 minutes to address the board.
Good afternoon, commissioners. I'm sorry, I guess I raised my hand too soon. I was under the impression that you were going to go right to the public comments about the masking. I'd like to defer until that time. Could I possibly do that?
Yes,
Yeah,
please.
we'll go ahead and lower your hand until the next item. Anybody else that wants to speak on the state of emergency, please keep your hand up. And it looks like we do have 2 speakers, Madam Chair. Our first speaker, I only have a first name, Dawn. Dawn, if you can give us your first and last name, address, spelling, and you'll have 3 minutes.
Can you hear me?
Yes, ma'am.
Oh, okay. I'm not used to this Zoom thing. First name is Dawn, C-A-W-N. Last name is Bowler, B as in boy, O-H-L-E-R. I live at 6678 54th Avenue North, St. Petersburg, 33709.
Thank you.
My question as far as the extension of the emergency order, I looked at the Pinellas County numbers just probably about 20 minutes before this meeting started. According to the numbers, Pinellas County does not even have 4,000 cases, and these are cumulative cases. To my understanding, these are numbers that just keep piling on each other since March. So we have an accumulated case not even reaching 4,000 and a population of over 1 million. How do you justify extending the emergency order when these are cumulative cases? We don't know what active cases there actually are.
Okay, thank you.
And Madam Chair, we have one more speaker that wishes to be heard. Again, Mr. Dave Waddle. Mr. Waddle, if you go ahead and unmute, you'll have 3 minutes.
My name is David Waddell, D-A-V-I-D-W-A-D-D-E-L-L. I reside at 4835 164th Avenue North, Clearwater, Florida, 33762. What I'd like to know regarding the emergency management situation is this. The contact tracing that is currently being used is ineffective. I've experienced it firsthand. Dr. Cho, I'd like for you to elaborate on how we are going to handle this. We have a bigger problem than just wearing the masks. This isn't just a mask issue. This is a contact tracing issue with voluntary reporting. And this is an emergency, a state of emergency when a employee tests positive and they are voluntarily calling, and I end up, because the owner was not going to call, they called me as a courtesy. I ended up having to call and give the health department the name of the clinic. It was a veterinary clinic. My dog laid there for 2 hours and I sat there with my mask. It saved my life. Anyhow, my point being is this is a state of emergency. We have no contact tracing. And until we start doing that, mask is only a little stepping stone, okay? We have to do that. But this contact tracing problem, hey, I have no direction. And I have talked to my health department contact there, and I was discouraged from getting a test. For God's sakes, people, there's lives on the line here, all right? I mean, we have to come up with a solution, and contact tracing is what's going to save us. And we have to have voluntary. No, it has to be mandatory reporting to the health department. For God's sakes, I had to call the health department and give them the information because he told me he was not going to call them, that it was a voluntary courtesy. That is a very big problem, just waiting to go. So light a match because all the fuel's out there. And until we do that, God help us.
Thank you, sir. Madam Chair, there are two other speakers that wish to be heard. Patricia Cox, you are next. If you can go ahead and give us your address and spelling, and you'll have 3 minutes to address the board.
Thank you. I appreciate that. My name is Patricia Cox. It's PATRICIACOX, and I'm in Largo, Florida. My address is 13,001 114th Street North. And I do want to address this. I like a previous speaker. I do think that because these numbers are cumulative and not being kept up as ongoing, what's going on right now, it is scaring people to death, like the previous speaker, who unfortunately does not. I don't think he did any research, but he's just scared, and that's the problem with keeping this thing going. It's just keeping people scared. We need to live our lives. We have to be able to do normal things and not be pushed to the point of where we stop everything entirely forever. That's got to happen if we stay scared. I don't think the numbers are there with how many people are actually sick. I think that when they say cases, they're also talking about people who are testing positive who are not ill. And if I understand this correctly, we're surrounded by viruses and bacteria all the time. This is normal. We have flus that happen every year. People do die, people do get sick, people do recover. I just don't think the numbers are there to keep us shut down indefinitely. As far as tracking people, I do believe that's unconstitutional. I don't think you need to start taking away people's rights. So keeping us in a state of emergency just doesn't make any sense at this point. I think we're past the worst of it. And I think, we'll head into another flu season and then it'll be something else. And so until we're ready to shut down every time the flu comes around and get into that mentality, it just doesn't make any sense to me. And I thank you for hearing me out.
Thank you.
Madam Chair, we have one more speaker, Miss Elena Levine. Miss Levine, if you'll go ahead and give us your spelling, address, and you'll have 3 minutes to address the board.
Yes, it's actually Dr. Elena Levine. I'm ELENA-LEVINE. That's MD. I'm at 936 Virginia Street in Dunedin, 34698. If I talk now, I can also comment again at the mask issue.
Yes, ma'am.
Okay, so I'm board certified in preventive medicine and public health, and I practiced family medicine for decades. This is nothing like we've ever seen. The commission, I'm going to speak very briefly. I hope to speak longer later. The commission needs to do whatever it can to stop the carnage from this pandemic. We have never seen anything like it. We have no adequate treatment. We need to learn from other countries how they've managed this to keep New Zealand with only 22 deaths in the whole country reported from this. We've done nothing right from the beginning about this in this country, and especially in this state. And if you look at the reports from a very important study out of Iceland, a full 50%, 50. So I hope the prior speaker is listening to this commenter. 50% never got any symptoms whatsoever, ever. We have no idea who is asymptomatic out there passing this along to us, and we have a right to safe air. You would not allow toxins to be put in the drinking water, and you can't allow people to be spraying this deadly virus that we don't have a cure for into our faces without our consent. Where you need to do and extend any regulations, any help, any education. We need more than just regulations. We need massive public education. People are not understanding this. This is a completely different thing than we have ever seen, and we don't have effective treatments. A vaccine is not in sight that's effective and safe, and we are only going to get worse. All it took was one person on a train in New York City from New Rochelle to Manhattan for 1,000 contacts to have to be traced. People have to get it, that this is an extremely contagious, deadly, dangerous, unprecedented situation. We have you as a commission need to protect us and keep us safe with any tool you have. So I'll reserve the rest for later. Thank you.
Thank you.
Thank you. Thank you, Doctor. Madam Chair, there are 3 other speakers that wish to speak on this item. Just for those 3 that are on, if I want to make sure the comments are related to this agenda item. If they're not, go ahead and lower your hand. We'll go ahead and go to Michael Fox again. Mr. Fox, go ahead and unmute. You'll have 3 minutes to address the board.
Thank you so much for the opportunity. Again, Michael Fox, 719 52nd Street North in St. Petersburg. Very brief. Solidarity with what the doctor said. Thank you.
Thank you, Mike.
Thank you, sir. Madam Chair, our next speaker is Barbara Walker. Ms. Walker, if you can go ahead and unmute, give us your spelling, address, and you'll have 3 minutes. Ms. Walker, you have to unmute yourself.
Okay, this is Barbara Walker at 319 Bradford Circle in Palm Harbor. And I wanted to ask that you extend the local state of emergency on behalf of all of the first responders and the people that are dealing with the outfall of all of this. I've been monitoring the 911 activity, and I can see how busy things are. And I've seen that the hospitals are not are reaching capacity, and I think that those are 2 good data sets to make a decision by. And I wanted to tell you that we thank you for protecting us, our family, our 15-year-old daughter, our 18-year-old daughter, and my husband. And I know that there's very, very heavy weights on all of your shoulders, and that I hope that you can feel my support. Thank you.
Thank you.
And Madam Chair, we have one more speaker. I do not have a name. It just says Well Life Global. So if you'll go ahead and unmute yourself and give us your first name, last name, address, and you'll have 3 minutes to address the board.
Hi, my name's Yvette Gaw. I live in 9371 Blind Pass Road, St. Pete Beach, Florida. I will have to absolutely disagree with your previous callers. I work with physicians right now, and as far as extending the emergency, the state of emergency, I think we are fear mongering. I think this is absolute insanity. I am a healthy 54-year-old. We've been on this planet for 2,000 years. We have trillions of viruses in our body. I study health extensively. I work with doctors who study health extensively and have followed this. We have right now, there are more deaths. So we have 473,000 deaths globally of this. However, we have 800,000 people who have died of AIDS. We have 3.9 million people who've died of cancer. Where's the outrage there? You're saying that this is being asymptomatic. The World Health Organization came out on Monday, and because social media lit up like a Christmas tree, they retracted. But if you listen to the scientist that retracted her statements on asymptomatic and passing this virus along to others, a healthy individual, I work out every day. I eat organic. 12% of our country is metabolically healthy. Build your immune system. Stop scaring people. Teach them how to eat healthy, take vitamin D, get out in the sun. And by goodness, please tell them not to wear a mask riding their bike and wear a mask walking on the beach. This is endangering their lives. And I can go, when we go into masks, I can go into the studies that show that we are blocking their airways. And these people are going to pass out. And I've already met 2 people gone to the hospital, and I'll address all that later. But people need to wake up and stop and think and use common sense. And they're reactivating viruses within their body. I will hold my comments for the mask later.
Thank you.
Madam Chair, there are no other speakers that wish to be heard on this item.
Okay, thank you. We have a motion from Commissioner Justice, second from Commissioner Welch, to extend the state of emergency for 7 days. Again, all in favor, please say aye.
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 And okay, that passes unanimously. Okay, we're going to talk about an emergency ordinance requiring face coverings. I just want to say, the commission will have our discussion first, and then we'll take comments. I can assure those of you who have already written to us, we've gotten over 800 emails on both sides of this issue. We have 3 doctors in our meeting today that are going to give us some up-to-date statistics. I personally will be making my decision based on what they're going to tell me. Please, if you have already written to us, I can assure you I've read as many of those emails as I possibly can. Please don't feel the need to speak today if you've already written to us. Thank you. Okay, go for it.
Barry, you need to unmute, sir. I'm sorry.
Sorry. As discussed last Thursday, we, and I'm going to let Dr. Cho give a presentation with up-to-date numbers. But the trend is very clear that we have issues within our community. There's community spread and our numbers are increasing. And as a result of last Thursday, we prepared an ordinance with 3 different versions of that for your consideration today. The first is very clear that we know that we're seeing a significant increase amongst our younger age group. We know that we've also seen us let our guard down regarding areas of bars where they have large bands and dance clubs and things like that. So any of the requirements or any of the versions contain a requirement for where you have a customer and patron employee interaction, that there would be a mask requirement for the employee. Any of the versions will have a requirement that we restrict bars to limit the large crowds, saying that you can only serve people that are in a chair. Listen, we know that we were very excited to see our economy begin to open up, but what we've seen is that we're not just opening up, but we're going back to business as usual, and that really cannot continue. And I do feel we have so many different versions of what we consider a bar. We have beach bars, we have extensions of restaurants, we have a lot of different versions. It's very hard to write an ordinance that covers that, but let's go to the clear intent. We cannot have large gatherings of people where they're practicing no social distancing and they're at an increased chance of spreading the virus, and that does not keep us safe. So any of these versions puts requirements to mandate social distancing, limiting large crowds. Now, there's a second version would then add, which was one of the items discussed last week, for any of the customers to wear masks in a grocery store that's only a grocery store, and a drugstore that's primarily a drugstore, and in doctor offices. And so that's a second version. And then the third version would say that if you're going into any business, so all customers and employees, where you have customer-employee interaction, and there's a variety of exceptions to that, that a mask would be a mandate. And so, in fact, those are the 3 versions that you have before you, and we'll get into each one of those or answer any questions. But to give context to this, I would ask Dr. Cho to outline exactly what we're seeing, what we've watched over the last week.
Okay. So good afternoon, board. Just to give you some updates on numbers, we have over 4,000 cases as of today with 129 deaths. The biggest indicator, the metrics that we're watching is the case counts, and these are new cases as well as the percent positivity. So what we do is look at 7-day averages for case counts. It's been, it is now at 219, and a 7-day rolling for the percent positivity is at 12%. Keeping in mind that about 4 to 5 weeks ago, that percent positivity was only 1 to 2%. So certainly we are seeing increases in both those metrics. Additionally, as Barry mentioned, we are seeing increases within our hospitals, ED visits, ICU beds, and hospitalizations. If you look at our ICU beds on our dashboard for the county dashboard, you can see that 18% of our ICU beds, which consists of 65 patients, are occupied by COVID patients. And just a few days ago, it was 50 and 40. So we are seeing more in the hospitals. And if you talk to those working on the front lines in the emergency rooms, the healthcare systems, they will tell you the same things. We are clearly seeing a community-wide spread. And I know the focus and the group that with the highest growth is a 24 to 35, but keep in mind that this is a respiratory virus and it's really not confined to a particular age group. It's growing really across the board. So again, just to reiterate that message, that if you fall into those high-risk groups, those that are older than 65, those with health conditions, it's very important to take those necessary precautions, social distancing, staying at home, masks. But in addition, those that are around those vulnerable populations. So it's the younger adults that works in the nursing homes or takes it back, potentially spreading into the grandparents. So it's important that all of us really take those precautions to really save and protect this vulnerable population. Let me touch on, so the State Surgeon General, Dr. Scott Rifkes, did release a health advisory this past weekend, just reiterating some of those key points, that all individuals in Florida should wear a mask in any setting where social distancing is not possible. This is very consistent with the CDC guidance as well. Additionally, vulnerable populations should limit personal interactions outside their home and take all measures to limit the risk of exposures, as well as limiting mass gatherings to more than 50. Some of the message that we've always sent is that nothing has changed. There is no cure, there's no treatment or vaccine. We have to, certainly it's going to be with us for a while. We have to learn to live with it. And certainly with the increasing numbers, it is concerning. And we do need to take additional actions. We know the trends cannot continue. Ultimately, what that would occur if this trend line continues would be increased death, increased hospitalization, and then ultimately overwhelming the healthcare system, which is something that we don't want to do, because what that will lead into is complications and death for both COVID patients as well as those without COVID presenting to the hospital with a heart attack or a stroke, and they just don't have the resources to appropriately take care of them. So we certainly do not want to overwhelm the healthcare system. We know right now the only options are social distancing and masks.
So our community testing centers, through our community health centers, through the Bay Care and others, have been overwhelmed with the numbers. And so people get frustrated because of the long lines in this sudden surge and the people needing to be tested. And then they go to our emergency room, which then clogs our emergency rooms. So it's not one in particular issue. It's a combination of all. The numbers are clear, the trends are clear, that more needs to be done. So we prepared these resolutions for your consideration based upon the feedback we have. We'd be happy to discuss any piece or all at your discretion.
I have a question. This is a little bit off topic. Does anybody know exactly what the governor did today? I didn't have a chance to listen to him about bars.
The governor said they're going to launch Friday's testing at all all long-term care facilities. Let's see, that just talked about where they're seeing more positive cases and longer. Again, an emphasis on wearing, on hand washing. If you can't physical distance, wear a mask. No tolerance for businesses not following the guidelines. And he threatened to suspend business license and liquor license for those that don't comply. Need to keep occupancy limits in place in restaurants, pubs, and bars.
Okay, thank you. Commissioner Eggers.
Commissioner Eggers, you have to unmute, sir.
Of course. I wouldn't get that. Thank you for the intro to the topic. I was listening earlier today to the several doctors, including an epidemiologist, that talked to the Hillsborough County Commission. I think it was yesterday. And there was a couple of things. They talked about a number of things, and she was impressive and very descriptive in some of the things that she and the frontline people are encountering. But they talked. One of the doctors even, I think, was from Brandon, relayed his personal experience of having COVID, which is pretty eye-opening. But there's a couple of words that they used, exponential growth, if we could speak to that and how that affects things, not only today, but the importance of planning ahead. And the other thing is that the doctor from Brandon, and I think the epidemiologist also mentioned a lingering effect, or he called it an IOU, that will occur after you've recovered from the disease, what lingering effects there might be down the road. So those two items, exponential growth and how that's different and how important planning is, but also the IOU or the lingering effects afterwards. And whoever wants to take that, Dr. Jameson or Dr. Cho.
I can speak to the growth aspects of this, and certainly, as Barry mentioned, the curve is going steep. We have seen increases pretty significantly over the past 7 to 10 days, and the concern is if it continues to go, it is following that exponential course. Hopefully, we can take some measures. Hopefully, it would flatten or plateau, but at this juncture, it is still on the increase and certainly on the incline. Now, in terms of the lingering effects, and Dr. Jameson can feel free to add anything, but again, it goes back to the fact that we are learning more and more about this virus, right? We normally, for any infections, any chronic diseases, we have decades to study a disease, and we're really learning as we go with this particular virus, just having really been introduced to people since the end of last year. But what they're finding in terms of lingering consequences is that it does affect multiple organs. It's not just the lungs. They've found diseases in the brain. Chronic diseases in the lung, if there was severe damage to it, kidney injury, especially if someone develops sepsis. But the effects for a number of people have been unfortunately lingering for those that infected. As to the prevalence in terms of the percentage, I think that's yet to be determined, but we are seeing that more and more.
Yeah, and certainly the numbers that we've seen, I think through May, were something around 1,300 cases, which, people might argue that that's not a lot, or it is a lot. I mean, to me, it's a lot, but 83 deaths. And if you want to compare it to any number of other diseases, that's fine. It may not rank up there at the top, but to me, that's significant. And that was over about 10 weeks. And so in the last 3+ weeks, we've had an additional, say, 1,100. 2,400 in June, which is about a 90% increase in 3 weeks from the first 2 months, and 117 deaths. So it's 34 deaths increase just in June. So just in this 3-week period, there's been an increase of almost 90% of the cases, and probably a close to a 40% increase in the deaths. And so to me, there's an absolute number that is important to understand, but also the trends that we're seeing, the exponential growth that concerns us all a little bit. It's not just like a regular standard growth, because that means that people who currently have been tested, the results of and I think one of the guest speakers talked about tracing, and that to me, we don't know what that one person or those folks that have come up with the testing positive in the last 3 weeks, how they're going to affect their parents and their grandparents over the next couple of weeks, or friends or whoever else, unintentionally. And so I just think this exponential concept is really important to understand. And so is this unknown about the disease. There's just more that we don't know. So that's all I had for now, Madam Chair. Thank you.
Thank you.
Madam Chair, may I respond to Commissioner Eggers as well, please?
Please.
So you bring up an excellent point, sir. The exponential growth, to put that in a way that may be easier to understand, 3 weeks ago across the greater Tampa Bay area, we were averaging somewhere around 125 new cases a day. 2 weeks ago, it was 250 new cases a day. A week ago, it was 500 new cases a day. And now it's 1,000 new cases a day. And so that's exponential growth. And we would anticipate, based on that curve, that next week it could be as high as 2,000 new cases a day, and the following week, 4,000. And so when people talk about we're concerned that the healthcare system may get overwhelmed soon, That's exactly what we're referring to.
Thank you, sir. Anybody else? Yes, Commissioner Justice.
Thank you, Madam Chair. I think these numbers are really fascinating. And I went back and I looked and I compared, because I did this Friday, I think. I looked back at April 1st numbers, and our 5-day average back then was about 28, and Friday was 154. Our 14-day average was in April at 15, and the 14-day average Friday was 100. And then the actual daily cases back in April were 60, and on Friday they were 141. And the reason I picked that date to go back and look at was on March 20th was when the governor issued his executive order, which closed restaurants and bars and closed restaurants to only takeout. And that was a pretty significant move for Florida, for Pinellas County. And then April 1st, which is the number I'm comparing, is the day that he issued his executive order basically saying, don't leave your home unless it's for an essential service. And then we followed that up with our local order, which closed the businesses. So those are the dates I compared. And we've come this far now, and we're seeing those numbers at what they are. And, I think we all kind of were hoping that we had flattened the curve. We were hoping that we had gotten through the worst of it. We were hoping, but the numbers don't lie. And so look forward to the discussion, the conversation with our constituents today. But I don't think any of us wants to go back to a point where we're shutting down businesses and that kind of thing. But we have to throw, as I heard this morning, we have to throw every tool that we have available at it in order to make an impact and a difference. I did talk to some retailers this morning, and they were fully in support. Actually, they wish the governor would issue a statewide so that it was uniform across the state. But their question was about enforcement. I guess this is for Barry or for the sheriff, is about they don't want their greeters at the front door being responsible for law enforcement. And so what advice are we going to give our businesses? What are we going to counsel them on as far to whatever version we end up with? What's the best way that they can enforce the rules and keep people safe?
Thank you.
Sheriff, you want to, or I have? And so under the current ordinance, it's a requirement of both the business to enforce the ordinance and the individual. And so both are responsible. Obviously, from an enforcement standpoint, we're looking for assistance in that. We cannot have police everywhere and being mass police and things like that. Others have found great success. We're not the only one considering. There are a lot of counties in Florida that have implemented similar orders. And again, we need them. We need businesses to assist in doing that. But I'll turn it over to the sheriff in terms of what do you do if somebody doesn't comply.
Well, I think that everybody has to have skin in this. Everybody has to be responsible, and everybody has to step up. And that means the businesses, the employees, the owners, and the patrons across the board. And if everybody just realizes we have a serious problem, I wholeheartedly agree that the numbers speak for themselves. It's a serious issue, and it's moving in the wrong direction. Well, we've got to correct this. And if everybody would take it seriously and stop having 300 and 400 people gathering in one place, and that those business owners would do their due diligence and exercise their responsibility, that's a problem that can be solved. Don't let them in. And and I think that the version, at least that I recommend, which is the universal mask, which is the most comprehensive version of the three that the commission has, it has a lot of reasonable exceptions. Just do the right thing with it. And I don't think, Commissioner Justice, that we get to that point if people realize that there is a problem, and we're just got to be reasonable about it. And I have no intention of running out, and as I said before, and playing mask police. But if people are totally defiant, they're not making any effort, then we're going to have to address it to some degree. But I really hope that never happens. We don't get there. And what you all adopt today, it is countywide, it is consistent, and people just do the right thing. And I think that if they will just do that, we can get to a good place, and we can accomplish, hopefully, what we need to. But we need all the tools in the bucket to do it. It's not any one thing.
Well, and I think you're right, and that's exactly what we talked about this morning. And I I just wanted to make sure that I brought that retailer's concern to the meeting today for this conversation, and I appreciate your comments.
Thank you.
Madam Chair.
Yes, Commissioner Long.
Yes, Madam Chair, may I respectfully request that we hear from Dr. Thogmartin? I thought his comments the other day were especially profound, and he may help to educate some of our citizens who seem to think this is no big deal and that we are intentionally inciting people or creating a panic. I'd really appreciate it if we could hear from him, please. He is a scientist after all.
Yes, please, Dr. Thogmartin. And I will say Dr. Thogmartin is our medical examiner. He does the autopsies for Pinellas County.
Oh, thank you. I hope I can say the same thing I said last time. I don't really remember what that was. Well, I can tell you just an update. I was looking at, while I'm sitting here, I was looking at our statistics. April, things were pretty rough for us due to some of the care home deaths that we were having. But just to give you a flashpoint, you know, I'm looking for, I know I've talked with Dr. Jameson earlier today, and he was talking about the hospitalizations, ICUs. We're seeing a surge there. The data supports what you would expect if you have increased positivity. You have exposure beginning, then there's a delay. And that's what people don't really get. You know, there's a delay. You change some sort of policy, and then there's a pandemic out there. So whatever you're doing, there's a delay factor. So we have exposure, there's an incubation period. People start getting sick or getting tested. They start testing positive. And then once they test positive, let's say they have it, they know they have it, they're sick for a week number 2, maybe the next week after that, they start getting short of breath, they present to the hospital, then they're in the hospital for a bit, then they start getting worse, and then they get severe, they're on a ventilator, and maybe they pass away. So I would be the last stage: exposure, incubation, illness, hospitalization, and then the ones that are susceptible may pass away. So to give you guys an idea, in the past, we give case numbers to our unfortunate decedents that pass, and we accept jurisdiction. Our last 23 cases, which spans back to about maybe June 20th, out of those total 23 medical examiner cases, 10 of them are confirmed COVID-19 deaths. There may be an 11th that we're looking at. That may or may not be. So we're pushing like a caseload over the past 23 cases where, 40-45% are COVID-19 related. So that's extra cases, stuff we don't normally see. That's a pretty rapid rate. And I'm hoping that, I always say that pandemics and their exponential growth, I think the human mind, if it has a failing, it's failing to understand how exponential growth works. And at the same time, though, when you're applying exponential growth, if you apply it to a bunch of sheep in a pen, they can't contemplate on the disease that's tearing through them. So the exponential growth models work very well. We are smart, we're intelligent creatures. There would be, even if governments did nothing, there would be social distancing to a degree. There would be businesses modifying things on their own. There would be people that would wear masks on their own. So automatically your baseline models for this exponential growth that you'd expect based on the R naught, or the ability of the virus to infect people, you could calculate it very accurately if you had sheep, but we're not sheep. So I think that we will see an increase. It just depends on how much people are willing to do themselves to mitigate it and use their brains, and how much, municipalities such as yourself decide to act, and what is reasonable and what is not. I think if you base it on the science, I think that indoor spaces without face coverings, you've got to cover your face, I'll cover my face, and we'll be all nice to each other. I know, all courteous and polite. I look at me wearing a mask when I go to a grocery store as me being thoughtful to my fellow human being, because they don't want what I'm spewing, maybe. And I would hope they would do the same for me. If we do that, I think we can do a lot. If we social distance, we can do a lot. But it depends on what you want to do based on the science. I think that relatively outside, we're safer, particularly with our wonderful UV index. But if you are indoors and you are with people that don't live with you, you should have a very large social distance barrier between these people and yourself, or some sort of fabric barrier between yourself. That, if you're at work and you're working around coworkers that don't live with you and they're not masks and they're standing in your office without a mask on, that's not the holistic approach you need. I think that if we used our brains and our common courtesy, we could beat this thing.
Thank you. Commissioner Welch.
Thank you, Madam Chair. Commissioner Eggers and Justice really covered the points about the data and the trends all going in the wrong direction. I just add another way of looking at it is 40% of the cases have been in the last week in Pinellas County. My question is, and I want to thank Dr. Cho and Jameson and Thogmartin for being willing to speak truth to the issues and doing it in a way that folks can understand. Dr. Jameson and Thogmartin had the Facebook Live event this morning, and they talked about what we're seeing in the ICUs and the emergency rooms. And I would just like Dr. Jameson to touch on that one more time for the folks that are watching now.
Sure. So one of the things that we watch very closely, as Dr. Thogmartin was alluding to, there's a lag here between when somebody actually is exposed to the virus, when they become ill, when they might become hospitalized. So one of the things we watch very closely is the rates of hospitalization and then the rates of those in the ICU within the hospital. And that can give us insight into just how this disease is impacting the community. Again, we keep hearing it's no big deal, it's not that severe, I'll be fine. Well, if you watch what's going on in our hospitals right now, a week or two ago, there was between 80 and 100 folks hospitalized all across Pinellas for COVID, and today we're 230 something. So we have seen significant increases in the last few days. We have the highest or the most number of people hospitalized from COVID in Pinellas that we've ever had. We have the most number of people in the ICUs of Pinellas County that we've ever had. And so we are seeing not just the leading indicator of young, healthy people testing positive, we are also now seeing the lagging indicators of other people in the community getting sick, getting very sick. And unfortunately, I'm very concerned that next week, Dr. Thogmartin is going to tell us that his numbers are rising significantly as well.
And you mentioned the decrease in ICU beds. And again, a lot of those are non-COVID related, but the COVID related piece is growing. Looking at the dashboard, it's at 51 on our dashboard. Talk about what happens when those beds run out. We've talked about a surge plan, and let's explain that.
Sure. So all of our hospitals have been working for months to develop surge plans and contingency plans to deal with when things get bad. And to be perfectly honest, we all watched what happened with New York and with places in Italy, and we said, geez, we hope that really doesn't come here. And we all prepared for it. And then for a month or two, it seemed like we had flattened the curve. And it seemed like this was going to be a bit of a slow burn. And maybe we'd have cases here and there, maybe in the nursing homes. But the hospitals were hanging in there. And in fact, the hospitals, in some cases, were sort of eerily quiet because people didn't even want to go there. And now what we're seeing in terms of the numbers, in terms of the numbers of folks in the community, then the hospitalizations, then the ICU rates, we're concerned that we could actually start to look like some of those places we saw on the news before too long. Now, we had a conference call yesterday with some of our hospitals, actually with all of our hospital systems here in town, and every one of them agreed that if this trend continues for the next week or two, they are going to be severely strained. What we mean by severely strained is if you have a heart attack and you go to the hospital, maybe you don't get your treatment as quickly. If you have a stroke, maybe you don't get your treatment as quickly. So we're not just talking about the hospitals struggling to take care of people with COVID. We're talking about them struggling to take care of anybody in the community. And that's the point at which some people have described it as a cliff. And if we fall off that cliff, mortality from all causes in our community skyrockets.
Thank you, Dr. Jameson. I think it was important for our community to hear exactly where we are with this pandemic. Thank you, Madam Chair.
Thank you. Commissioner Seal.
Yes, thank you. With important information that's already been shared, I want to go back to Dr. Thodmartin. And this may be gruesome, but I would like to know, when you're doing the autopsies, what does COVID attack and what do you see?
Well,
we heard on some calls earlier where someone had to have a lung transplant and their lungs totally destroyed. We heard about 3 young people going on cardio machines because their heart had been attacked. So the public understands how serious this is. What are you seeing when you do the autopsies?
Well, it's a respiratory illness. It infects you through your respiratory tract, and obviously there's going to be changes to the lungs. But if it's just hard to describe. I mean, gosh, I really don't know how to say it without being gruesome. It's just destroys the lungs. Let me just say that. And it can also, one of the most amazing things about it, though, that's just horrific, is the thrombosis. We had cases of COVID where we've examined those, and it's just, I've done a lot of autopsies. I've been doing this for 25 years more. If you count residency, did a lot there too. The amount of changes of the blood, even post-mortem, is quite unprecedented. So I think that that just goes along with us trying to understand. The problem is people, this isn't the flu. It isn't anything we know. We don't quite understand what it does, but we're just, I think, coming to terms that it's a multi-organ illness, particularly when you have a long-term case of it. And when a case gets so severe where the person dies, you can find lungs that don't look or feel like lungs anymore, and you wonder how they're even moving air. Probably they're going to have to do very, very heroic measures where you're actually oxygenating their lung with an ECMO machine, because the lungs don't look like lungs anymore. So it's just not pretty. I think that we're going to start. What I'm dreading, though, is not the ones where they're in the hospital and we know what they have. I'm looking for the folks that die where we didn't even know they had COVID. And, those are the ones I'm worried about and trying not to miss.
Okay. Thank you very much. That's all for me for right now. Thank you.
Okay.
Chair.
Thank you. Jewel, maybe you, David, Commissioner Eggers.
Go ahead and unmute Commissioner Eggers.
Unmute yourself.
Okay, well, I'm just trying to get a flow of our discussion here. I'm not trying to jump the gun here or anything, but just hearing some of the doctors from this morning, which were really from yesterday's, the doctors that spoke at the Hillsborough County Commission, listening to our doctors this morning and also again this afternoon, and seeing the trends and the numbers. And so what I'm hearing about, there's a couple things. Why are we here? Why are we talking about this? Is because the numbers are exponentially going through the roof. Okay. It doesn't matter what the level of, I mean, if it was 1 or 2, it'd be different, but we're talking about thousands that have happened. So it's grabbed everybody's attention. We're trying to understand from the doctors all of the things that we can understand about this disease, to educate, share that information with us and with our residents. So when people say that, we're fear mongering, I think we're just trying to understand it. We're trying to share that with you, because it would be really, I think, reckless of us to know this information and not share it, not to try to inform and educate. I mean, this is all, we're all in this together trying to figure out about this disease. And, you know, Dr. Jameson said a couple of weeks ago, we know, the more we know, the less we really know. I mean, it's unfolding by the day. I heard the epidemiologist this morning talk about we have gone down the learning curve hugely fast, but there's volumes and volumes of reports that are coming out every couple of weeks and 3 weeks about this. So they're learning more and more on the fly. And we're just here trying to make sure that we stem the tide to keep free those hospitals. And I think that's something Dr. Jameson just mentioned a minute ago. What the whole point about flattening the curve was making sure that we didn't overrun our hospitals. Not only our hospitals, those physical things, but our doctors and nurses who we've driven by there and we've waved at them and said, thank you, you're our heroes, but we're exhausting them. So again, I know that they're starting to ramp up too. So I just that, and to hear that the doctor this morning talk about his experience, he just mentioned, oh yeah, I had COVID toes. And I'm like, what the heck's COVID toes? And he talked about clotting in his feet from this thing and just not figuring out like how to deal. He's a healthy person that runs all the time. And this is what's happened. He used to have 100/60 blood pressure all the time. He's now running at 130/80 or 130/90. His blood pressure had systemically changed. So we're still learning about this and we're scared about it. And you know, again, for our responsibility, it is about public safety and it is about public health. That's why we're here talking about this. And so I just think that there's an obligation for us on many levels to be looking at this. And I just had a couple of questions. I didn't see anything in here, and I probably overlooked it because there was like 3 different versions, and I was going back and forth. Are we limiting these bars and nightclubs to 50, or are we limiting it to capacity percentage numbers? Or there was some discussion about limiting it to the number of 50. And I was also looking at the violation numbers. We said we were going to have a violation penalty, and I'm looking at $100. I mean, I thought we were talking about higher numbers than that. So just wanted to get your thoughts on that as well, to grab their attention. I don't know that $100, I'd take the fine and keep moving if they're not going to do the right thing. So I just wanted to understand that part as well. And then are we reserving the right, if things don't work along that line, to take the other path of, you know, if you can't follow the rules on a steady basis, then we can come at you from a criminal standpoint? Or are we taking the criminal aspect off the table completely? Those are 2 or 3 questions. If Barry, if you can maybe address those.
Sure. So the first piece, you know, we did have, and when we discussed it last Thursday, kind of put a 50-person cap on a facility. Very, very difficult. We were going to have 50 or 50% if it's a bar. Restaurants is 75% per the state order and phase reopening. Bars are 50%. One of the problems is size, you know, and what's appropriate. The way we address that same issue is that you're not going to get service unless you're in a seat. And so we design this around discouraging and eliminating the dance floors and the where you can have mass congregation. Frankly, you know, I shared pictures with the media, and I'll point out the postcard in. You know, they weren't out on a dance floor. They were just 100 people congregating around a bar. Well, you know, you can't do that, and so you can't have service from there. And so we addressed it by the way in which we control the service. It's easier from an enforcement standpoint, and it's easier to manage. So that was a change from when we originally discussed that. We
Barry,
did make. Go ahead.
Barry, on that point, I had a couple of bar owners, or I should say nightclub owners, contact me, and they said that they're doing it. They're doing it kind of on their own by having somebody count. Now maybe they're a little bit larger, so they can afford that person.
Right.
Where they sit out front with a counter and they say, when you hit 50 at the nightclub or at the bar, we just stop it. Or in their case, I think in one of the cases they had a 70 number because that was 50% of their capacity, but they just stop it. I mean,
and they still have that capacity requirement under state law, and that's what I was reading for, that the governor, you know, just said that he's going to enforce that. So if you're not enforcing it, you're putting your liquor license on the line. Okay. And that's reality. We need voluntary compliance. We were trying to find a way, and there was just so, I go back when we were trying to write this, and Sheriff, we remember these days earlier when we were trying to figure out how, different businesses are classified and the different situations that we're going to run into. And we have beach bars, and we have bars that have partial outside, partial inside, and there's just a whole variety. And so we were trying to make it a little bit easier. But what we said is you have to maintain social distancing. No food or drink can be served to patrons or inside that are not seated at a table or at a bar. Standing at a bar is prohibited. Tables have to be 6 feet apart. So we were trying to go at those things that they can implement and that we can hold them accountable for. Social distancing in groups larger than 10, that all of whom have to be companions. So if you're waiting, so those types of things where we can try to get at that. If we wanted to go back and put in 50, we could do that. We just thought these other measures address that, and that's the reason we made that change.
Well, Barry, on that front, with the state coming in with the threat of their liquor license, if we go to an establishment and you give them 3 successive fines of 100, 150, or 200, that becomes kind of a like we report that to the state for somebody who continuing to violate what the state is asking too. So again, all we're doing is asking people to comply with the rules that are in place, and so that not only can they continue to have a business, because obviously folks in the age groups that are going there perhaps are having some problems themselves. They have to kind of be the enforcer. So I just, if I think the combination, maybe we've got that covered without doing the 50 and the percent number, even though the percent number gives us some guidance. Let me see what else. Let's see, Barry. I want to make sure I got my other question.
We left it as a civil rather than a criminal because that was what we discussed last week.
Okay, that's fine.
We can always refer to the state. We can always defer to the state and their liquor license. But let's make real clear: Sheriff's on the line. Sheriff can address this. It's not business as usual. This has to stop, and we need them to comply. And if they don't comply, then we'll ramp it up because we do have. So this has civil fines, but they also have the liquor license on the line. We need compliance. We need to stop the large crowds. We want them to be open. We want people to be able to get out, enjoy, and have a good time, but they need to do it responsibly.
And what we've included in here is a range of penalties. So when you all met last week, the clear direction that you gave is that it was your preference that this not be a criminal violation. So we've actually brought this to you in the form of an ordinance rather than the resolutions that you've adopted in the past, so that we could make this an ordinance violation as a penalty. And those are civil. Those are considered civil infractions. And what we did is we directed that the first offense be 100, then 250, then 500. And there's some reasons why we did that. If we did not dictate the penalty that we wanted in here, we would have defaulted to the 6th Judicial Circuit's administrative order that provides for penalties, and those would not be commensurate with what we provided for here. We have also included in each of the 3 ordinances that you have today as options, the option for law enforcement to continue pursuing this as a criminal offense if they so desire. A third remedy that we have in here, which is always available to us, is injunctive relief. So that's really something that would be aimed more at a business establishment where we're finding repeated violations. We could come and ask you all for authority to file an injunction and essentially close down a business that's not complying with this ordinance. So you really have a range of options available through this that range from a simple request to a patron to put their mask on, followed by a citation with a monetary penalty if they don't comply, all the way up to a criminal sanction and the opportunity for injunctive relief.
Yeah, and then just one final question on the age. I think we said anybody under 2 does not have to wear. Is that? I'd just like to understand that a little better. I was thinking it was going to be something like under 5 or 6. So just trying to understand that, the thought process on that. Maybe that one of the doctors could speak to that. And then finally, for the sheriff, I know the sign that we put out when we first started this 3 months ago was a really impactful sign that really made a difference, and it helped support the businesses with the message that everybody was giving. Is there a role for a second sign to talk about what we're talking about now? And you can think about that fun activity, but just comments from the doctors on the age, the under 6
Commissioner,
versus
if I could start and then defer to the doctors. We selected age 2 because that is what's provided for in the CDC guidelines. We really wanted to base what was drafted in the ordinance upon something that was recommended as a legitimate age. You know, we're lawyers, so we're not really experts in that area. So certainly if you all wanted to entertain a different age, I would defer to the medical providers that we have here, because again, we would want to have some basis for making a determination of what age is appropriate. We selected 2 because that's provided for in the CDC guidelines.
Yeah, I think the 2-year, I just think they're young. They're young. And
Now, I just bring that to your attention because I think it strikes a pretty good balance and lets the parents decide, Commissioner Gerard, along the lines of what you're talking about with, especially the smaller kids. So I just bring that to your attention.
Commissioner Long?
Yes, and I would just like to point out that I believe we're not in a place just yet to vote on a particular one of these 3, but for any of you who have had children who are 2 and 3 and or have grandchildren that age, it's nearly impossible to make them, when they decide they don't want to wear a mask or, have a little hissy fit, there's nothing worse than the awful 2s and the terrible 3s. So again, common sense in here. Parents know what they can and cannot expect from their children. I've just received several texts from our citizens who have little ones like that, and they are articulating exactly what I'm sharing today. So just a word of caution and common sense. A healthy dose of both is probably very appropriate. Thank you, Madam Chair.
Thank you. Commissioner Justice?
Thank you, Madam Chair. It's kind of been said, and yeah, I was wondering about that age when I first read this, and just as an FYI, assuming they go ahead with their plans to open in July, Disney World is requiring the age 2 and above. How they're going to make that happen, I have no idea. But I actually like the language that you just read from the city's thing. I think this is not about eliminating all risk entirely. It's about reducing the risk as best possible. So it has to have that common sense in there.
Right. Yes, Commissioner Seal.
I would agree as far as the children. The other parts of the Section 3, the face covering requirements, do not apply to. We've got so many exceptions in that I'm a little concerned about that, because I know we're trying to ease into this, but for instance, persons strictly adhering to and maintaining social distancing. Another is persons exercising while maintaining social distancing. So gyms can go forth and multiply. And then the final one that I had concern about was which is patrons or customers in any indoor public place that have no contact with an employee of the business except as protected by a solid barrier with 6 feet. Well, how are you going to measure that? I don't think there's one place in a grocery store or any other place where they put a plastic barrier up that you could find yourself 6 feet away and doing proper social distancing. So I think we're going to hear more from the public, but we need to make this practical and full of common sense and easy to implement and understand. So just my comments at this point. I forgot, there's only one other thing. What about child care facilities?
Not cover the child care facilities. Of course, you all could give us direction to make the universal one exempt them if that was your desire. But the other 2 options would not cover child care facilities.
Yeah, I would not want to exempt the adults in child care facilities myself. All right, I think we're getting close. I'd like to actually have a motion before we start taking public comment.
And
Madam Chair, if I could maybe go over some of the process before we get to that.
Sure.
As I mentioned previously, this is brought to you as an ordinance. And the reason why we did that is based on your discussion last week and your preference, your stated preference, that there be civil penalties associated with any sort of violation rather than a criminal penalty. And the other orders that you've previously passed, such as your Safer at Home ordinance, those violations, they're violations under the emergency management statutes that give you the authority to do this in the first place. And the penalty provided there is a criminal one. So we specifically brought this back to you as an ordinance for that very reason, so that it could be a civil penalty. That being the case, this has not gone through your normal notice procedure because of the emergency nature of the topic. So in order for you all to enact this ordinance today, should it be your desire, you need to comply with the emergency provisions set forth in Chapter 125. And what that states is that you must first vote to waive the otherwise applicable notice provisions of 125, and that must be by 4/5 vote, which for your purposes is 6 out of the 7 of you. So what my recommendation to you all would be is that you do need to take that vote to waive notice, and then of course you would need to vote on whatever ordinance you may choose to adopt today. Madam Chair, my recommendation to you is that you open up public comment on both of those topics at once, and then come back and decide what you want to do, and then go through the procedural requirement of waiving notice and then adopting the ordinance. But my suggestion to you is that you take notice on both of those topics through a single opportunity for comment.
If I could add one small little thing to that, that the board needs to find that an emergency exists and the immediate enactment of the ordinance is necessary. I know that's a technicality. I just want to make sure we get that on the record. So thank you for humoring me.
Okay. So do you suggest that we wait for a motion until after we take public comment?
I would suggest under the circumstances that it might be wise to go ahead and take public comment, because you have 3 options in front of you.
Right.
And the comment may inform your decision as to which of those 3 you proceed with.
Okay.
If at all.
Okay. Commissioner Peters.
Thank you, Madam Chair. So I have a series of questions, and I'm going to ask you to indulge me to finish my series, if that's okay. And most of these are for Dr. Cho. You said there's 129 deaths. Could you tell me the age brackets, or, you know, give me an idea of what the ages of the deaths are?
I can certainly get you the breakdown. I don't have that in front of me. I believe the median or the average age is about 80, 81.
The median or average is 88 or 1. I think you said in a phone call that 77 or more than that were over the age of 70 or 80. I think you told me. I'm not sure if that's true.
At a statewide, in terms of the death, looking at that and the ages, about 85% of the death occurred in those above the age of 65.
Okay, I was curious about Pinellas County, but thank you. And then you said that there's a 2 to 3 week lag. And so we see this increase for the last week. Is that coinciding with the mass demonstrations that have been going on, do you think?
We have not conclusively connected that with any of the mass demonstrations at this time.
Okay, so I asked that because I know 3 young people that have been tested positive, and all 3 of them were at the demonstrations. And so if there's a 2 to 3 week lag, we started to see the rise on June 15th would be about 14 to 15 days after, with that high peak on the 20th, which would be that 3rd week jump. And then we've had 2 days where it's dropped to, you know, a 7%. I'm looking at the wrong, now I just realized I'm looking at the wrong county. But we had 2 days in a row where it's dropped to 7 and 9% versus the 2 days of 14%. I also noticed that, you know, the testing is different, and that way we get data dumps, and I understand that every day can be very different. I get that. But I was curious your thought on that lag time. And since we haven't had large protests since then, I don't know if we still see the same. And I understand that we're worried about young people giving that to other people. But I was just curious about your opinion on that. And then I also want to know which hospitals are diverting patients, because I understand there's several hospitals in the county that are diverting patients and sending them someplace else, and I want that information.
So the majority of about 30 something percent are been close contacts. So a little bit, I know there's been some comments in terms of the contact tracing aspect of it. And then just to give a little background, contact tracing is something we've done for any communicable disease. Even besides COVID, it's been around since the beginning of really public health has come around. What we've done with these types of efforts, we ramped up with, ordinarily we have 6 epidemiology investigators. We ramped up in terms of staffing to 39 for part-time doing investigations, another 17 doing contact monitoring. The state has been providing a lot of additional resources in terms of OPS staff. They've also contracted, I believe, with one organization's vendor that can assist with some of those contact tracing efforts. What we're seeing in terms of, because it is a respiratory virus and it does spread readily, is that, hold on, real quick, I think there was a comment, it is mandatory for hospitals and labs to report it to the health department, so we do get it. Get that information. I think one of the callers mentioned that. So what we're seeing in terms of those types of investigations is that one case generates 5 to 6 other contacts that are high risk. So we do monitor, touch base with them, give them the appropriate instructions. However, I think I mentioned on the call last week, but if you think about it, if you have these exponential growth in cases, that the contact tracing will become more limited. Just looking at the curve, because if you think about the cases and it's generating 5 to 6 high risk and close contacts, it's going to be limited.
Thank you, Doctor. I think that was helpful, and it's good to hear you say that publicly. Do you know which hospitals are now diverting patients because they're full? Could you tell us?
I'll divert to Dr. Jameson. Do you know that?
Sure, I can try to answer that. So the EMS system on a daily basis tracks multiple specialty capabilities at our hospitals, and we try to arrange for the most appropriate destination for an individual patient. Examples of some of those categories would be STEMI or heart attack, stroke, neonatal, obstetrics or OB services, trauma. So we track the hospital's capabilities when it comes to each one of those things routinely. And when a hospital, for whatever reason, is not capable of giving the best care to one of those categories of patients, they'll let us know, and we'll try to steer that patient to a place that can give them that top level care.
Okay.
Because our hospitals began to have significant increases in volume over the last week or so, there was a request from the hospitals to begin tracking their capability to take known confirmed COVID patients, particularly for interfacility transports as opposed to the 911 side of the house. And that went into effect over the weekend. So we have been trying to distribute the transfers from, for example, long-term care facilities into the hospitals as best we can to match up with the hospital's capabilities.
Okay, I don't think you answered my question, but I think that's okay. So, I mean, I've talked to hospital CEOs as early as today, and some hospitals are not that full. They are seeing a spike, but they're not that full. What the hospitals are seeing is a high number of deaths because people didn't go to the hospital. So a much higher death rate of people who died at home who possibly could have been saved because they're too afraid to go to a hospital because they had a heart attack or a stroke or something like that. And I think it's very important that at some point we make a public issue about letting people know that hospitals really are a safe place for people to go if they do have a heart attack. But my next 2 questions would be either for you, either one of you. So, you know, I talked about the OSHA guidelines. I understand people on social media said I pointed out fake news when I read directly from the OSHA website. But I've looked at the CDC, the OSHA, and the World Health Organization, and all 3 of them say, don't get me wrong, they all say that we should say masks. We all should, and I'm not saying we shouldn't be wearing masks. I have issues about people with the misperception of the mask, and I also have an issue with the safety. So every single one of those websites say that wet masks are dangerous. So if you wear a cloth mask and it gets wet from the perspiration while you're wearing it or from sweat, that it could build up mold and it could build up impurities that can harm the person wearing it. Do either one of you agree with that?
So I would agree that a wet mask is less effective and maybe more uncomfortable to wear. As far as building up mold and being potentially harmful, my understanding is that relates more to storing the mask and reusing it if the mask is not allowed to dry while it's stored.
So wearing it for 8 hour and 8 hour shifts, you don't think could be a danger to the wearer?
I wore my mask for 13 hours straight on Saturday and I was okay.
Okay,
And I know
so
lots of
I
us
was
are.
just,
So I know it can be very uncomfortable. I really do. But I'm not aware of any actual adverse health effects.
so I just want to get this out because people are going to argue this. So that's the reason why I'm asking your point. And then I sent a picture to Brian. Brian, can you bring up that picture?
Yes, ma'am.
So I guess you have to wait till that black thing goes away, but that's a warning. And on that warning of that mask, it says that that mask will not prevent COVID. And there's plenty of other things that say a mask with the ear loops will not prevent a disease from coming in because it's not fit. So when people call in and say, you're telling me I have to wear this, but it says on the box that it will not prevent this disease, I need to hear your comments about the warning on the box.
So a procedure mask, which is what we generally refer to the ones with the elastic ear loops, in and of itself will not prevent COVID if I am caring for a patient with active COVID and performing medical procedures on them. I do believe, and I believe there's a preponderance of evidence in the literature, that that same type of mask can be effective at reducing your chances of spreading COVID in the community.
Okay, thank you.
Just to echo Dr. Jameson's point, studies have shown the more in the community that wears the mask, the more effective it is, both the spreading and obtaining getting COVID. And I can tell you just from experiences in other parts of the world that it's something that's done, it's culturally done, and they have seen lower cases of COVID, if you point out countries like Japan and South Korea.
Okay, and my last question, and thank you for indulging me, Madam Chair, is Jewel, you said if you have respiratory problems or anything like that, are we going to require any citizen in Pinellas County to provide a doctor's note?
The way the ordinance is currently written is that for folks who, we say in here that it doesn't apply to people who have trouble breathing, unconscious, incapacitated, etc. We also say if following the requirements would be detrimental to health, safety, or security, it's an exception, and that they are not required to carry or produce documentation verifying the health condition.
So a doctor's note is not required if somebody has asthma or something like that?
That's correct.
And they don't have to be actively wheezing or something else?
It says they don't have to apply it, but it would be detrimental to health, safety, or security.
I just wanted to, I want to confirm that. So thank you very much. I appreciate it.
Thank you. Commissioner Justice.
Thank you, Madam Chair. I had a question. Was it the, Madam Attorney, was it your thought that we should take public comment before we decide if we're going to waive the emergency rule? Or should we not do that waiver first for, if there's some reason that we're not waiving that rule, that makes everything else moot, doesn't it?
It would. I will remind you that you need to take public comment on everything you vote on. So if you choose to take public comment, you're going to have to take public comment first on whether you waive. And then secondly, on the ordinance that you adopt. I do believe that there is, to a large extent, value to having public commentary before you take either action, because I do believe they are very, very much related.
And I would prefer to just take public comment once on both those issues. So are we ready to do that? Oh, I'm sorry. Commissioner Eggers, did you have your, yeah.
Yeah,
No, you're good.
See, I checked to see if my speaker's on, and it's on this time. So, oh well, I'll figure it out at some point. Just a couple things, just to follow up. I just want to make sure there was a comment, and I think Commissioner Peters talked about protests and that kind of thing and what those effects are. I remember when we did phase 1 back in May, we said it would probably be about 3 weeks to 4 weeks before we started seeing the effects of that action. it seems to me that we did phase 2. Gosh, I can't even remember. I thought it was in June, but maybe it wasn't. So that a 3 to 4 week period would be about where we are this past week for phase 2. And I'm sure that the protest piece is an element, but I'm thinking that phase 2 would be as well. So that, just a comment about that. And then when I made the comment earlier about the fine level, I was really thinking that the ordinance is addressing just the operator or owner of the establishment. It's also keeping it open to patrons who can be fined. So again, I think if I'd read that more closely like I should have, I would recognize that that fine level of $100, I think, is more in line and more reasonable for that. And then obviously you have other elements for the owner. And so to me, I think that's important that you have that ability to do both, but you're probably going to have some effort from the state on that level for the businesses as well. So, but anyway, just to comment on that 3 to 4 week period, maybe the doctors can comment on that, but I would think that phase 2 would be in these increased numbers as well.
Dr. Chair, you want to comment on that, because I think that is a comment you said earlier on our policy call, that what we're seeing are the results of phase 1. We're not even to the results of phase 2 yet, or just beginning to see the results of that.
Okay, thank you.
I think it's something that we've spoke about here and on the EPG calls as well, that it does take 3 to 4 weeks to see full effects of that, and keeping in mind that if there is something adopted here in terms of the ordinance, we may not necessarily see the effects, the benefits of that for the next 2 to 3 weeks as well. But with it, and I don't have the date of when the phase 2 started. I think it was beginning of June. We are just hitting those points, so it does coincide potentially with that reopening, just people crowding different types of establishments. So I hopefully that answered your question.
Well, I mean, I didn't see that. We didn't see that spike after the phase 1 opening, or the phase 1 part of it. And it seemed like going into the phase 2, where the capacity numbers were up, was a significant change. And again, I'm thinking that was about 3 or 4 weeks ago, but again.
And that really went to some of the bars that are open and things like that. And I think, we also saw a lag in even people opening. They had to get workers back, they had to order. So, you're seeing kind of a lag on the reopening of the whole economy. But in particular, I think we see a lot of less social distancing by its very nature in bars, beach bars, clubs, and things like that. And that's not to pick on them, but it's other parts where people have just begun to become immune to this and are a lot more, are taking a lot more risk and not practicing social distancing and organizing in large groups. So I think it's a combination, but certainly the actions that we took and we have put in within your ordinances designed to really try to disperse and not allow that congregation of large crowds.
Thank you.
Okay. Let's go ahead and start taking public comment. Brian, I noticed that we have over 150 people on the
Yes, ma'am.
that have signed in right now. I'd like to limit the comments to 2 minutes.
Okay. So at this time, if there are any members of the public that wish to comment on the proposed process modification and the ordinance, do I have that correct, Jewel?
Yes, that is correct.
Okay, please hit *9 if you're coming in on the telephone, or raise your hand virtually in the Zoom meeting. And Madam Chair, we have 26 members of the public that wish to speak on this item. So I will start with the first one. We have Dawn. Dawn, if you'll go ahead and give us your first, last name, address, and you'll have 2 minutes to address the board.
Yes, thank you. Dawn Bowler, D-A-W-N. Last name is B as in boy, O-H-L-E-R. Address is 6678 54th Avenue North, St. Petersburg, 33709. First, I want to say to Commissioner Peters, thank you. You nailed one of my questions with your question as far as the involvement of the protesting to the increased numbers. As far as the fines for going in without a mask, we are protected under the 8th Amendment, which states Excessive bail shall not be required, nor excessive fines imposed, nor cruel and unusual punishment inflicted. The 14th Amendment protects us. No state shall make or enforce any law which shall abridge the privileges or immunities of citizens of the United States. Again, as I said earlier, accumulatively, the site is showing that Pinellas County only has 3,438 cases. Accumulative. Doesn't say how many are cured, doesn't say how many are in existence. Another point I'd like to make, as far as going back to the protest, we have Mayor Kreisman, who openly invited people to the streets of St. Petersburg to come out and protest. And now in St. Petersburg, he's got this executive order mandating everybody wears masks. I don't believe I heard any of the commissioners call out against the protesting, which really didn't help. So I'm very curious as to those numbers. And then I'm kind of curious too, as far as the patient's bill of rights, how it works if you guys have these doctors that are not physicians over everybody helping make these mandates. It essentially puts us as a patient under these advising doctors. Sorry about that, I'm outside. And according to the patient's bill of rights, if we have the right to refuse such treatment, and you're using a mask as a treatment for COVID, which I don't even know if it's COVID anymore because all the reports are saying coronavirus. So the narrative keeps changing. The whole goal in the beginning was to prepare the hospitals to not stop this. You cannot play God and stop a virus. It's impossible.
Ma'am, your time has
It's
expired.
absolutely impossible. Okay, thank you.
Thank you.
Madam Chair, our next speaker is Jeremy Dolan. Mr. Dolan, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hey, good afternoon. My name's Jeremy Dolan, Jeremydolan. And I live at 6150 Gulfport Boulevard South. I saw you poke your head up, Miss Seal. Yeah, your son, Scott, actually showed me around Elon when I first got there many years ago. So, and my dad's Vincent Dolan, formerly with Duke Energy. I actually own a business up in Largo. And one thing that's not very clear to business owners is the processes in which employees are potentially, I've heard this from many business owners, the process of which employees are possibly interacting with somebody who is COVID positive, and the steps that business owners need to take legally and like ordinance wise on what they're supposed to do. So some clarification on that to the public and to business owners would be super helpful. Another point I wanted to make is I've been to the protests in downtown St. Pete, and I would say 99.8% of the people are wearing masks. And if you look at any of the pictures from those protests, I think that will back that up. But I think that my position would be to, as a business owner, would be to require employees and all customers to wear masks at all times, with few exceptions. I think that, you know, the sooner that we tackle this, and I know there'll be some temporary pain for everybody, and but the sooner that we tackle this, the sooner we can get back to normal. And I think, you know, whether it's 6 months, a year, you know, to eradicate this, I think that we need to take the necessary steps in just doing as much as we can. And another thing I just wanted to appreciate about up until the end, the bipartisan cooperation, I think, is something that you guys should highlight for your press releases, that all of you guys are, I don't know how the dividing line goes, but everyone seems to be working together here and on the same page. And I really do appreciate that about the Pinellas County government.
Thank you, Mr. Dolan.
Thank you.
Madam Chair, our next speaker is Len. I do not have a last name. So Len, if you'll give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Hi, my name is Len Kister, Lenkischter. I'm at 4865 Harbor Woods Drive in Palm Harbor. I agree with the previous speaker. Thank you all for the way you're handling this, the open conversation, the direction that this seems to be going in, to at least do something. I just turned 60. I do have an underlying health condition. When I go into, and I haven't been going out much, the liquor store the Publix and doctor's appointments when I need to. When I go into Publix and I see people not wearing masks, it makes me very angry. It's disrespectful. It's not helpful. When I hear, well, I'll backtrack quickly. We have a president in this country that's made this a divisive issue, the mask wearing. We have a governor that acts as his lapdog. You people obviously are not acting that way, either side of the fence. Thank you. As my father said, and he was an ex-New York police officer, very conservative, takes all kinds to make up a world. Someone wants to yell and scream about their individual freedoms, et cetera, go sue Congress over the Patriot Act. You can't yell fire in a theater. This is not a matter of politics. This is not a matter of personal freedoms. This is a matter of public health and safety. It's real. We need to listen to the doctors and the scientists. That's all I have to say, except I'll finish with Commissioner Welch, the sign you have behind you. Much respect. Thank you.
Thank you.
Okay, Madam Chair, for the record, we have 38 remaining speakers. We'll go to the next one. Well Life Global. I can't remember what the name was, so if you give us your name for the record again, you'll have 2 minutes to address the board.
Hey guys, thanks a lot. This is Yvette Gaw, 9371 Blind Pass Road, St. Pete Beach. First off, just addressing mask wearing and how it is unhealthy for us. And so I've got a couple of articles. One's from that Lancet, which Dr. Cho addressed, and from the USA. It's interesting how they flip-flop on this, but wearing a face mask is not recommended for people who are healthy. UK said, but there is a very little evidence of widespread benefit for members of the public. Germany also had a comment on that. I have something right here from I have several articles, but from the New England Journal of Medicine, we know wearing a mask outside healthcare facility offers little, if any, protection from infection. And then mask wearing induces hypoxic injury as it restricts airflow. So if the doctors could address that, and I've got other things as well. But my other comment is that I'm very disappointed in our medical community for not addressing how individuals on how to prepare themselves to not get sick. How about building the immune system, exercise, eat healthy, don't drink alcohol, don't go out and eat processed foods. I mean, we're not addressing the core issue and getting to the root of the problem. We have a lot of people with weak immune systems. So for those of us who take care of ourselves, look at, per Dr. Cho, who is the average person getting this disease? Over the age of 75? So now we're going to mask our young people and create hypoxic injury. You breathe in your own CO2. Reduce your oxygen by up to 60%. And the doctors know if you put on a pulse ox on them, and it's been tested with a mask and without a mask, it lowers their oxygen level. And I know someone who went to the hospital because of that. And when your cortisol goes up, you increase your cortisol level, which is your stress hormone. And when it goes up, you suppress your immune system. And when you're stressed out, you need more oxygen. So wearing masks has never been established scientifically to prevent disease.
Ma'am, your time has expired. I'm sorry.
Thank you.
Thank you.
Madam Chair, we have 39 remaining speakers. Our next speaker is Dave Waddell. Dave, if you'll go ahead and, actually, I think we already have your name and address for the record, so you can go ahead and speak for 2 minutes.
Thank you for this opportunity. I'm disappointed, and don't take this personally, Commissioner, Chair Pat Gerard. Such an important issue. We just got bumped from 3 minutes to 2 minutes. 2 items were combined. And so therefore 6 minutes were lost. What I have to say, and I'm going to tell you right now, folks, I'd like to know, and everybody raise your hand if you've gotten the document that I sent on COVID-19. Please raise your hands. Please raise your hands.
Mr. Waddell, we've gotten 800 emails in the last
I'm
few
asking
days.
you if you've read it. I've given you a real time, and on Thursday of last week, I heard everybody wanted to clarify. Well, I'm going to clarify for you. I have a real-time event of my exposure that I sent you, and only one person up there raised their hand. All right? I understand. It's a proactive, reactive situation we've never dealt with. Sheriff, please don't go anywhere because I've got something to say to you too. All right. We've got a really big problem here. Enforcement's going to be a critical part of that. We are going to have to wear masks. There's no way out of this. I am scared. All right. I've communicated with a commissioner and we have a really big problem. Sheriff, if you can enlist the ATF regarding any violations regarding their licensing and not following these guidelines, and that's the problem, their guidelines. What we have is liability issues here. You are making decisions about lives today, okay? And what do we do if somebody has hepatitis, right? Well, we shut the restaurant down. We do contact tracing. I'm
Mr. Waddell.
asking you now, we want contact tracing and give it to us. And please don't cut me off because
Your
I
time
need
has
this
expired,
extra
sir.
minute. I want to know what these doctors respond to me about contact tracing. Tell me what the plan is.
Mr. Waddell, please.
Madam Chair, our next speaker is Megan Chapman. Ms. Chapman, if you'll go ahead and unmute, give us your first, last name, spelling, address. You'll have 2 minutes to address the board.
My name's Megan Chapman, M-A-E-G-A-N, last name C-H-A-P as in Paul, M-A-N, and I'm in Clearwater, Florida. I'd first like to say thank you to Kathleen Peters, who seems to be the only one with any kind of common sense on your board. I honestly don't know how the rest of you got these positions. This is absolutely ridiculous that this is conversation being had. At some point, somebody with a brain has to come in here and recognize that this is a virus that's not going away. The whole point of this was to not tax our hospitals. We did that. For you guys to come in here and to put these mandates on people, and it's unconstitutional. You simply cannot force people to put masks, lessen the crowds. I mean, and the fact that you can't even address in a intelligent way the fact that the riots possibly had a huge impact on this and dismiss it because they were all wearing masks, where Kathleen Peters actually brought to your attention on the side of the box that they don't even prevent virus spreading. I mean, there's been enough studies that show that wearing masks is absolutely futile. So you're putting a Band-Aid on it. Let people get out, let people get exposed, let this thing run its course and get back to normal life. You're doing no good by doing this. I'm a mother of a 9 and 6-year-old. And if you think that I'm going to have them go in public and wear masks, you are crazy. That is putting fear into our children. That is making them live a life that is completely uncomfortable and filled with fear that is completely unnecessary. And I'm not going to do it. You say under the age of 2. No, I'm sorry. My 9 and 6-year-old will not do that. They will be out in public. And if you want to try and stop us and fine us, go right ahead. But you guys are asking for anarchy over and over again. You are pushing people to a brink of breaking down. In addition to that, you guys realize that Pinellas County, majority of our money comes from tourism. Nobody in their right mind is going to come to our county and spend tourism dollars if they're being required to wear masks everywhere. People are already putting on social media, they're not going to come. They're going to cancel their reservations. Why are you killing our economy where we live for masks that don't do any good? Stop trying to be God.
Ms. Chapman, your time has expired.
I'll go with the previous caller and bring in special forces.
Madam Chair, our next speaker is on the phone line. It's last 4 digits 2317. If you can go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Thank you, Commissioners. My name is Vanessa, V-A-N-E-S-S-A, and Alabarces, A-L-A-B-A-R-C-E-S. My address is 8541 West Gulf Boulevard, 33706. I want to thank you all for your time today. I want to echo some of the comments of other callers. Thank you so much to my Commissioner, Kathleen Peters, for being a voice of reason on this issue. I want to note cases are up, hospitalizations are not dramatically up, deaths are definitely not up. So I think there's a major conflation pushed a lot by the media, but it's causing a lot of panic for people. So just because positive cases are up, does not mean deaths are up. Are you going to regulate the storage of the masks? As people have brought up, those could be problematic, the way that someone stores it. You see a lot of them hanging from your mirrors. Are you going to regulate the cleaning, how to wear them properly? Where does the nanny state and personal responsibility and the responsibility to assess risk for ourselves come in? Will you stop? I'm saying you will not stop this virus. As someone else said, we're not God. We can minimize risk, but we cannot stop it.
From the beginning, we were told it is to flatten the curve so hospitals are not overwhelmed. We did that successfully. Thank you very much for everything you've done so far. We're not at the stage where the hospitals are being overwhelmed. Even with this current spike in cases, positive cases, we're not at a place where hospitals are being overwhelmed. I understand this is an emotional issue for a lot of people. It does feel like life or death, even though 99% of the people, over 99% of the people, are not going to die even if they get this. I know that there's a call to do something, and I know this feels like y'all are doing something, and people like one of the previous callers are begging for you to do something, but this is nothing, really. It's an infringement on rights in the name of feeling safe. And I understand the fear of people, but their fear cannot dictate my life or the lives of others. Public health does not override the Constitution. There's no clause that negates our rights in the Constitution. If we get sick, these rights don't apply. Please let us citizens assess the risk and act accordingly. We do it every single day when we get in the car, which is a very dangerous activity.
Ma'am, your time has expired.
Thank you, sir.
Thank you.
Madam Chair, our next speaker is Bonnie DiMartino. Bonnie, if you can go ahead and give us your spelling, address, and you'll have 3 minutes to address the board.
Thank you. My name is Bonnie DiMartino, BONNIE-DIMARTINO, and I'm from Clearwater. I first would like to acknowledge Commissioner Peters because of the good points that she made. Thank you very much. And I'm not going to talk about my rights. What I'm going to give you is some common sense and some logic, and I just want you to evaluate this. So many times you guys all said, it's what you don't know. You don't know this, you don't know that. And that's my point. What we do know, we already know that the masks will not protect us from the virus. The last study they did on masks was in 1953, and they studied rubber gas masks. And even then, they were found to be ineffective against viruses. So let's not pretend that any of these masks, whether wet, dry, cloth, whatever, are going to protect us. They're not. But here's what we do know. One, the masks create less oxygen for the body. The mask will cause dehydration for the body. Those two things alone are not beneficial to someone's health. Two, experts have shown that the effects of mask wearing will impair the immune system, and it also creates fear, depression. Those are definitely detrimental to the immune system as well. So if everybody would stop watching, the mainstream media and start forwarding hope and watch the numbers go down. If you keep up this, oppression, you'll watch the numbers go up. So your actions will expose your intentions. Basically, that's the thing. But when this information is made widespread to the public.
Ma'am, your time has expired.
Thank you.
Thank you.
Madam Chair, our next speaker is Patricia Cox. Patricia, if you'll go ahead and unmute, and you'll have 2 minutes to address the board.
Thank you. My name is Patricia Cox. It's Patriciacox. I'm from Largo, and I appreciate Commissioner Peters. You brought up some really wonderful points, and I'm glad you brought those forward because they're important. I am concerned and horrified that we're discussing taking away our constitutional rights, and by doing that, using either civil or criminal ways of doing so. We've already had a number of businesses go under because of this sort of thing. I remember reading about a barber who was arrested and was charged with a criminal infraction of the law, and then in the same week I read about criminals being let out of jail because of COVID-19. I mean, we're arresting barbers and we're letting out other criminals who've been convicted. It doesn't make any sense. This is the same mindset. You're talking about taking away people's livelihood. You're talking about taking away their freedoms. You're talking about hurting them for just being human beings. It doesn't make any sense to me. It's a horrifying step. Why are we doing this? It makes no sense. It's not going to stop the virus. It will not stop the virus. No matter how much you want to hurt people, it's not going to stop the virus. all you're going to do is be hurting people over the long haul. We've got people, higher numbers than ever, people committing suicide over this. We've got higher numbers than ever of people not going to the hospital when they need to go to the hospital. If they have heart disease or other diseases, they're not getting their medical care. When I needed to see my doctor back in, I think it was February, I couldn't go see my doctor because she was so afraid to see patients that she called me on the phone, and I got absolutely nowhere. So this has been a long-term now scare tactic that is just going.
Ms. Cox, your time has expired.
Thank you very much. I appreciate the time.
Thank you.
Madam Chair, our next speaker is Christine. I do not have a last name, so Christine, if you'll give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. You'll have to unmute. Christine, can you go ahead and unmute yourself? We might be having technical difficulty with this speaker, Madam Chair. We'll go to the next one. We'll go to Karen Nasello. Karen, if you'll go ahead and give us your spelling of your name, your address, and you'll have 2 minutes to address the board. Karen? Hello? Madam Chair, we might have technical difficulty with that one as well. We'll go to the next speaker. Last 4 digits, 0473. If you can give us your first name, last name, spelling, address, and please turn down your TV or your broadcast in the background.
Can you hear my TV or broadcast in the background?
Yes, ma'am.
Okay. Okay. Is that better?
That's better.
Okay. My name is Heidi Olsen, HEIDIOLSEN, 2064 Hunters Glen Drive, Dunedin, Florida. I am calling. I'm a concerned mother of 2 children, both who have breathing difficulties and asthma issues, anxiety issues as well. Looking at the actual science of this, there is more issues with hypoxia and again, like wearing a mask for 8 hours a day. There was a gentleman who was speaking that said he wore his for 13 hours a day. That is not what surgeons do. When you look in the actual medical community, masks, gloves, all of it come off and on between each patient. If you go out into the community and you watch people, they are touching their mask, they're moving it down, they're touching garbage cans, touching all of the things you do, then touching their mask again to pull it back up. They're doing all of these things that are cross-contaminating. So we're expecting to put medical devices, medical treatments, these masks on the general public that does not even know how to use them. And going back to Sheriff, I want to thank you for using some common sense. Kathleen Peters, you as well. There's a couple others as well. You guys are looking at the reality that you cannot expect children to wear these. And I'm so glad it was brought up that parents of children 18 and under have the right to choose for their children. You cannot put these on little kids, especially in Florida. We're reaching the hottest months of this year. It's humid, it's hot, children cannot breathe. So I'm sorry, watch Disney, Busch Gardens, all of it. They're gonna have some major legal issues with this because you cannot force this on people. People have medical conditions. It needs to be a choice. All medical must be choice. You cannot do.
Your time has expired, ma'am.
Thank you.
Madam Chair, our next speaker is Teresa Pablo. Teresa, if you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
All right, the Pablo family calling from Dunedin, Florida. Welcome. I mean, thank you. I just wanted to say, I don't have to say much because if you guys listen to everyone calling you, the group of you leaders right now have a chance to be the heroes. Do not succumb to this false flag event. We know it's fake. Don't you see? We all know. So please do the right thing. Be the heroes. Get yourselves reelected right now. You can all get yourselves reelected right now by doing the right thing. If you continue with this, it's over for you all. This is not supposed to be a career job. You're public servants. Now serve the public correctly. Enough of this lie.
We don't want to wear masks. It's against
No
our
masks.
constitutional rights.
You know it's wrong. That's all I have to say. Be the heroes. Get yourselves reelected right now. You, Mayor.
Madam Chair, our next speaker is Sharon Calvert. Sharon, if you'll go ahead and unmute yourself and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, this is Sharon Calvert, and I live at 340 Pinellas Bayway South in Tierra Verde. This is according to the OSHA website. Cloth face coverings are not a substitute for social distancing measures. And these are the bandana type scarves, items made from cloth. They are not considered personal protective equipment. They will not protect the wearer against airborne transmissible infectious agents due to loose fit and lack of seal or inadequate filtration. Surgical masks. Surgical mask will not protect the wearer against airborne transmissible infectious agents due to loose fit and lack of seal or inadequate filtration. And those should be properly disposed of after use. Respirators, which are like the N95, those are supposed to be worn properly, and you should be certified on how you place them on their face to be able to actually do what it's supposed to do, which is purify the infectious agents. According to the US CDC, you are not supposed to be keep taking a face covering on and off. It must not hang around your neck or your forehead, and one must not touch your face covering unless you have washed your hands. Perhaps all this is why in 2009, during the swine flu pandemic, the US CDC did not recommend the use of face masks or respirators in non-healthcare settings, such as schools, workplaces, or public places, with some exceptions, of course. There's been disagreement about the value of wearing face masks, and some experts fear that masks give people a false sense of security where they do not, then they replace it with not use other standard precautions. They also said masks may benefit people in close contact with infected persons, but it was unknown whether they prevented the H1N1 flu infection.
Ms. Calvert, your time has expired, ma'am.
Thank you.
Madam Chair, our next speaker is Lucinda Johnson. Ms. Johnston, if you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Yes, my name is Lucinda Johnston, 348 11th Avenue Northeast in St. Petersburg, Florida. And I'm going to try not to take my entire 2 minutes. At the very beginning of this, I was so impressed at the bipartisan nature of this discussion. And I don't know what happened towards the end, but that I found that a little bit disturbing. But anyway, my husband is on day 102 of staying at home. He's been to 2 doctor's appointments. He hasn't had a haircut in almost 4 months. And so I'm not so much worried about him or myself because I wear a mask everywhere that I go. But I'm worried about other people our age. I'm 67, and I know a woman right now who's in St. Anthony's Hospital in intensive care with COVID-19 because she was not as blessed as I am, and she had to go to work. And I think that all of us should be doing everything possible. What if masks don't work? Maybe they do, so let's wear them. Let's do everything that we can to protect our fellow citizens. I just think it's so important, and I appreciate every one of you who believes in science. I love to hear from the doctors, the medical examiner who said it destroys lungs. It sent chills up my spine to think of my friend who's in intensive care right now. And I'm really, really hoping that you guys will implement the strictest rules possible right now. They are constitutional. We all know that, despite the constitutional scholars who've been calling in and saying that they're not. We know that public health has been upheld in the Supreme Court many times, and you guys have the right to do this for us, and I appreciate it if you will. Thank you very much.
Thank you.
Thank you, ma'am. Madam Chair, our next speaker is coming in on a Galaxy S10e. If you can go ahead and give us your first name, last name, spelling, address, and you'll have 2 minutes to address the board.
Hello, thank you very much for this opportunity to speak with you. My name is Amy Boretti, B-O-R-E-T-T-I. I live in Largo, Florida, at 249 Jasper Street. Thank you, Kathleen Peters, for being a voice of reason on this panel. I appreciate your statements. I'm a healthy 50-year-old And how do I know that I'm healthy? Because I take my health into my own hands. I see my doctor every 4 months for blood tests, which come back almost perfect. I do have underlying issues that I deal with. I drive for Uber Eats and Instacart. I have not once worn a mask. I will not wear a mask. I can't wear a mask. I've never had any opposition from restaurant owners, workers. In fact, many of them aren't wearing them in the kitchens, which, in my opinion, that's a separate issue, but they should be in the kitchen preparing food. But nobody's ever said anything to me. None of my customers have ever said anything to me. I've decided today that if this ordinance goes through and I have to wear a mask, I'm going to have to become unemployed because I can't wear one. I'm physically unable. My health would deteriorate. There's just so many layers to this. I know that masks do not work. I read the New England Journal of Medicine. I've read the CDC and their own admission that masks don't work. There's a 99% recovery rate if, in fact, you get this. I understand that people are sick and that people are dying, but not at the rate that some people believe. I read the research. I've been doing this not only because of Corona, but years previously because of a vaccine injury in my family. So this is a very important subject to me, and I thank you for your time. I hope that you consider the people calling in. We are the people, and we are saying no. Thank you.
Thank you.
Madam Chair, we have 40 speakers waiting in line, so just to give you a update on that. Our next speaker is Craig. I do not have a last name. Craig, if you'll give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. And you'll have to unmute, sir. Craig? Hello? Okay, Madam Chair, we're going to go to our next speaker, Aaron Bayard. Mr. Bayard, if you can go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, thanks everyone. My name is Aaron Bayard, Bravo Yankee Alpha Romeo Delta. I live in Palm Harbor, Florida. Been a resident here since I was 7 years old. I'm 55 now. I think we're pretty lucky at this point because we have a great body of evidence. A lot of data out there right now that a number of excellent researchers at universities have studied, and pretty much the evidence is conclusive. I think that the death rate of this COVID-19 is about comparable to the average flu season. In fact, in 2018, 1.5 million people died of the flu. I don't remember a shutdown. I don't remember any social distancing. I don't remember wearing masks for 1.5 million people dying. Now we have this COVID-19 thing, and they want us to social distance, wreck our economy, ruin our lives. And when I try to add it all up, it just doesn't make any sense. It makes me start to believe that there are other motives here that are involved. So I would encourage everyone who's listening today, who's listening to me, who believes the way that I do, that we have got to take a stand. We have to remember these people. And when it comes time to vote, remember. That's all I have to say. Thank you.
Thank you.
Thank you, sir. Madam Chair, our next speaker is Trevor Burgess. Mr. Burgess, if you'll go ahead and unmute, give us first, last name, spelling, address, and you'll have 2 minutes.
Hi, it's Trevor Burgess, TREVOR-BURGESS. I'm calling again for science-based leadership and a rejection of conspiracy theories and misinformation, which will do nothing but get people killed. The bottom of this curve in Pinellas County, this recent curve in Pinellas County, was May 27th. We have been on an exponential march since then, and many of us have been screaming that from the rooftops since late May. So here we are on June 23rd, and my general view is that this mask order is the least that you should do, and please limit the loopholes. Easing into this is a huge mistake, as you have heard from your own medical experts. I do have 2 practical questions. In the last week, we have tested 14,000 people. The week prior, it was nearly 19,000. Given the exponential growth, why is testing down by 26% week over week in Pinellas County? Are we running short on tests? Second, on a 5-day rolling basis, we are at 25 cases per day per 100,000 people in the county. Many experts recommend locking down at 5 cases per 100,000 per day. What metric are you looking at before you will have no choice but to lock down again? Thank you.
Thank you.
Madam Chair, our next speaker is Tiffany. I do not have a last name, so Tiffany, if you'll give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, my name's Tiffany Beach. I live Beach. The address is 11 Baymont Street in Clearwater Beach.
Thank you.
Appreciate everything you guys are doing. There's some tough conversations here. I think people need to be nicer when they make some of their comments, because I think that's just really not cool for people to be mean to you guys. But social distancing does need to be better. Now, there's so many areas that it does work, like over on Sand Key, things are great. People move away when you're walking toward them. But here on Clearwater Beach, on Mandalay, and on the nice, pretty walkway, people are clueless as far as moving over, stepping away. I mean, I walk every day. I walk in every direction. And it's very sad to see the total disregard of the people in my immediate area. I don't know if masks work or don't work. It doesn't hurt to wear one. I mean, and I've washed my mask. You know, if I'm done wearing it, I put it in the pile and wash it and wear a new one. I do think contact tracing would be awesome. Like, the numbers are going up. The numbers do look a little scary. You know, especially across the bridge in Clearwater, you see those numbers have been significantly going up in the past couple of days. But I'd love to know what the contact tracing shows, and I'm sure you can't share any of that, but I think it would be really great to be able to kind of figure out where and how people are getting it, spreading it, and all that. As far as the mask, if you do it, when do we review, like when you would stop doing it or how that might work? But thanks for all you're doing. Keep up the great work and smile, and we'll do our best.
Thank you.
Madam Chair, our next speaker is Michael Fox. Mr. Fox, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Thank you all. Michael Fox, Michaelfox, 719 52nd Street North, St. Petersburg, 33710. Very quickly, I just want to stand in total solidarity with Commission passing the strongest possible measures here. And I would say to all of our folks who are freaking out that they have health issues, et cetera, as I understand it, as it was read today, there are 873 different loopholes for all you folks whose heads are exploding. All right. So just take a great big deep breath on that. If you don't want to wear it, it's sounded like pretty much you aren't going to have to. Bottom line, you're going to find something to get out. Now, here's what I would ask all of our people who are preaching the Constitution and all of their individual rights. Notice that when Dr. Jameson mentioned the efficacy of these masks, he stated quite clearly that what he was suggesting is where this definitely will help is if you are infected, you won't infect others. This isn't about you. This isn't about whether or not you're going to get the disease. In this effort, we have to come together as a community. Everyone's right to not be infected by you, supersedes your right to engage in irresponsible behavior. This is about you don't know if you're infected. Bottom line, you could be walking around totally asymptomatic. If you wear the mask, you won't give it to me. And that's one of the reasons why I wear the mask. So I've been tested. I have no idea if I've been infected in the 3 weeks since I was tested. So I wear a mask so that I don't infect you, so that this can be stemmed.
Mr. Fox, your time has expired.
Thank you so much.
Thank you, sir. Madam Chair, our next speaker is coming in on the phone line. Last 4 digits 5054. If you can go ahead and unmute, give us your first, last name, address, and you'll have 2 minutes to address the board.
Yes, good afternoon, commissioners. My name is Christine Hubbard, and I actually live in Newport Richey. If you want my address, it's 6039 Guilford Drive. My husband, however, works in Pinellas County. My mother lives in Pinellas County. So I'm in Pinellas County every day for my mother. My husband, as I said, he works 10, 11 hours a day in Pinellas County. I would like to add my voice to those that are objecting to having to wear a facial mask when you're in public in Pinellas County, which I am quite a bit, and my husband obviously is for work matters. I would like to echo some of the other concerns that people have had regarding the fact that these masks offer little to no protection against transmission, either you giving it or you getting it from another person. It says so right on any box that you buy, and that's the out. According to the FDA, as long as a manufacturer states this on the box, they are immune from any legal liability. They cannot be sued. Okay, so that's right there on the FDA website. The other point is if you bring up the latest statistics, people have been talking about that from Pinellas County for today, you see that there are 129 deaths, which represents 3% of all cases. I think this has been a fairly steady amount throughout the whole ordeal here. I'm not seeing that this is a huge increase. If you do the deaths to the number of people that live in Pinellas, according to 2019 the census, 975,000 people lived in Pinellas. So if you do the math on that, that works out to be 0.01% of the population. Are we calling this an emergency? Over 0.01% succumbing to this virus.
And I'm sorry, your time has expired.
Thank you.
Thank you. Madam Chair, we have 35 remaining speakers. Our next speaker is Ann Hutchinson. Ms. Hutchinson, if you can go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Ms. Hutchinson? Hello? All right, Madam Chair, we'll go to our next speaker, Mr. Cliff Noakes. Mr. Noakes, if you can go ahead and unmute yourself, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hello, thank you. My name is Cliff Noakes, C-L-I-F-F, last name N-O-K-E-S, 3780 Sweepstakes Court in Palm Harbor, Florida. Was just wanting to express my opinion against the mask wearing. There, I think, is a lot of interpretation out there that people walking around are basically just virus vectors that are walking around just spreading COVID around if they're positive and they don't know it. I can understand wanting to use masks in very crowded areas like bars, nightclubs, things like that, or restricting the occupancy. That makes total sense. But somebody just walking around Target or walking around Publix grocery shopping, if they're not coughing, if they're not sneezing or doing anything like that, people are very, there's a very low chance of transmission to somebody doing that. I don't think that making masks mandatory in these places is necessary. I've been immunocompromised since 2004. I take care of myself. I go to the gym 5 days a week. I jog 6 days a week. I keep myself healthy by not wearing a mask because I do truly believe that wearing a mask is probably more detrimental to my health between cross-contamination and restricted breathing. There's just no way that you can sanitize a surface 100%. There's constant cross-contamination, constant touching of the mask. I feel like I'm more at risk with my immune system by contracting some other type of lung infection, a neurovirus, some other type of bacteria that's going to cause more damage to my immune system than COVID. I think that people are smart enough to make their own choices for how to stay healthy, and I don't think that this is something that the county should make mandatory. Thank you.
Thank you, sir. Madam Chair, we have 34 remaining speakers. Our next speaker is Matt Winter. Mr. Winter, if you can go ahead and unmute yourself, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Yes, Matt Winter, M-A-T-T-W-I-N-T-E-R, 1916 Anclote Vista, Tarpon Springs, Florida. I want to say thank you to Commissioner Peters. You made some great points. And I also want to say that my family and I, we pray for the leadership of our community every day. So thank you all. And Sheriff Bob, we absolutely support our police department. And I thank you for that. Thank you for continuing to be not giving up on our community. I want to say that I don't support wearing a mask. I've got 3 small kids, 6, 3, and 1. It would be virtually impossible to keep anything on the mouth of my 3-year-old. So I don't think it's really necessary for children that are that young. Also, I don't understand how a virus, that it's a real virus, but it seems that we have a 99% survival rate is making this much of an impact on our community. You know, a lot of small businesses are getting hurt. A lot of people are just scared, even scared of each other. And I think masks are going to really affect people's just approach on each other. And I don't think it's going to be good for our community. And they really don't work. I did some research with the OSHA website stuff. And even though the N95 seems to be the hot thing, that mask doesn't even have a filter for people breathing out. So any infected person walking around with an N95 that's not gonna help matters. And the cloth masks, I mean, you got to put one on, it seems like, to be safe, like every 8 hours. And I don't feel like it's the right thing. So anyways, that's what I wanted to say. No masks for me and my family. And we will continue to pray for you guys. And thank you so much for leading our community. And that's pretty much it. Thank you so much.
Thank you, sir.
Thank you.
Madam Chair, our next speaker is Elena Levine. I believe Dr. Elena Levine. If you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Thank you. Yes, Dr. Elena Levine. I need to give you all again the same stuff?
I think the clerk probably has a record, so you're in the clear.
Thank you. Yeah, I live in Dunedin.
Thank
First,
you.
I want to thank you all the doctors especially on the panel, for their valiant efforts today in providing actual facts. I've been listening to the many comments just now, and I'm actually sad and terrified to hear how facts are misused, and they're not facts. They're talking apples and oranges about the masks. And the one caller was absolutely right. It's not about reading the liability off a package. No one's saying that these masks we're talking about will protect the wearer from all this virus. It's to protect other people from your own possible spreading of the virus. And as I said earlier, 50% of the people in Iceland who tested positive never got a symptom and never knew it and could spread it. And people should keep in mind that only 70% of the nasal swabs are accurately reporting. So you could have a 30% false negative rate, think you're negative and fine, and go out and spread the virus. As I said before, whatever you can do, you need every single tool you can use. And from my education and background in public health, it takes 3 things to change behavior. You need knowledge that's accurate and real. You need attitude changes and beliefs to change. And then the last thing is behavior change. You need all your tools. You're going to have to do a massive education campaign. If what these people we just heard are believing, then we're all in trouble. We're all in trouble. It's our right to breathe safely. It's your duty to uphold the safety of the public health. And the response has to be real science-based, not politically motivated. Everyone has a right to safety, and you're the ones who can protect us. I'm terrified that you might actually be listening and believing some of what you've been hearing from the non-scientists who seem to have the same script over and over. I wonder where they're getting it. This should not be a political decision. This is a public health emergency. It's a medical emergency. And the legacy that you leave, there's blood on the hands of everyone in this country that didn't handle this properly from the beginning.
Dr. Levine, your time has expired.
Do everything you can. Thank you.
Thank you.
Thank you. Madam Chair, we have 31 remaining speakers. Our next speaker is Orlando Acosta. Orlando, if you can go ahead and give us your first, last name, address, and spelling, and you'll have 2 minutes to address the board.
Good afternoon. Good afternoon. Orlando Acosta from St. Petersburg, 1155 53rd Avenue North. Thank you very much for your time. I'd like to echo some of the other citizens who are dismayed at the partisan tone that the conversation took at the very end. It's exactly the sort of politics that we're all fed up with. And I appreciate the science-based arguments that are being made by the commissioners and by the medical professionals over here in our audience. As many of you may well know, and I hope other callers are still listening, I am a second-generation American, second-generation military service member, graduate from the Air Force Academy, And my extended family over here, also second generation military. We're very familiar with what sacrifice means. What we're asking over here is for the rest of our citizens to take a very, very small sacrifice in order to renew our commitment to the economic and social strength of our community. I'm calling you from Key West, Florida. We took a calculated risk to come here from St. Pete, deadheaded it straight drive down here because Key West adopted very universal standards for mask wearing. Everybody needs to wear a mask if they're inside a closed establishment, period. And that's what we've seen. About 95% of visitors are wearing it. We're seeing kids wear it. We're seeing babies wear it. And we're seeing all the establishments enforce those rules. It is working. Bars are busy. Restaurants are busy. Even the cruises out into the Atlantic and the Gulf over here to go diving and all, they're busy and booked, right? Because they're all wearing masks and we all feel secure, right? We feel safe. We are mitigating the risk of passing the infection and getting it caught ourselves. This is a sort of future we can envision for our own communities in Pinellas with a very, very simple universal measure. So I ask you to all to waive that requirement, the emergency requirement, if I got that right, Ms. White, and also to adopt the universal standard for mask wearing in our community. Thank you very much.
Thank you, Mr. Acosta. Madam Chair, our next speaker is John Kay. I do not have a last name, so if you can give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
John Kurzman, 5810 Bahia Honda Way South, St. Pete Beach. Thank you.
Thank you, sir.
Thank you for your efforts. There are two main types of masks. There are the procedure masks like Commissioner Peters had shown, and the cloth masks that people purchase or make from cloth napkins. And both these types mostly protect others from the wearer who potentially but unknowingly carries the virus. They do not significantly protect the wearer and they have the CO2 issues. The other main type of mask is the N95 mask, and many of the masks you see with the little vent. That vent is a check valve that prevents the buildup of CO2 from exhale and makes it much easier for those at high risk with lung conditions to breathe. It has nothing for others if that person is affected, as the check valve lets exhales through. But it's perfect protecting those at risk and unfortunately being saved for the emergency. Lack of N95 mask is causing, because they're saving them for the emergency. So people need to wear the right type of mask. N95 for people at risk, such as those over 65, type A blood type, etc. Then the cloth procedure mask for people that are in roles where they might infect others, such as food prep, servers, even the front hostess who I see in many places who touch every fork and knife and wrap it in a napkin. Mostly about those near what you eat, not what you breathe, because people need to wear N95 if they have a concern. What we need is availability of N95 masks to the high risks. Gun-free zones don't work if any single person does something bad. These COVID-free zones won't work either unless the people at risk have the N95 protections they need. People need to be able to protect themselves with that N95, not depend on everyone else. Even some species of animals are transmitting the virus. Will they wear masks too? Dr. Cho said that there was no definitive proof that the riots or protests were the cause of the spread. Okay, so Dr. Cho, was there similar lack of proof that these positive case spike is not just at assisted living homes, the migrant workers being bussed around the state, and then to Georgia, those in prisons, the rioters and protesters, and not data of increased cases coming from the free public?
Sir, your time has expired. Thank you.
That was my question. Thank you.
Madam Chair, we have 26 remaining speakers. Our next speaker is Joanna Perez. Ms. Perez, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hello, my name is Johanna Perez. Last name is P as in Paul, E-R-E-Z, and I'm in Dunedin. Thank you for taking my call. I am a registered nurse. I've worked as an infectious disease nurse and a hospice nurse. I've been doing a little research while everyone has been talking, and I see that currently we have 34 available ICU beds in Pinellas counties. Several of our hospitals are currently in a divert status, including St. Anthony's, due to COVID. So it's very concerning because we are nearing occupancy for a lot of our area hospitals. Several callers have said that they have issues with masks. However, the data does show that most people do not have any issues while wearing masks. Hypoxia is not an issue. Otherwise, we would have doctors passing out in the operating room, which would be less than ideal. the purpose of the mask is to prevent transmission between people, and the mask is highly effective for that. And the study that's being cited, or the article from the New England Journal of Medicine, I have pulled up, and it is being miscited. The New England Journal of Medicine does recommend that masks be used by people to prevent transmission of the virus. So it is being miscited by many people, which is disappointing. So, and in addition, it does not violate any constitutional rights. In fact, not wearing a mask violates the rights of private property owners who can ask a person to wear a shirt, shoes, and a mask to enter their business.
Ms. Perez, your time has expired.
Thank you.
Thank you. Madam Chair, our next speaker, I only have the name Wood. If you'll go ahead and give us your first, last name, address, spelling, and you'll have 2 minutes to address the board.
Hello, my name is Norma Wood, Normawood. I'm a lifelong resident of St. Petersburg, Florida, and I'd like to beg the Commissioner's indulgence. I did send an email, but I would like to urge you today to waive further notice and vote for the most comprehensive ordinance possible. I'd like to bring your attention to the website COVID Act Now, which works in cooperation with Georgetown and Stanford University. They rank Pinellas County's risk level as critical, with active cases increasing exponentially, as Commissioner Eggers pointed out. They predict that Pinellas County's hospitals will reach overload by July 13th of 2020, which is consistent with what our medical experts are telling us today. If we do not act today, our hospitals will reach overload. Thank you very much for letting me speak.
Thank you.
Thank you, Ms. Wood. Madam Chair, our next speaker is Karen Mullins. Ms. Mullins, if you go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, Commissioners. Thank you for taking me. I'm Karen Mullins, Mullins, Dunedin, Florida. Hi to everybody. Thanks for indulging me. I just want to make a little comment. Yes, we have the Patriot Act, which is undoubtedly invasive to a lot of us. The other thing is, if I see somebody not wearing a mask in a public place, am I going to get arrested for taking my shirt and bra off? Please, this is ridiculous. We're talking about lives, Sheriff. We're talking about lives, not indiscretions. And thank you, Commissioner Peters, for writing the script for every phone call that said, you're the voice of reason. Thank you, everybody.
Thank you.
Thank you, Ms. Mullins. Madam Chair, we have 21 remaining speakers. Our next speaker is Caitlin Nothan. Caitlin, if you can go ahead and unmute, give us your spelling, address, and you'll have 2 minutes to address the board.
My name is Caitlin Nothan. I live at 2526 Blackwood Circle in Clearwater, Florida. I would just like to speak on, I don't think it's reasonable for you guys to enact a mask mandate. Dr. Cho, all your statistics, there was no context with them. You need to add, out of how many people being tested, the rate of infection
12%
previously and now. I don't think that any law enforcement should be enforcing this. That's violating your constitutional oath that you took against this. I don't think store clerks should be mandating people masks when they walk into the store. And I would hope that you would listen to the people, because it seems the overwhelming majority of the people on this call are against the mask mandates. Thank you very much. Thank you for.
Thank you. Madam Chair, our next speaker is David Katsaros. Mr. Katsaros, if you can go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Mr. Katsaros? Hello, sir? Can you hear me, sir? All right, Madam Chair, we're going to move on to our next speaker, Allison Barden. Ms. Barden, if you can go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Ms. Barden?
Yes, can you hear me?
Yes, ma'am.
Okay, my name is Allison Barden, ALISONBARDEN, Seminole, Florida. And I just wanted to make several observations. First of all, any warning label we know on these masks are really written just out of legal jargon so that people are not sued. So I think that that is an scapegoat to say for that. However, what I would like the commission to actually look at long term is just like we have a seasonal flu season, we are going to have seasonal COVID season. When and if a vaccine is brought out, not everybody is going to be vaccinated, and you cannot mandate that everybody get vaccinated. So we have got to look at the fact of we are living with this here, just like we live with the virus, the flu, and that it is going to take time for us to build up immunity to it. I think that masks are important, but I do not think it's your place to mandate them. That it does need to, people need to take their own health in their own hands. And with that, I'll concede my time.
Thank you.
Thank you, ma'am. Madam Chair, we have 16 remaining speakers. Our next speaker is Stephanie Y. I don't have a last name. So Stephanie, if you can give us your first, last name, address, spelling, and you'll have 2 minutes to address the board.
Hi, everyone. My name is Stephanie Young, STEPHANIEYOUNG. I'm located in Largo. I would like to say that we do need this mask mandate in order to maintain the safety of our community. Seeing contract tracing is also extremely imperative. To those here that are advocating for the public safety of our community members, thank you. You are appreciated. Also, to one of the previous speakers and those who think like her, there are plenty of people who don't have their panties in a bunch about wearing a mask that will happily visit our area and spend their dollars in our community. They're already doing it. To other naysayers, this is not fake news. Wearing a mask isn't just for yourself, it's to protect your neighbors' kids, and your best friend's grandma. Not everything is about you and your false narrative about what the Constitution means. And to Sheriff Bob, I find it utterly disgraceful to the people of Pinellas County that you can continue to defer to this idea that people will do the right thing without members of the authority stepping in. I don't know where you've been the last 4 months, but everywhere I've gone, I've seen the enormous lack of compassion for other individuals by way of ignoring social distancing guidelines and not wearing masks. Everywhere I go, I see it. Your continued delusions are hurting this community, Sheriff. The same goes for you, Ms. Peters. Relying on people to do the right thing doesn't keep people from stealing, killing, or raping, so why on earth would our police department take that approach now during a public health crisis? Do your job, Bob. Stop denying the reality of our country and our county right now. Stop listening to the drivel that COVID deniers spew. Listen to the doctors in our community. They know how to handle this horrific crisis much better than any COVID denying sycophant. Stop fighting what's best for our community and get behind the mask mandate. Do it. It's your job to protect and serve. So pull your head out of the sand and do it. To
Ms.
everyone
Young,
else,
your time has expired, Ms. Young.
thank you.
Thank you. Madam Chair, we have 19 remaining callers. Our next speaker is on the phone line, last 4 digits 2613. If you can give us your first of all, if you can turn down your broadcast so we can not hear it, and then give us your first, last name, address, spelling, and you'll have 2 minutes to address the board.
Yeah, can you hear me?
Yes, sir.
Yeah, it's Robert Mail, 14869 Mockingbird Lane West, Clearwater, Florida, 33760. I wanted to clear up something scientifically. First of all, I'm an engineer, and we have seen an exponential growth in COVID. That is true in the number of cases that have been documented as positive. However, we're confusing correlation versus causation. The reason we're getting an increase is because we're doing more testing. If you actually look at the line of the number of people that have died from it, the curve is flat. They even had that in the Tampa Bay Times. So it is very, very clear to me that wearing masks or this social distancing nonsense is not going to make a darn bit of difference in the amount of deaths. And this exponential increase is absolutely irrelevant. That's basically all I have to say about this. Thank you.
Thank you.
Thank you, sir. Madam Chair, we have 18 remaining callers. Our next caller, our next speaker is James Shaw. Mr. Shaw, if you can go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Thank you, Brian. My name is James Shaw. Common spelling, it's 2320 Messenger Circle in Safety Harbor. I appreciate the opportunity. So what's interesting is it's fascinating to me that wearing a mask has become a political issue. When you look at it, you have over 100,000 people who've received this virus, 3,200 have died, and each one of them got it from somebody else. They didn't go get it themselves or decide to have it. They got it from somebody else. And wearing a mask isn't about keeping you off that list. It's about keeping you from putting somebody else on it. And so here's what I'd ask. If you'd like to take your health in your own hands, but you can't do that unless the other person's wearing a mask. This is about kindness, it's about respect, and it's about care for others. My family will support your mask wearing ordinance. We'll wear one whether you ask us to or not, just like we wear a seatbelt. Thank you for the opportunity to speak.
Thank you.
Thank you, Mr. Shaw. Madam Chair, we have 17 remaining speakers. Our next speaker is Liam and Evan Oliver.
Brian.
I'm not doing anything. Mr. Oliver or Mrs. Oliver, if you can go ahead and give us your first, last name, spelling, first and last name, spelling, address, and you'll have 2 minutes to address the board.
Hello, my name is Evan Oliver, and I live in St. Petersburg, Florida. I am 9 years old, and I think there should be required masks because they help keep us significantly safer from COVID-19. Please vote yes. Also, Black Lives Matter. My name is Liam Oliver. I also live in St. Pete. I have 2 brothers. I'm 11. My brothers are 9 and 2. We wear masks to protect people, and I urge you to vote for a younger age requirement for wearing masks, so my littlest brother can protect people and himself when he turns 3. Also, Commissioner Peters, the warning on the box of the mask is saying they will not 100% protect you from COVID-19, but they will protect you more than if you don't wear the one. So wear your masks. Thank you.
Thank you, guys.
Thank you. Madam Chair, our next speaker is Jamie L. I don't have a last name. Jamie, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
My name is Jamie Lewis, Jamie-Lewis. My address is 616 Lake Forest Road in Clearwater.
Thank you.
I am a student in the Public Policy and Administration program at SPC under Jeff Cronschnabel. And Commissioner, Mr. Burton, Ms. White, Sheriff, doctors, thank you for meeting today. And I wanted to speak in support of waiving notice and voting in favor of the universal mask requirement. I wear a mask not to protect myself, but to protect those around me because I hope to be a responsible member of my community. The unfortunate truth is I see that a lot of people in this community do not share that same perspective. The ultimate purpose of government is to protect the health, safety, and welfare of the people who live in the jurisdiction. We pass laws to protect ourselves from ourselves, and the situation with COVID-19 is escalating. I'm not a scientist or a doctor, but basic math shows me that the death rate across the country is closer to 5%. In Florida, it's closer to 3%. The percent positive about 2 weeks ago was 1.5%. It got up to 14% a couple of days ago. I just want to say that a lot of the comments about constitutionality, I'm sure Ms. White has considered this and advised you properly. I'm not sure what part of the Constitution addresses this. So I think we're talking more of natural rights, and there is a right for people to go out in public and have safety and breathe clean air and not be infected. I think the communal rights outweigh the individual rights in this instance. I don't want to take up too much of your time. I'm sure you're tired. Thank you for the hard job you're doing and taking all this abuse. Please vote in favor of the mask ordinance. I would like some clarification for employees in restaurants and bars, what responsibility and liability they would have with enforcing this ordinance. Thank you.
Thank you.
Thank you, sir. Madam Chair, we have 15 remaining speakers. Our next speaker is coming in on a Galaxy A20 device. If you'll go ahead and give us your first, last name, address, and you'll have 2 minutes to address the board. And you'll have to unmute.
Hello?
Hello.
Hi, my name is Zachary Seco, Zachary Seko. 3593 54th Avenue North, Apartment 1, St. Pete 33714.
Thank you, sir.
Thank you. I'm calling to ask that you not vote for mandatory mask wearing. Our Bill of Rights was written. They did not put in a clause that negates or suspends our rights if there is a pandemic. I have been in Pinellas County for 31 years, and I am 49 years old. Not once have I heard or seen of any.
Cell phone signal is really bad
Please
right
do
now.
not vote for this, and I thank you for your time. Oh, well, I thank you for your time,
Thank
and
you,
may
sir.
you guys have a good day. Bye-bye.
Madam Chair, our next speaker is Nicholas Eddy. Nicholas, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
All right, thank you very much. Nicholas, common spelling, Eddy, E-D-D-Y,
Thank you.
2618 West Grand Reserve Circle, apartment 622, Clearwater 33759.
Thank you, sir.
Calling in today, I would really like that you, or hope that you vote positively for this mandatory masks initiative. You can see based off of the completely unhinged and uninformed arguments that a majority of the people in this county are going to continue to ignore CDC, WHO, and WHO guidelines. Somehow everybody is suddenly a infectious disease expert when everybody, all of the evidence suggests otherwise. So the British Medical Journal just recently had an article, and I quote, "The virus has been shown to remain viable in the air for several hours when released in an aerosol under experimental conditions, and such aerosols seem to be blocked by surgical masks and cloth masks in laboratory experiments." That was Dr. Tricia Greenball, an Oxford professor, and her associates. So I don't understand what information these individuals are getting. By the way, it was published late April of 2020. So where these people are getting this idea or this evidence that masks are not effective is most likely outdated. Sheriff Bob Galtieri, it is your job to protect these individuals, and you, more than anybody, should understand that common sense is not common. People are going to be selfish and lazy, and without a mandatory mask initiative, more people are going to die, and it will be your fault. Thank you very much for your time. I know this is not an easy situation for you, and I appreciate everything that you do. Have a wonderful day.
Thank you.
Madam Chair, our next speaker comes in on the phone line. Last 4 digits, 4637. If you can go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
My name is Megan Armstrong, MEGHANARMSTRONG. I just want to say that I am in favor of waiving the requirements and enforcing the mask ordinance. I do have some concern about, with it being an ordinance and there's no proof required as to whether you should be exempt by medical concerns, how can you then enforce it? I think that needs to be looked into because, as you see with all these phone calls, most people in this county are not wearing masks currently. Most of them are saying they will not wear a mask. They don't think you have the right to tell them not to. And they're going to continue to not wear one, and they are just going to tell businesses that they don't have to for medical reasons. And if we cannot require proof of that, then they are continue to be allowed into businesses and continue to spread this virus. And that's all I wanted to say. If you could just please take that into consideration. Thank you.
Thank you, ma'am. Madam Chair, our next speaker is Margaret. I do not have a last name. So Margaret, if you'll unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Margaret Gibbs, Largo Unincorporated. Calling to ask you to please, this is a public health emergency and people are not making good decisions. Please make a good decision today and listen to the medical doctors and public health experts and vote on the most restrictive mask requirements. Don't leave this up to the people who've already not made good decisions. We see this every day. Most people don't like to wear masks, but also I don't want to die and I don't want my loved ones and other people in the community to get very sick and have ongoing conditions due to COVID. Thank you very much for your service.
Thank you, Margaret. Madam Chair, our next speaker is Deborah. I don't have a last name. So Deborah, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Deborah? Okay, we'll move on to our next speaker. We'll try April Thanos. April, oh, April has an old version of Zoom. April Thanos, if you can hear me, you're gonna have to call in on the phone line. The version of Zoom that you have is not supported in this forum. We might have to spell those out for anybody that has those numbers. I'll ask for tech support and get it to you before. Let me see here. Don, do you have the number that we can call back in on, or that we can advertise for them?
Yeah, if you give me 1 second here, I'm pulling it up right now. Yes, if you can call in on 646-558-8656, and then dial *9 on your phone, it'll raise your hand back in the queue. Again, that was 646-558-8656.
Thank you, Don. Madam Chair, our next speaker is Ricky Cushing. Ricky, if you can go ahead and unmute yourself, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, it's Ricky Cushing, RIKKICUSHING. I am at 3094 Ennis Glen Drive in Palm Harbor, Florida. I would like to say that I think you should vote no on the mask mandate. It seems like you already have your mind made up, seeing as how you didn't even want to take questions or comments prior to your vote, but I'm going to say it anyway. So what will the timeline be on this? How long are we going to mandate this for? Is it going to be like Key West? We're going to do it for a whole year. I think we're going to see that even when you guys do vote yes on this, that numbers are not going to go down. People are still going to gather. We are going to gather and celebrate the 4th of July, even though our freedoms are being taken away. Yes, we do like the Constitution. Yes, we do like our rights, and we would like to keep them intact. Thank you. Please vote no.
Thank you.
Thank you. Madam Chair, we now have 18 remaining speakers. We've added some. Our next speaker is Nick Carey. Nick, Nick, you are also on a unsupported version of Zoom. If you go ahead and call in on the phone line, that's how we'll be able to get you in there.
Brian, if I could, one thing I neglected to put in there. When you call in, you're also going to have to put in the webinar ID number. That number is 238-247-671. So again, the number is 646-558-8656. And then the webinar ID number is 238-247-671. Thanks, Cap.
Madam Chair, our next speaker is Ann Hutchinson. Ann, I think we had technical difficulties with you last time. Can you hear me okay this time? Ms. Hutchinson? All right, we're going to skip over her. Madam Chair, our next caller is coming on the phone line, last 4 digits, 7474. If you can go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Thank you. My name is Kyle Wells, Kylewells. I'm actually calling in from Houston, Texas. I was born on the MacDill Air Force Base in Tampa Bay, but I now live here in Houston. I'm actually a medical radiologic technologist. I work at several major Houston area hospitals, including the largest medical center in the world, Texas Medical Center. We have currently been seeing a huge spike, and we just implemented our own mask mandate here in Harris County. A couple points I just wanted to address. I know this is not an easy thing to discuss. There are a lot of rights in question here. One of the biggest rights that is in support is that we do have the right to life, liberty, and the pursuit of happiness. Another huge thing about this mask is that these cloth and surgical masks, there's a huge misconception spreading on the internet regarding hypoxia or carbon dioxide poisoning. People seem to have the idea that for some reason these masks will cause low oxygen levels, which is not true. These masks allow plenty of airflow that is redirected, which stops the spit droplets that transmit the virus, which is the biggest reason why us on the surgical team, we do not experience any kind of hypoxia or any kind of increased sickness rates due to wearing masks, even though we do 24/7 for our jobs. These masks are another big misconception is that these masks are to protect ourselves, and that is not exactly the case. It is definitely to protect other people, which is the same reason why we wear them in surgery. Us surgeons, nurses, and radiologic technologists, we wear the mask in order to prevent infections of open surgical wounds. I definitely would take the opinions and the data of medical professionals the most when regarding this decision, as the general public does not have all this kind of information at hand as the people who have studied and have a thorough knowledge of masks and the effects on the body, as well as viral transmission.
Sir, your time has expired.
Thank you so much for your time.
Thank you, sir. Madam Chair, our next speaker is Robert Wallace. Mr. Wallace, if you go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, this is Robert Wallace, RobertWallace, at 11201 122nd Ave, Largo. I just want to voice my support for this ordinance. Basically, everything that I want to say has already been said, and much more eloquently, so I'm going to leave it at that. I just do want to correct Commissioner Peters on a couple things. First off, I think it's interesting that a 9-year-old knows more about masks than you do. And as someone who's been a lifelong sufferer of asthma, I can tell you masks do not cause asthma attacks. Last week, I spent 30 minutes unloading 18 bags of groceries from my vehicle in 90-degree weather wearing a mask. I did not have an asthma attack. That is a complete fabrication. Respiratory illnesses cause asthma attacks. That's what we're trying to stop here. I'm going to leave it at that. Thank you so much for your time.
Thank you, sir. Madam Chair, we have 17 remaining speakers. Our next speaker is Tommy Frayne. Mr. Frayne, if you go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Sure, it's Tommy Frayne, TOMMY-FRAIN. I live at 1671 Autumnwood Street up in Tarpon Springs. I'm not going to address all of the, I think everybody's, gotten their feelings out regarding the constitutionality and the health aspects. I think, the arguments that it's unconstitutional and that it's somehow unhealthy for masks are just really ridiculous arguments. I do want to point out, though, this is also about the liberty for other folks to be able to go out and not get sick. I am somebody, I have 3 kids at home. I'm now working from home while my wife still works out of the home. So I'm basically been here for 3 months, and I'd love to go out, but I also, rely on our parents a lot for childcare. So we've chosen to stay in order to not infect or, potentially infect them. I don't think it's fair that, that the liberty for those to not wear masks and they can go out and do anything they want, trumps ours to be able to go out. I would also like to go and engage in commerce and feel comfortable. It seems that everybody's given up here in Florida while the numbers are rising. We know that the death count is a lagging indicator, so I don't know why that keeps getting brought up. But, we know what to do. And I think it's a really small thing to ask people to put on a mask. And if we're at a point where we can't even do that, I'm very afraid for our society. Thanks.
Thank you.
Thank you, sir. Madam Chair, we have 18 remaining speakers. Our next speaker is Unic Ortiz. Mr. Ortiz, if you can go ahead and unmute and turn down your broadcast and give us your first, last name, address, spelling, and you'll have 2 minutes.
Hi, yes. Sorry, I'm just there we go.
Thank you. Thank you.
My name is Unic. It's Miss Ortiz. I live in Palm Harbor. Thank you for giving us the opportunity to speak today on the mandatory mask ordinance. How are we even debating the health and safety of our community right now? The question in front of you is, how do we keep our community healthy? How do we keep our community safe? And by not passing a mask ordinance, you are saying you do not only not care about our community's health, you also don't care about our safety. And this is not just a health concern. We're also talking about wearing masks so our small businesses stay open. For those saying our freedoms are being taken away by asking you to wear a mask, that's completely not true. We have seen in countries across the globe that by wearing masks, their contraction rate and rate of death has stayed extremely low. I wear a mask every time I go outside. I have asthma, and my mask does not cause me to have an asthma attack, and we need to stop repeating fake news. The remarks that we should not wear a mask because the death count is low, how many deaths is enough? Just one person dying from this horrific disease is too many, where it can be prevented just because we all wear a mask to keep each other healthy and safe. We are in a public health crisis, and we are in an economic crisis. And the mask ordinance is one way to combat both at the same time. To not vote to mandate our county to wear masks would be heading in the wrong direction. This is a no-brainer. To those who don't want to wear a mask, it isn't all about you. By wearing a mask, it protects those around you, and we need to listen to the medical professionals. I'll also echo the child who said previously, Black Lives Matter.
Thank you, Ms. Ortiz. Madam Chair, we have 15 remaining speakers. Our next speaker is Brittany J. I do not have a last name, so Brittany, if you'll give us your first, last name, spelling, address, so you'll have 2 minutes to address the board.
Hi. Okay, I'm sorry. Am I doing this correctly? I'm Brittany. My last name is Pope, P-O-P-E. I actually graduated from Tarpon Springs High School and have been a lifelong resident of this area. I am speaking to you while I'm nursing my sweet 4.5-month-old daughter. I work with children for a living, and I have not closed down, as some of my families are essential workers who work in the health care field. And I want to, again, address many people who are suggesting that these masks are going to protect us from this scary COVID-19 virus, which when we look at, the serological gatherings from Geneva, we can tell that this fatality rate is extremely close to influenza. And before, someone's like, oh, she's hearing that from Trump, it's fake news, whatever weird things people want to come up with. There's hard, raw data at this point that we have. It was overblown. There aren't the death rates. There wasn't the loss of ICU beds for people to stay in. That just has not happened. And it's not going to happen. And as far as protecting ourselves from viruses, there's the HIV virus that you can protect yourself by wearing condoms, yet people continue to not wear condoms because ultimately your safety is your own responsibility. It is not the responsibility of anyone else. It is your own personal responsibility. So I would urge you on the commission to make a reasonable decision and vote no on the masks. Allow businesses to restrict people however they'd like to, and allow, people to make educated choices based on their own personal reason. And remember that good ideas never require force. If it's a good idea, people will voluntarily do it. They do not need the force of the state and penalties of financial.
Ma'am, your
or
time
jail.
has expired.
All right, thank you so much.
Thank you. Madam Chair, our next speaker comes in on the phone line, last 4 digits 7900. If you can turn down your broadcast.
Yes, hello, this is David Katsaros, David Katsaros, and I live at 1610 Pennsylvania Avenue in Palm Harbor, Florida. I appreciate the opportunity to speak. The question I have, or a couple of comments and questions, are why haven't actual testing numbers being released? All I hear is the testing has increased, but this is a very, very important data point when we're making decisions, especially as leaders of our community. Are you tracking the numbers of testing against positive or negative cases? For example, in 1 week, if you test 1,000 people and there was 10 positive cases, and the next week you test 10,000 people and you get 20 positive cases, does this mean that the cases are doubling week over week, or does this mean that COVID positive cases are going down? If you're not tracking this data point and the test numbers don't mean what you're believing they mean. So the doctors avoided or didn't have the answers to Mrs. Peters' questions, which tells me there is a fact gap within your subject matter experts that you are basing decisions on. So most of you have your minds made up, and I think we know that, but this is about moving forward safely with accurate information from all sides. Political biases shouldn't play in the decision, rather balancing the facts from both sides, because there are good points for wearing a mask or not wearing a mask. I believe there is no cut and dried answer. So in closing, wash your hands with soap, take your vitamins, go outside for a walk, pray, and don't give in to fear, because 99% of positive cases. Thank you.
Thank you.
Madam Chair, we have 17 remaining speakers. Our next speaker is Barbara Walker. Ms. Walker, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Barbara Walker, BARBARAWALKER, and I'm at 3019 Bradford Circle in Palm Harbor in the 34685 zip code in the Eastlake area.
Thank you.
And I just wanted to urge the commission to make a decision based on sound science and based on what the experts are telling you. I trust them and I trust you to protect our community. And when we talk about what our community is, there's a whole lot out there. It's not just individuals, but it's all the threads that connect us. It's the community web, so to speak, that needs to be protected. And I know this is very, very difficult for you. And I just want to urge you to stick with sound science on this, please. And I thank you all so very much for your hard work, and I appreciate you.
Whatever.
Thank you, ma'am. Madam Chair, our next speaker, I don't have a name. I have initials KF. If you can go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Yes, please. Thank you so much for taking my comments here. And this is K-A-Y, FIT, F-I-T-T, at 609 Oak Avenue, Clearwater. And I do not support face masks. Please vote no. Nationally recognized neurosurgeon Dr. Russell Blaylock's article, "Face Masks Pose Serious Risks to the Healthy." By wearing a mask, this is a quote, "the exhaled viruses will not be able to escape and will concentrate in the nasal passages, enter the olfactory nerves, and travel into the brain." And this article was written on May 11th, 2020. And I hear your frustration. So please consider doing a different paradigm using hydroxychloroquine, which has been known to work well with these types of things, together with other supplements. And vitamin C has been used in other countries, such as Israel, with very successful rates. So look into other solutions rather than perhaps consider respectfully focusing on the problem. Please focus on the solutions. And even Dr. Blaylock says that he even calls this situation the so-called COVID pandemic. So it could be that, like, I would be asking, who is it that's reporting these numbers and how are people being treated? Because how they are being treated can make a big difference, that even ventilators may not be supportive for them because it's like forced into them. So, so Dr. Blaylock again says that masks fail to protect the healthy from getting sick, but they also create serious health risks to the wearer. So again, I appreciate your time and thank you for your service.
Thank you.
Chair, our next speaker is John D. John, if you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
This is John Ferguson in Largo. I want to thank all of you for participating in this. And but it seems to me, as I look at everybody on here, I mean, I can kind of tell who's made up their mind. If not all of you have already made up your minds. I hope you're listening to people and you're taking that into consideration. And I hear a lot of, well, we're going to follow the experts. Well, as you all know, there are experts on both sides of this issue. And I only see experts on one side of the issue here. And it seems like they're there to promote what everybody else already believes. My second point is I feel sorry for the sheriff, because if you guys are going to put this thing out there and you're going to mandate it, you're going to be getting the snitches, which is most of these people that are calling in. They're going to be calling 911 when they see somebody not wearing a mask. It's going to be a nightmare. You go ahead. You put yourself in this situation and you're going to be so sorry that you created this Pandora's box. You opened it up, because the punishment, I'm sorry, it doesn't fit the crime here. We're seeing an uptick in infections. There's no doubt that's true. Well, that's happened because there was a lockdown, and the lockdown creates people with no immunity. And so after everybody started getting out and we got people coming in from other states, yeah, it's going to go up, but it doesn't warrant what you're talking about. don't do it. That's all I got to say.
Thank you, sir.
Thank you.
Madam Chair, there are 17 remaining speakers in the queue. Our next speaker's on the phone line. The last four digits, 2856. If you can give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Yes, my name is Marcus L. in Seminole, and I just wanted to reiterate what some of the last callers had said regarding the masks posing a healthy risk to healthy people. The last point is making masks mandatory will create felons in the state. Being a concealed weapons holder, I am not allowed to wear a mask in any store, in any public street, or any road. So mandating I wear a mask automatically makes me a felon if I want to protect my family. That's what I want to ask you guys to consider. Thank you.
Thank you.
Madam Chair, I want to make a comment about that.
No, please wait till after we're done.
I did talk
Please.
to the lobbyist on this. It's important. I did call Marion Hammer. She is the state expert on the Florida
NRA.
concealed weapons permit. She's an expert on that and that legislation. And my conversation with her was exactly about what this gentleman talked about. And she said that that is truly not the case. That mandating masks should not prohibit anyone's or risk anyone losing their concealed weapons permit. She said the statute is very clear and defined, and I just want to make that point in case anyone else was calling. Thank you.
Okay, great, thank you.
Madam Chair, next speaker, I don't have a name. It says C. Spages. I'm going to go ahead and ask. Oh, I'm sorry. You have an older version of Zoom as well. You're going to have to call in on the call-in line. Don, can you repeat that real quick for this gentleman or lady?
Yes, the number is 646-558-8656. Again, the number is 646-558-8656. And the webinar ID is 238-247-671. Again, that's 238-247-671. And for anyone who doesn't have that, it's listed on the notice on the Board of County Commissioners Pinellas County webpage under the agenda notice.
Thank you, Don. Madam Chair, our next speaker comes in on the phone line, last four digits 7836. If you can go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
It's April Thanis, and I live at 5850 27th Avenue South in Gulfport. And I'm just calling because I can't believe there's so many people who don't believe the science. And we here in Gulfport are counting on you to do the strictest possible measures for the mask. And I get it about young children, but maybe under the age of 9 or 10, maybe. But certainly I wouldn't want to see teenagers allowed to go out without masks. And, the science is what we've got. And people who aren't believing that are putting us all at risk. So thank you for taking this action. And we're counting on you. Thank you.
Thank you.
Thank you, ma'am. Madam Chair, our next speaker is Brian Harrison. Mr. Harrison, if you go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hello, I'm Grace Harrison. I'm Brian Harrison's daughter. I live at Chickasaw Trail and I'm 9 years old. I don't like wearing masks, but I wear them to keep my friends and family safe and make sure they don't have to go to the hospital because of this horrible virus. And with the people saying that children won't wear masks, they're wrong. Kids will wear masks if you make it fun. And look at Halloween. Kids wear masks all the time, and it doesn't cause any issues. Thank you.
Thank you.
Thank you. Madam Chair, our next speaker is Timothy Nixon. Timothy, if you can go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Sure. It is Timothy Nixon, Timothy Nixon. I'm at 5571 64th Avenue North, Pinellas Park. And just want to say appreciate you guys and all the time that you're putting into this, regardless of how you vote. I know it's not an easy decision. I do ask, though, that you guys just provide some clarification. I didn't see anything in the verbiage regarding places of worship. I'm currently the church administrator at my church, and we're trying to just figure out what we're supposed to do and if these if this decision will affect us or how it will affect us. So just providing some clarification on that would be nice, as well as for how it might affect preschool, since we have one of those as well. And that's all. Thank you, guys.
Okay, thank you.
Madam Chair, our next speaker comes in on the phone line, last four digits 9853. If you can give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, thank you. Good afternoon. My name is Morgan Spinks, MorganSpinks. I live at 14671 Sugarcane Way in Clearwater. I am calling today to say I really do wish that you guys do enact passing the mask. I think that it is vitally important for not only ourselves, but for the rest of the public. As many other callers have reiterated, the masks do not protect yourself, they protect others around you in the community. And we have vaccines and they give us herd immunity, and that allows us to go out into the public and be safe from these very serious diseases that killed many people years ago. And we have the ability to prevent that from happening now. We do not have the ability to prevent that with coronavirus. The only thing we can do is take those simple safety measures, such as social distancing, washing your hands, and wearing masks to prevent others from getting it if you possibly have the coronavirus. I also would like to make a point that I've seen several places opening summer camps and mass child care facilities, and it is extremely concerning to me because children are germ factories. They pass illnesses back and forth between each other, and they're only going to make this worse. They're going home, they're giving it back to their parents, and their parents are going to take it into their office, and it's just going to keep spreading and spreading. I think the best thing to do is enact the strictest actions possible, keep people home, keep people safe, and let it die out. It's the best thing we can do. Thank you for your time. Please keep people safe.
Thank you.
Thank you. Madam Chair, we have 13 remaining speakers. Our next speaker is Ralph. I do not have a last name. So Ralph, if you give us your first, last name, spelling, address, you'll have 2 minutes. Ralph,
can you hear me?
Yes, sir.
Yes, my name is Ralph Angel. I live in Nashville, Tennessee. I'm considering moving to the Clearwater area, so I do have an interest in the area. Thank you very much for listening to me. What I would like to say is I've worked in construction for years, and construction mask, a paper mask, does not keep dust getting into one's face, into one's mouth. So I have no idea how that is supposed to stop an invisible virus getting into one's system, one's body. Nobody is talking about how one can boost one's nutrition and one's immune system to protect one from a virus or anything else for that matter. I think that is much more important. I think that we need to be getting out there living. We need to stop trying to hide away from this virus. We need to get out there and live. We need to boost our immune systems by getting out there and mixing with people, boosting our immune systems with good health and nutrition. People's health is boosted by being out there and mixing with people and socializing with people, not by looking like we're afraid and hiding away or trying to stay away from each other. We need to be happy. We need to be sociable. We need to be getting out there and enjoying life. Life is there to be lived, not to be hiding away indoors. That's not living. So I very much urge the Commission to vote no on this. I think this is very important, that we need to get out of this and move forward. You can't sit here and hide away forever. Well, thank you very much for listening to me, and I hope that you do vote no. Thank you.
Thank you.
Madam Chair, we have 15 remaining speakers. Our next speaker is Ryan Thompson. Mr. Thompson, if you unmute, give us your first, last name, spelling, address, and you'll have 2 minutes. Ryan, can you hear us? Mr. Thompson? Okay, Madam Chair, we'll go to our next speaker, Nick Carey. Mr. Carey, if you can go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, my name is Nick Carey. I live in St. Petersburg, 5320 10th Street North. I wanted to call in support of universal masks, the strictest possible requirement. As many other people have said, masks are there to protect those around you. And when you're choosing not to wear a mask, you're not taking your health into your own hands. You're taking everyone around you's health into your own hands. And I just want to know why everyone who's so worried about the economy won't take even the smallest steps to help ensure that it stays open. Also, there's a lot of research that I've heard about the younger, the median age lowering over time is simply an artifact of testing bias. Before, we weren't testing everyone, and so the population being tested was skewed older. So the younger people are now being tested at a greater rate, and so it makes it look like more younger people are getting infected. And I think that in the coming weeks, we're going to see death rates that reflect what's actually happening. Thank you for your time.
Thank you, Mr. Carey. Madam Chair, our next speaker is Gianna, and I'm going to butcher this, Setsmilis. Gianna, if you'll go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Hi, it's Gianna Tesmelis. It's a long one. It's Gianna. Last name is Tsesmelis. Address is 421 85th Avenue, St. Pete Beach, Florida, 33706.
Thank you.
Okay. I have a few things to address. I've been listening to this for on and off for quite some time. The first thing I want to say is that I just graduated as a biology major, so I have quite a background in science. I took a class on prokaryotic biology. I'm going to dental school in the fall. My mother is also an RN at St. Pete General Hospital, so I do have quite a background in this subject. The one thing I want to say about the death curve is that the death curve actually doesn't update until at least a few days after the actual date. So if you look back at the days, it actually is not as seriously declining as people think. Also with masking, I really think that this is the best way to do it because masking is actually very effective if everyone's wearing one, especially when in combination with social distancing, washing hands, reducing travel, and other precautions. We actually have no natural immunity. This is an animal originating virus, and so the fact that people are saying herd immunity will help us or that boosting our immune system will help us is actually not true. The virus is not afraid of us. It is not a living entity, so I don't know what people are talking about there. And I think it's really disgusting that people are more ready to try an unregulated drug rather than wearing a piece of cloth over their faces. It is not infringing on human rights. What's actually infringing on human rights is the fact that people who don't wear, especially the ones that are knowingly positive, which is actually should be considered public safety issue, more specifically manslaughter if they ended up actually killing someone because they knowingly went out and infected someone. Like I said, my mother is an RN. She's been working with COVID since day one, testing people, being around this. She's seen so many coworkers, doctors, ER staff that are getting infected and seriously ill, even with no underlying health conditions.
Gianna, I'm sorry, your time has expired.
That's okay. Thank you very much. Vote yes on masks.
Thank you. Madam Chair, our next speaker is Sarah Viola. Sarah, if you'll go ahead and unmute yourself, give us your first name, spelling, address, and you'll have 2 minutes to address the board.
Thank you. My name is Sarah Viola. I live at 15 North Taurus, Clearwater, Florida. I just wanted to say I'm against wearing the mask. I understand everyone's saying it's a choice and it's a decision, so I still feel like we should be able to have that choice and that decision, whether we want to wear the mask or not, just like how businesses are able to make that decision, whether we go in there with the mask. Again, I just want to say vote no against the mask. Thank you.
Thank you.
Thank you. Madam Chair, our next speaker is Dave Waddell. Oops, hold on, I unmuted the wrong person. Dave, give me 1 second here.
Dave has already been in.
Has Dave spoken on this item already?
Hi, everybody. I'm just going to make this very, very brief. We need contact tracing. That's the only thing that's going to save us, okay? The
Thank you,
mask
sir.
will help, but I want answers from the health department and emergency management. The distribution of the document that I sent.
Mr. Waddell, did you already?
A timeline.
Yes, he already spoke, Brian.
Okay. All right. We're going to go to our next speaker. Our next speaker, Madam Chair, is coming in on the phone line. Last 4 digits, 2830. If you can go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Yes, my name is Jerry Perna. I live in Tarpon Springs.
My main complaint about this is people tend to think that wearing a mask is not a big deal if you're going to Publix or you're going to the doctor's office or you're going someplace for a half hour or so. I'm working in an office where they're requiring us to wear that mask 9 hours a day. And at the end of the day, or I should say at the end of 2 hours, I have a headache like I've never had before. My nose is running, the mask is sticking to my face, and I'm getting dizzy. I don't have any underlying health conditions, and that is how the mask is affecting me. I think it needs to be noted that we're not talking about just necessarily wearing a mask for a half hour out of the day. I think it should be thought of that the people that have to work in places that are requiring the masks, and if you put this mandate in effect, everyone's going to require us to wear masks. What about our health? If you want to wear a mask and I don't, I would say you're protecting yourself, so don't worry about me. I'm fine. And I just don't think this is fair, and I think that by listening to the comments today and reading them on the Facebook page, which I have been on since the beginning of your meeting, the majority of the people in Pinellas County are not for the masks. And I hope that as our elected officials, you will take that into consideration and not make this a political move, but an actual decision based on the wants of the citizens. I'm not saying you can't wear a mask. If you want to wear one, by all means, wear it. But I don't, and I shouldn't be told that I have to. Thank you for your time.
Thank you.
Madam Chair, our next speaker comes in on the phone line, last four digits 4656. If you can go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Hi, my name's Amy Cox. I live at 530 Skyview Avenue, Clearwater, Florida. I am a nurse here in Pinellas County, and I would like to give perspective to the current pandemic. I work and have been working directly with COVID patients for the past 3 months in the geriatric population. There are a few points I would like to make. We are seeing an uptick in cases, yes, but no one is bringing up the fact that ACA, the regulatory agency over healthcare facilities, mandating that all patients, all workers in healthcare facilities be tested. There are 496 long-term care facilities in Pinellas County alone. This isn't including assisted living, clinics, or hospitals. Secondly, I would like to address false positives and a false death count, as many patients I've had have had false positives followed by several negative tests confirming false positives, and they pass from other causes unrelated to COVID, but are being added to our death count. I would also like to say that even my patients with trachs who are true positive and who are in the geriatric population with several other comorbidities have done well and without issue with this COVID infection. I don't know what's going on in the news as far as reporting, but my own personal experiences as a nurse, that this virus is not what we were seeing on the news. No matter all this info, and no matter the fact that the science continues to change, supporting science on both sides, our government does not have the right to mandate a face covering. We have constitutional rights protecting our right to bodily autonomy. And so I think that makes it clear that I am not in support of mask wearing. And this comes from somebody who works double 16-hour shifts back to back, working directly with COVID. Thank you for your time.
Thank you.
Madam Chair, our next speaker is Kelly Johnson. Kelly, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Yes, hi, I'm Kelly Johnson, KELLYJOHNSON. I live at 571 Shady Grove Drive in Dunedin. And I would like you to vote yes on support of wearing masks. I know everybody has their own opinion based on their own personal experiences. Mine comes from having to be home, furloughed, and with children. If we don't get a hold of this thing, we're just going to continue to have to shut down and not let the kids go to school, things of that nature. It's not just going to magically go away. I really think it's time for us to be proactive and go ahead and do some things that may be a little bit uncomfortable for a little while, but in the end, it'll result in a much better Pinellas County for us. When DeSantis started his phase reopening, he continued to refer that he would watch the numbers, and if it didn't look good, he wouldn't open the next phase. He didn't do that, and I'm really sorry that our county now has to do their own thing. And I really would like you to just consider the big picture in this. I'm not happy wearing a mask either. It makes me nauseous. But I want my life to return. I want to be able to get back to work and my kids to get back to school. And I think that that's the only thing we can do at this point. is wear masks. Thank you for your time.
Thank you.
Madam Chair, we have 15 remaining speakers. Our next speaker is Jeff Dupuis. Jeff, if you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Jeff, you'll have to unmute. Jeff? Okay, we'll move to our next speaker. Madam Chair, our next speaker comes in on the phone line. Last 4 digits 3494. If you can give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Hello?
Hi, can you hear me?
Yes, ma'am.
Oh, great, thank you. Please, I'm asking all of you to please listen to the health experts and vote in favor of the mask ordinance. I have asthma. I wear a mask. It doesn't bother me.
Could you say your name, please?
Oh, I'm sorry. Sure. It's Laura Clark, and I live here in Clearwater for 35 years.
Thank you.
To the woman who just screamed at everyone, yes, I'm concerned about your health and my health too. Don't psych yourself up into a rage. Breathe normally, remain calm. That goes for anybody wearing a mask who hates it. It's just, it's uncomfortable sometimes, but we have to do what we have to do. HIV and other diseases are not transmitted the same way COVID-19 is transmitted. You don't have to have intercourse to catch it, for the woman who said it was comparable to getting HIV. To address another caller, wearing protective masks is part of the solution. Since April 20th of this year, the state of Connecticut has had a mask requirement, and they currently have the lowest rate of coronavirus transmission in our nation, going from a very high level. Look to other states as models for what has worked and what has not. There shouldn't even be any question that we as human beings should show basic respect and decency in the middle of a medical crisis for each other. How is this even a question? We all know that this disease is easily transmitted. And wearing a mask is one of the simplest and easiest ways to slow the spread and save lives. So I'm just asking, please, please save lives. It's not hard. It's not uncomfortable. It doesn't hurt you. Grow up and put on the mask. And shame on you, Sheriff Bob, for your lack of concern for the people of this community. Please, everyone, don't be a danger. Please protect each other. Thank you for your time.
Thank you, ma'am. Madam Chair, our next speaker also comes in on the phone line, last 4 digits 0473. If you can go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. Hello? Hello?
Oh, hello?
Yes, ma'am.
Hi, I'm Compass. I'm 9. First of all, kids are not germ factories. No one is sterile. We all have immune systems that we need to fight viruses. So I choose to boost my immune system by not eating junk food and being outside with the sun and breathing fresh air and not cotton particles from a mask. Stop believing in fake science.
Thank you.
Thank you.
All right, Madam Chair, our next speaker is Diane Lebedeff. Diane, if you can go ahead and unmute, give us your first, last name, spelling, address. You'll have 2 minutes.
Sure. Diane Lebedeff, L-E-B as in boy, E-D as in David, E-F-F as in Frank.
Thank you.
101 South Bayshore Boulevard, Safety Harbor. And hello, commissioners. I'd really like to just testify in favor of a mask requirement. There is absolutely no legal reason why a public safety provision like a mask requirement cannot be imposed by the commission. And this morning I listened to the presentation of Dr. Jameson and his companion on the Pinellas government website about the coronavirus. There is no doubt that it is going to get worse. And I think it's incumbent on you to impose a mask requirement so that the public health can be protected and so that we can get a grip on this and so that it doesn't inflict serious damage on the citizens of Pinellas. And it's not just getting sick temporarily. There are also signs that there can be permanent physical damage to organs, to circulation, to lungs, neurological systems. So it really is a horrific cascade of events that can occur for the people of Pinellas. And a mask requirement is the simplest way to deal with it. Thank you very much.
Thank you.
Thank you, ma'am. Madam Chair, our next speaker comes in the phone line, last four digits 6191. If you can give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, my name's Gloria Lindenberg. It's Lindenburg. I live at 314 Indiana Avenue in Crystal Beach, Florida. And I was just calling to say that I am in favor of requiring masks. I do have asthma, otherwise I'm healthy. But when I go out in public, you know, my health depends on everyone else. And even though I know that just me wearing a mask isn't necessarily just protecting me, but I feel like I could have the virus and I don't want to give it to others. I am really alarmed at the growing rise in infections, and I see younger kids that think they're invincible together at the beach, at bars, and sometimes you just have to step in and say, this is what you're going to have to do. And I hope that you vote yes. And thank you for your time.
Thank you, ma'am.
Thank you.
Madam Chair, our next speaker is Barbara Walker. Barbara, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll get 2 minutes.
Hi, it's Barbara Walker. I did speak before 3019 Bradford Circle in Palm Harbor. I didn't probably take up my whole 2 minutes. I just wanted to say, I think it's extremely important that you vote yes to stay in alignment with Tampa and St. Petersburg. We need to be consistent throughout the region. Thank you.
Thank you, ma'am. Madam Chair, our next speaker is Antonia Green. Antonio, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Hi, my name is Antonia Green, Antonia Green, Green, 13561 Forest Lake Drive, Largo. Thank you for hearing me today. I am urging you to vote in favor of wearing masks. I'm a librarian in Pinellas County. I'm a parent of 2 young children, and their health and the health of my patrons is definitely the forefront of my mind every day. This is not something where we can develop a herd immunity. It does not infringe on anyone's rights to wear a piece of fabric over our faces. It's just a minor inconvenience to citizens. Since we started this return to normal, I've seen people ignoring masks in social distancing, both in libraries, grocery stores, pretty much anywhere where people are gathering. And it's just a flagrant disregard for the well-being of our fellow citizens. This virus is not going to disappear overnight. We really need to come to grips with that reality. And I'm willing to wear a mask at work, in public, for my safety and for yours. And I really do expect the same from my neighbors. Thank you.
Thank you.
Thank you, ma'am. Madam Chair, our next speaker is Robert Salta. Robert, if you'll go ahead and unmute, give us your first, last name, address, spelling, and you'll have 2 minutes to address the board.
Hi, my name is Robert Salta, spelled R-O-B-E-R-T, Salta, S-A-L-T-A, and I live in Gulfport, Florida. I'm a licensed attorney, and I've actually studied and written about constitutional law. And personally, it has me scratching my head at the complete lunacy of the idea that a mask is unconstitutional. It's the same laws that require a restaurant to refrigerate their chicken. No matter how hard a restaurateur believes that they don't need to refrigerate chicken, the chicken will rot. And if it's served to the public, it will infect the public. Your individual rights have always ended when you're causing harm to the public. You cannot use your speech to start a riot. You cannot use your Second Amendment to shoot someone. You can't decide to forego clothing because you believe it infringes on your constitutional rights. You are free to not wear a mask in your own home, and no one will judge you. Just as no one is forcing you to wear clothing while you're in your own home. See, the idea of a society, the idea of a state, is that we came together with the purpose of protecting one another. This has been going on for 10,000 years. And whether it be in the ancient world against barbarians or in the present day against a pandemic, the goal stays the same, and that's to protect one another. Over the past 3 months, we've lost over 100,000 citizens. That's the equivalent of experiencing 10 September 11ths every month for the past 3 months. If that had happened, we'd be listening to the generals, we'd be listening to the military leaders, how to respond, how to protect ourselves. Those best suited to protect themselves in this situation are the doctors and the medical professionals. And they're telling us that masks work. They're telling us that masks are the simplest solution that can lower this death rate. And we have other countries that have used these masks, and they have practically eradicated the pandemic. New Zealand hasn't had a new case since June 8th. They have a population of 3 million, which is smaller than that of Pinellas, and they've eradicated completely. No new cases since June 8th.
Mr. Salta, your time has expired.
Thank you very much.
Thank you,
Thank
sir.
you.
Madam Chair, our next speaker comes in on the phone line, last four digits. Let me see here, 3084. If you'll go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Hi, can you hear me?
Yes, ma'am.
Hi, this is Danielle Sheeler, Daniele, last name Sheeler, 1396 Bellevue Boulevard, Clearwater, Florida. I'm imploring you all to please vote yes for wearing masks. I am in healthcare, been there for over 20 years. I have to wear an N95 mask all day. When I go to the store or go out in public or do anything like that, I still keep my mask on because I care about my own health, as well as everyone else that's in the vicinity of me. To hear some of these selfish comments coming from people saying that they don't need to wear a mask or they shouldn't have to wear a mask, and that if I want to wear a mask, that's all right for me, but if they're not able to do it, then too bad, is really very selfish. And I think I want to protect everyone, but the people that are complaining about not wanting to protect each other is very disheartening. You've got to do the right thing here. I implore you all to please follow the lead of other great counties such as Miami-Dade and Hillsborough County. Pinellas County is a fantastic county, and you need to do the right thing here and step up and be the leaders that we voted you in for and the leaders that we hope that you continue to be. So thank you very much for your time.
Thank you, ma'am.
Thank you.
Madam Chair, our next speaker is Carl Conyers. Carl, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Yes, this is Carl Conyers, Karlconyers. I live at 1799 La Grande Drive in Dunedin. I am not a licensed attorney or an educator or a healthcare professional. I am just an everyday citizen. But I hate to sound like a broken record. I know you've heard this argument all day, but I do urge you to vote in favor of, face masks in the public. I think about people that are other than myself, which is something I'm constantly having to remind other people of, that this is not about the individual. This is about protecting all of us. I'm sure you know that. But it is something I have to remind my friends and family of quite often. I'm 22 years old. Being a member of the younger population, I see my fellow friends out without masks, pretending like this is not a problem. The thing I have to remind them of is that we do not have an end in sight for this. There's no cure. There's no vaccine. We need to act like it, and we need to act like this is the crisis that it is. That also said, about thinking about other people until we see a downward trend, I think it'd be right to be wearing masks. And, to the person that said that this is a political discussion, I vehemently disagree with that. This is a matter of public health. It should not be left versus right. It should be people versus the virus. And that's all I have for you.
Thank you, sir.
Thank you.
Madam Chair, our next speaker is Phil Gozo. Phil, if you'll go ahead and give us your first, last name, spelling, address, you'll have 2 minutes.
Hi, it's actually his wife, Kathleen.
Oh, okay. Sorry, Kathleen.
I'm calling in on his Zoom. It's Gozo. I'm 100% for mandating the masks. I'd like to be able to see my parents who are in their 70s be able to go out and about without fear of getting the infection. I also am autoimmune, and I don't think I should be punished for that. So it's not violating anybody's right. You go into a store, you have to wear your shirt, your shoes. I mean, come on, guys. And you know what, Sheriff Bob? Shame on you. Really, pay attention. I've been watching you roll your eyes. If it's too hard to take drunks out of an overcrowded bar, what do we need you for? I mean, literally, it's common sense. Wear a mask. That's it. And I've been watching all of you. And except for Mr. Welch, you look like you're so bored. You take tax money from people in Pinellas, and you're going to be bored when we try to tell you what we feel? Shame on all of you, except for you, Mr. Welch. Thanks so much for your time. We need masks. We're on the rise.
Thank you.
Thank you. Madam Chair, the next speaker comes in on the phone line, last four digits 9632. If you can go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Good evening, everyone. My name is Michael Leibovitz, Lebovitz. My address is 2199 Chianti Place, Unit 912, Palm Harbor. And I am calling in favor of masks. I myself am a behavior therapist. I work with an endangered population. I have type 1 diabetes. My wife also works in healthcare. And we cannot ignore the danger that people like myself with chronic illnesses are in, and we cannot ignore the danger of our clients. For my wife, nursing home, assisted living population, and for myself, kids with varying diseases and disabilities, and all of their families as well. Lastly, I would like to make an economic argument here. Wearing masks encourages economic growth. People can go out, they can feel comfortable and safe wearing a mask. Not wearing a mask makes people feel scared, uncertain, like their lives are in danger, and for some of us, they are. And the sooner that we wear masks, the sooner that we all conform, the faster we can kick this thing, and the faster we can get right back to it. Thank you very much. That's all I have to say.
Thank you.
Thank you, sir. Madam Chair, our next speaker comes in, let's see. I've got Moto Play. I'm not sure. You have to give us your first, last name, address, and 2 minutes to address the board. Can you hear me okay?
You hear me?
Yes, ma'am.
I'm calling from my home in 812 East Gulf Boulevard.
I'm sorry. Can you give us your name one more time? We didn't catch that.
Echo Thomas, ECHOTHOMAS, calling from 812 East Gulf Boulevard, number 5, Indian Rocks Beach, Florida, 33785.
Thank you.
I'm calling to encourage all of you, as I have in emails that I've written you, to trust the scientists and the experts on this issue. I am 26 years old. I live with an autoimmune disease, which means that my immune system doesn't work as well as it should. I also live with my mom, who has the same autoimmune disease and a recovering cancer survivor, and a father who is a teacher at a Pinellas County middle school who has asthma. We absolutely cannot keep living life as normal when our fellow citizens and our neighbors are dying. So the worst that can come from this is that if we don't wear masks, the numbers continue to rise and we see more loss of life. The worst that can happen if we do wear masks is that some people will be inconvenienced temporarily for having to wear one. I myself get very fatigued and out of breath very easily, but I still make a point to wear a mask as a courtesy, not only to protect myself and my family, but protect everyone else and their families as well. So I encourage you, please do not let this become a bipartisan issue, but trust the facts and the science. Please vote yes to mandate masks in Pinellas. Thank you.
Thank you.
All right, Madam Chair, we're back up to 15 remaining speakers. Our next speaker is Melanie Fort. Melanie, if you can go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, my name is Melanie Fort. I live in Gulf Boulevard on St. Pete Beach. I'm a 21-year-old college student. I had my senior year last semester, and I missed a lot of things because of this virus. And I'm literally the epitome of a healthy person on book. I've never had anything, never had to go to the doctor for anything bad. The worst thing I've had was a strep throat because I was a singer. And I still am wearing my mask every single day. I don't leave my house unless I really need to. I'm 21 years old, so when people say that young people are avoiding this, I do understand because I do see my fellow people like me ignoring it, but it's not all of us, so it would be really nice to not generalize us. I'm disappointed in my fellow citizens for the way that they are responding to all of this, and the commissioners and just the people in charge. The fact that we have to have this conversation is really disheartening because we have seen other countries and states do what they have to do and have strict rules in order to make sure that their citizens are safe, and it's working. And the fact that we have to have this conversation to allow people that are against it to share their voice is kind of disappointing. I love the analogy of having to wear clothes. Like, I don't like wearing pants, but you see me wearing pants because I'm not going to walk around naked. You know what I'm saying? Doctors are saying to wear masks, and officials are saying that this is the bare minimum of what we can do to prevent it. So to go against that and to say that that is taking away your rights is really annoying when there are Black people that are dying and they are getting tormented by the police. And that is pretty much the epitome of getting your rights taken away. If you don't want to wear a mask, then you can stay home and order your groceries online. We are in 2020 that you can literally order anything and everything to your house. So if you want to be selfish, please stay home because you are literally committing attempted murder, basically, because if people are coughing on each other, people are being not respecting social distancing, that's literally an assault, basically. And I know that sounds crazy, but it literally is just the truth. Mr. Welch, I love your background. I love your bow tie. You are a king, and I am very hopeful and inspired to see somebody like you on this board. Thank you for listening. Please do the right thing, because I'm really worried for my generation and the people above me and below me. Thank you so much.
Thank you.
Thank you. All right, Madam Chair, we have 17 remaining speakers. Our next speaker is Jennifer Harmon. Jennifer, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Excuse me, my name is Jennifer Harmon, JenniferHarmon. I am in favor of the masks. I drive home through downtown Dunedin. Sorry, I'm at work. Downtown Dunedin, and I see tons and tons of people crowded together. I'm sure that all these hundreds of people are not from the same family, and no one is wearing masks. No one is social distancing. And I go to work and I go home. And at work, I require all of us here to wear masks when we deal with the public. Inside the building, there's only a few of us, so we're not that close to each other. We all have our own phones. We're being very careful, but to see massive amounts of people, all ages, small children, elderly people, crowded downtown Dunedin on a Sunday afternoon or Friday night or Saturday night, it just makes me sad that people, I mean, if they're not forced to do it, they're not going to do it, period. You know, people are not going to be careful.
Thank you, ma'am.
Hey, thank you. Brian, can I just cut in for a second?
Sure.
I know that a couple of our guests are going to have to leave soon, Sheriff Bob and Dr. Cho. Thank you, Dr. Jameson, for being here all afternoon, but I just want the public to know that they're not leaving because they don't want to hear you anymore. They're leaving because they need to go somewhere else. They have other meetings to attend. This is well beyond our normal meeting time, so we appreciate you being here, and just leave whenever you need to.
All right, Madam Chair, our next speaker is Jennifer Strakic. I probably butchered that. So Jennifer, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Good evening. Jennifer Strakic, JenniferStracick. And I am here on behalf of Alpha House of Pinellas County. We are a homeless shelter for women and babies in the community who are abused and or human trafficked. And I just wanted to go on record to say that I support the use of masks at all times. We struggle on a daily basis to keep COVID out of our home. We've been successful thus far, but we have newborn babies, teens, adults, and it's very scary environment. We only take them to the grocery store every week. We don't take them anywhere else. And even in the grocery store, it is such an undertaking to spray everything down, additionally what the store is doing, and to basically dodge people in aisles that choose not to wear masks. So I thank you all for everything that you're doing for the community, and I just wanted to be on record that we support having masks on all the time. Thank you.
Thank you.
Thank you. Madam Chair, our next speaker, I only have a last name for it. It looks like Katsaros. If you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. And you'll have to unmute, ma'am or sir.
Someone with that last name has already spoken to
Yeah, I seem to remember that as well, Madam Chair. We'll go ahead and go to the next caller. Our next speaker is Alexandria Johnson. Alexandria, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Hello, my name is Alexandria Johnson, Alexandria. My last name is Johnsson. I live in Tarpon Springs, Florida. I lived here since I'm 21 now, and I've lived here since I was 4, so 17 years. I have a little sister, and she is 5 years old, and she's fighting leukemia right now. So she's at very high risk if she were to catch the coronavirus. So I think it's very important that everybody wears their their face masks. It's not that big of a deal to wear a face mask for 30 minutes while you're in the grocery store, or a few hours if you choose to go to a restaurant or something. Because of people like me, where I can't leave the house to hang out. I can't leave the house to go to the beach. I can't leave the house to go to a restaurant. I can't hang out because I can't put myself at more risk. So I literally only leave the house for essential things. So if I'm trying to go get some groceries so I can eat, I'd like to be able to go there with peace of mind, knowing that I won't be at risk for catching the virus and bringing it back to my 5-year-old sister who could die from the virus because she has leukemia. So I think I highly encourage that we implement the laws for people to wear face coverings. Thank you.
Thank you. Madam Chair, our next speaker is, I just have a last name, Yasova Savos. You'll have to go ahead, unmute. Give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Yeah, good morning or afternoon. Wow. My name is Ariella Yasova Zaffos. Last name is spelled on there. It's YASOVA-ZAFFOS. We're in Seminole, Florida. As a healthcare professional, we have had the unfortunate reality of seeing how this unfolds, not only in the hospitals that some of us work in, but also those that our loved ones work with. This is a healthcare crisis, and these decisions should be made by healthcare professionals. These should not be political discussions. The fact that this is up to public discussion is asinine, to be frank. We have a responsibility to protect our communities. That's your job as our elected officials, to protect our communities, when clearly those amongst us will not do the right thing unless they are required to. There are a lot of individuals who do not have the luxury to work from home, whose livelihoods and their families' livelihoods require them to go to work. So they have the responsibility to have to be in contact with all of these irresponsible and selfish individuals who do not want to mask themselves to prevent spreading the disease. There are plenty of asymptomatic and pre-symptomatic people spreading this disease, and you have the responsibility to keep your community safe. Do the right thing, vote for universal masking, listen to your healthcare professionals. This is not a decision that any of us in the community should be making. It's a decision that strictly the experts should be making.
Thank you, ma'am.
And again, if I could break in on that one, we are not just required to listen to the public if they want to make a comment on something we're going to be voting on, but we believe it's a central part of our government. We need to hear from the public. We will be listening to our health professionals when we make this decision. But I appreciate you calling in. I appreciate everyone that's called in so far. And when we stop getting calls, we will make a decision.
So, Madam Chair, we have approximately 11 remaining speakers. Our next speaker is Joshua Ellis. Joshua, if you'll go ahead and unmute, give us your first, last name, spelling, and address, and you'll have 2 minutes.
This is Joshua Ellis, Seminole, Florida. Yeah, I mean, I think there's a positive to wearing the mask. I think we should be cautious. I think it should be left up to the parents if the children wear the mask. I don't have much comment. I work in healthcare. I get it. We wear the mask. I don't like the fact that we're imposing it on citizens. I don't like the fact that we're adding, especially during the civil unrest that we have in our country right now, that we're adding this extra burden to our police officers. Sheriff Bob, I really appreciate, our family really appreciates the effort that you and all of your men do every day, as well as all of the other police departments around Pinellas County. I understand there's a difficult decision here. I do appreciate the time. Thank you for the time.
Thank you.
Thank you, sir. Madam Chair, our next speaker, I don't have a name. It just says veteran. So if you'll go ahead and unmute yourself, give us your first, last name, spelling, and address, and you'll have 2 minutes to address the board. And you'll have to unmute yourself in order to address the board, please. Hello? And Madam Chair, looks like we're unable to have this person for whatever reason, so we'll go to the next caller. Next caller is Daniel McAllister. Daniel, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Thank you, ladies and gentlemen. My name is Daniel McAllister, DanielMcAllister, and I live at 5228 Carlsberg Place in unincorporated East Lake, the northern section of the county. I'm a lifelong resident of Pinellas County, born at Mountain Park Hospital in 1969 in St. Petersburg. Raised here my entire life, raised in Largo, a graduate of Largo High School, proud father of 9 children, most of whom were adopted from the foster care system here in Pinellas County, and proud father of 7 of 9 of them who've already graduated from Pinellas County schools. I asked to speak today very briefly in support of requiring some kind of source control measure for the spread of the COVID-19 virus, whether that's the masks that everyone is talking about, but I would also ask that you consider an alternative of a face shield. Reports are generally supportive of the fact that that equally will support the concept of blocking the spread of the virus. And it is an alternative that people that have respiratory issues can use without blocking their ability to breathe in. And that's all I really have to say. Thank you for the opportunity to speak.
Okay, thank you.
Thank you, Daniel. Madam Chair, our next speaker is, let's see here, we need Zach Stevenson. Mr. Stevenson, if you'll go ahead and unmute, give us your first, last name, spelling, and address, and you'll have 3 minutes, or 2 minutes, I'm sorry.
Hi, thank you. My name is Zach Stevenson. I live in St. Petersburg, and I just wanted to say, you know, as someone who works in healthcare, as a husband of an immune-compromised cancer patient, and as someone who's actually survived COVID, I'm frankly disgusted that we're even having the conversation right now. I mean, it seems like a no-brainer to wear masks. You know, we as a society should care for the least of these. We should care for each other. Wearing a mask isn't really an issue of your personal health. It's an issue of the health of your neighbor, of your friends and family. You know, scientific studies have proven that wearing a mask is far more effective at preventing spread than preventing infection. And just to kind of, you know, talk to some of the points people brought up about the mask being uncomfortable. You know, like I said earlier, I've survived COVID. I was in my bed, unable to breathe for 4 weeks, and it's far more uncomfortable.
Thank you, sir.
Thank you.
Thank you.
Madam Chair, our next speaker is Cindy Churchward. Cindy, if you'll go ahead and unmute and give us your spelling, first name, last name, and address, and you'll have 2 minutes to address the board. And Cindy, you'll have to unmute.
Hello.
Hello.
My name is Cindy Churchward, Churchward, and I'm live at 1730 Sherwood Street, Clearwater, Florida. And I'm looking at the basic facts. First, I want to say thank you, Sheriff Bob. Thank you for standing up for our constitutional rights. And also thank you, Karen Seal, for looking at the really hard questions. We were doing fine in Pinellas County. We were leveling out until the kids started protesting and started going back into the bars. I think we need a lot more tracing to find out where it's coming from. And it spiked up, and from what I understand, the last few days, it's headed back down again. I do not think we're in any type of huge catastrophe emergency situation when 99% of the people survive. COVID is here to stay. It will be here 10 years from now. It will just continue to mutate, and even the vaccines won't work, the same as the flu. So we have to practice social distancing. I, for one, I have immune compromised system. I'm on disability, and yet I social distance. I go out without a mask. I cannot breathe with a mask on. I don't know how any other way to say it with asthma. I cannot breathe with it on. My daughter works in healthcare. I know your testing has had to go up recently because she works in a long-term facility that just started getting tested 2 weeks ago. So if that's the case around the county, your numbers will be spiking. Anyway, I appreciate your time. I urge you, please do not make this mandatory. Anyone who wants to wear it, great. Hats off to you. If I'm around somebody that's really closely immune compromised, I try to wear it as best I can, but I can't breathe in it. I literally have to pull it out from my face.
Thank you, ma'am. Your time has
So,
expired.
Thank you.
Madam Chair, our next speaker comes in on the phone line, last 4 digits 0473. If you'll go ahead and unmute and give us your first, last name, and spelling. I'm sorry, let me unmute real quick. Can you give us your first, last name, spelling, and address, please? And then you'll have 2 minutes.
Hi, my name is Devin, and I'm 11 years old. And to all of the callers with asthma, just because masks don't affect you doesn't mean it doesn't affect others. It gives me asthma attacks, and Halloween masks do the same, and I can't wear them. Vote no for my safety. Thank you.
Thank you. Madam Chair, our next speaker is, let's see here, Barbara Walker. Barbara, if you'll go ahead and unmute, give us your first, last name, spelling, and address, and you'll have 2 minutes to address the board.
Okay, it's not Barbara. We have other household members that wish to say something.
Okay.
Please go ahead.
Hi, I'm Lonnie Walker, LANIWALKER. I live in the Palm Harbor area, and I think we should have masks on. I think it should be required, because when you're walking around the grocery store, just even if that's the only place you go, you don't know who there has a family member who could be compromised. You don't know who there is compromised. And it's just like, and I'm totally for, like, if there's an alternative, like a face shield, like just anything is better than nothing. And I don't think like people should just be walking around without that kind of protection for themselves and for everyone else. It's common sense.
Thank you.
Thank you.
Let's see here, Madam Chair. Our next speaker is on the phone line, last 4 digits 0790. If you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes.
My name is Michael Ferdovich. I'm Vice Mayor of Gulfport, 5325 11th Avenue South, Gulfport. I'm in favor of the masks, and I think we should require all masks. People should wear masks, whether you're an employee or visiting a store, or restaurant, etc. I mean, not a restaurant, obviously, but when you go into an establishment. The absurdity that it's unconstitutional is ridiculous. I don't like wearing a seatbelt, but I have to wear one. So that constitutional situation is an absurdity. So anyway, I suggest you vote yes on requiring masks. Thank you.
Thank you, sir. Madam Chair, we have 8 remaining speakers. Our next speaker is calling in on the phone line also, last 4 digits 7900. If you'll go ahead and give us your first name, last name, spelling, and address, and you'll have 2 minutes.
Hi, my name is Miles Katsaris. I apologize. I called in on my tablet, but I had internet issues and it kicked me off. I'm in the Palm Harbor area, and I'm a 7th grader in Pinellas County. I struggle with anxiety like many others do. I had a school project which required me to educate myself on COVID, and I'm particularly interested in what it will be like going back to school. I have not heard anyone say anything about mental health, and it is a very important topic to address. Do you know how much anxiety this has caused children? While I am wearing a mask, I am in serious danger. How is this more dangerous than secondhand smoke? Should I have anxiety that I will die from that too? So smokers do not care my health, or they would not be smoking. What are you going to do about that? I also want to thank Ms. White for giving me the opportunity to speak when Madam Chair didn't care to hear me. Thank you.
Thank you,
Well, I can
Miles.
assure you that I wanted to hear you. We just couldn't get you here. We have not listened to anybody that called in.
Yeah, that's definitely true. All right, Madam Chair, our next speaker is Katie Jamesman. Katie, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. And Katie, you'll have to unmute yourself.
Oh, okay,
There,
you can hear me now.
there you go.
Hi, my name is Katie Jamesman. I live in the Clearwater area around Gulf Bay and Belcher. I'm 27 and I do have an autoimmune disease. I'm calling because I am in favor of face mask, and I do think that it should be mandated because nobody else is going to do it apparently. I do have friends in my age range, and I clearly see them going out and about and not caring about anybody else besides themselves. So I see a lot of that already. I think that a face mask is just an inconvenience, and if you can't wear one, then don't go out. I mean, the people that are going out right now, should be the ones that can, take care of others and not just themselves. So thank you.
Thank you.
Madam Chair, our next speaker comes in on the phone line. Last four digits 4341. If you'll go ahead and give us your first, last name, spelling, address, you'll have 2 minutes to address the board.
Hi, my name is Kelly Edwards, Kelly Edwards. I'm in Tarpon Springs, Florida, a lifelong Pinellas County resident. I take great pride in how I've taken responsibility of my own health over the years. I work hard at bettering my health every single day. This is in regards to the foods I eat, the water I drink, working out and exercising regularly, the products I use on my body, etc. That being said, as a healthy 37-year-old woman with no underlying medical conditions, I strongly oppose wearing a mask for myself and my young children. I absolutely oppose mandating masks or any other medical procedure for that matter. It is important to allow citizens to make the choice on whether wearing a mask is beneficial or actually protecting themselves and others. I am a small business owner of a gym and think it is detrimental to people's health and well-being to wear a mask while working out, and have questions on how this would affect my business and income. Please vote to uphold our health and medical freedoms and parental rights and allow us to make the choices that we feel is the best fit for us individually and for our families. Thank you.
Thank you.
All right, Madam Chair, we have about 5 more speakers here. Our next speaker comes in on the phone line, last 4 digits 5612. If you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes.
Hi, can you hear me?
Yes, ma'am.
Yes.
Okay, my name is Kristen Ward. I am actually a resident of St. Petersburg, Florida. I'm actually studying a master's degree in public health administration. So I am all in favor for face masks. I think you guys are doing a great job, and I would appreciate it if you voted yes on face masks. Thank you for your time.
Thank you. Madam Chair, our next speaker, I don't have a name for, CVERKUILEN. If you'll go ahead and unmute yourself, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hello, my name is Christopher Verkeilen, CHRISTOPHERVER, capital KUILEN. Address is 1014 Bella Vista Drive, Northeast, St. Pete, Florida. So my comment is, we've asked for this information before. If you're going to impose these kind of policies, you need to have a measurable reason to implement it, a measurable point at which it will be retracted. We haven't had an increase in cases, yes, but your chances of running to a person with COVID in Pinellas County are less than 1 in 4,000. This is nothing to say of your chance of contracting it from that person, which is around 1%. Mark my words, this order will not stand the scrutiny of the court. The lawsuit that will come to Pinellas County, and you will lose it. It's expressly against the U.S. and Florida constitutions, and the law will decide as such. If you decide to wear a mask, perhaps you should choose a device that is actually capable of protecting you, so you don't need to force others to wear a device. This order will penalize those who don't wear masks, but those who wear face coverings, yeah, I said face coverings, because many devices in the public wears will provide absolutely zero protective value. In fact, it can have a negative effect because of facial touching. Yet these individuals wearing fashion-grade masks will be complying with the law. The WHO has said masks are ineffective, but they retracted their statement due to political pressure. So I urge you to not enact a facial covering law. Thank you.
Thank you.
Madam Chair, our next speaker is Leah Walker. Leah, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Hi, my name is Leah Walker, and I am at 3019 Bradford Circle, Palm Harbor, Florida. My name is spelled LEAHWALKER.
Thank you.
I've suffered from mental health issues for the majority of my life, and originally masks gave me panic attacks, and I had to overcome that. And even being on this call creates immense anxiety, but I felt it was so important to just urge people to do the right thing and wear the mask, if not for you, but for someone you love or someone you don't even know. We should be united together right now in protecting each other. And it's really just a no-brainer to me at this point, as an essential worker and a new voter, we should be wearing the masks.
Okay,
Thank you, Leah. Madam Chair, our next speaker is Steve Pisano Prevuznak, and I probably butchered that. So Steve, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes.
Hi, I'm actually a first responder, so I'd like to say, first of all,
I really think you do need to vote this in because of the number of cases I've actually ran and been exposed to. And my fear is bringing it home to my family, my in-laws, and all that stuff. So definitely need to vote it in. It's the point I won't even let my family go during the whole lockdown. I won't let my family go out. I was the only one going out getting stuff. So yes, you definitely need to vote this in. People are going out there without the mask, exposing themselves and all that stuff. I don't know why they would even want to take that risk. So yes, most definitely, you do need to vote this in.
Steve, just for the record, can you give us the spelling on your last name, sir?
Pizzano.
Mm-hmm.
I don't use the other part of it.
Okay, thank you. I appreciate it.
Thank you.
Yep.
All right, Madam Chair, we have next Rich. I do not have a last name, so Rich, if you'll give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Hi, yeah, my name is Rich Graham, Graham, and I live in Seminole up off of Park Boulevard. And I know this entire thing is politicized one way or the other. Doesn't matter where we fall. We have very strong opinions. Personally, I'm against it. I would much rather us have the choice rather than being mandatory. But I would ask that in this time of all this other craziness going on in other areas locally and around the country, that if we pass this, what will be the restrictions on those who can legally and lawfully carry a concealed weapon if they're also required to wear a face mask, especially for those of us who have young families and we don't necessarily want to go out in public without the ability to just there's dangerous situations at times and they come up out of nowhere. So what is that restriction or clause going to look like? Thank you.
Thank you. And I think that one's already been answered, but go ahead.
Madam Chair, our next speaker comes in on the phone line, last 4 digits 7780. If you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. You'll have to unmute. Hello, can you hear us? Yeah, I think we're gonna have to move on to the next one, Madam Chair. We had the remaining speakers, Madam Chair, were all ones that we had technical difficulty with. Do you want me to try going through one just to?
Can try them real quick.
We'll try them real quick, and we'll try Ryan Thompson. Ryan, if you'll go ahead and unmute.
Can you hear me this time?
Yeah, now we can hear you. How are you, sir?
Oh, I'm good. Thank you for being patient and listening to everybody today. Ryan Thompson, RyanThompson, and I live in 33756, which has the most cases outside of St. Petersburg that already has a mask ordinance. Maybe it's better that this happened towards the end of your call, because what I wanted to say to you guys especially is Albert Einstein once said, what is right is not always popular, and what is popular is not always right. When I first called over an hour ago, you guys were getting inundated with people telling you that you were doing the wrong thing by having masks. And I want to thank you guys for listening and hopefully passing this mask. So please don't worry about your reelection. Do your promised duty. I only wish that you guys would have followed Tampa and St. Petersburg and voted on this last week and maybe saved how many number of people from getting it over the weekend. On May 23rd, we had 1.4% positive rate on any of the tests that were taken. According to testimony here today, we have 14%. That's a huge amount. Everyone calling and saying this is just due to more testing is not looking at the numbers. We went from 1.4 to over 10%. According to the state plan for reopening, we are now above the required level to continue our phased reopening at over 10%. That's one of the required 3 things that we have to pay attention to. If we don't get below 10%, we cannot continue reopening. All other areas in Tampa Bay are forcing masks, so people will flock to Clearwater and the rest of Pinellas County and Gulfport when they will not wear masks in Tampa and St. Pete, causing a higher rate for citizens here near me. For people saying there's a constitutional issue, there's no further restriction than a sign that says no shirt, no shoes, no service. It's the same thing. It's just requiring a little bit to protect everybody around you. The Constitution promises life before liberty for a reason, life and then liberty. Those are the in order that the Constitution promises. So please vote the most restrictive and comprehensive version that removes all loopholes and find ways to close any loopholes, because a large portion of the population cares more about political viewpoints than keeping us safe. Please do the right thing.
Thank you.
Thank you, Ryan. Madam Chair, our next speaker, we'll try Ann Hutchinson one more time. Ann, if you'll go ahead and unmute yourself.
Hi, can you hear me this time?
Yeah, now we can hear you. How are you, ma'am?
Fine, thank you. Ann
All right.
Hutchinson, Common Spelling, Clearwater, Florida. And I first want to thank Sheriff Bob. I think he has the most difficult job of all, which is keeping our liberties, as opposed to government officials and bureaucrats who are overwhelmingly trying to take them away. I want to urge you to vote no to masking and other restrictions, and I'm going to support this very quickly with a number of excerpts and headlines from various media reports that are quite credible. Here we go really fast. The WHO states asymptomatic carriers don't spread COVID-19. The WHO declared that COVID-19 almost never spreads through asymptomatic carriers, as reported by CNBC. From the data we have, this is quote from Dr. Maria Van Kerkhove, head of the WHO's Emerging Diseases Unit, said in a news briefing at the United Nations Agency Geneva headquarters, quote, from the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a second individual. And also from on video, quote, they're not finding secondary transmission onward. It's very rare. It appears to be rare that an asymptomatic individual actually transmits onward. Next headline, American Association for the Advancement of Science study claiming new coronavirus can be transmitted by people without symptoms was flawed, published in sciencemag.org. Next, study asymptomatic COVID-19 carriers might not readily spread the disease. That's the New American. Study on COVID-19 published in the journal Respiratory Medicine suggests that asymptomatic carriers might not spread the disease very effectively at all. Next headline, the Centers for Disease Control and Prevention, CDC, says there is no evidence pets can spread COVID-19. Next, CDC admits virus does not transmit easily on surfaces. You cannot get COVID-19 by touching things, disproven by the German government just a few weeks ago. The CDC admitted it.
Ms. Hutchinson, I'm sorry, your time has expired.
Thank you.
Thank you. All right, Madam Chair, we're going to try Jeff Dupuis one more time here. Jeff, if you'll go ahead and unmute and see if we can talk to you this time. Can you hear us? Jeff, you have to unmute on your side, please. And he's not taking himself off mute, Madam Chair, so we'll go on to the next one. We'll try Veteran one more time. If you'll go ahead and unmute yourself and give us your first, last name, spelling, and address.
Yeah, hi, can you hear me this time?
Yes, sir.
Yes, my name is Don White, is W-H-I-T-E, and I reside in Clearwater, Florida.
Okay.
And I just sort of against the mask wearing because it's pretty much, it's a virus. Your mask, yes, it does stop if you sneeze or someone else sneezes, but you still can pull it in through the side of the mask. I mean, because you don't have a clean seal. It's pretty much like scuba diving. If you put a mask on and go in the water, if it doesn't have a seal, you get water in. It's just the same thing with a virus. You know, a long time service in the military. If the little PPE mask works so well, why didn't we just wear them instead of a protective mask that sealed your face and stopped everything from coming in? I mean, I'm all for if you want to wear one, wear one. But when it comes to your own decisions, I mean, if you're not comfortable wearing one because of the fact of how things sort of work, I mean, it should be your responsibility. You take care of yourself. You know, that's pretty much all it is I had to say. It's just, I sort of don't understand because you can catch stuff through your eyes. The mask is open on the sides. When you breathe, you pull the virus in. All it's really doing is stopping a fluid transfer. So, and I want to thank you all for your time. And that's about all I got to say on this. I hope you all vote no on the mask.
Thank you, sir. Madam Chair, we have 3 remaining callers on the phone line. Want me to keep going?
Yeah.
All right. Next number next phone number is 0176. If you'll go ahead and unmute yourself and give us first name, last name, address, and you'll have 2 minutes.
England Miano, ENGLAND MIANO, 1722 Tall Pine Circle in Safety Harbor, Florida, 34695. I'm going to skip arguing constitutionality or medical data because that could go on for days. What I do want to address that I haven't heard anyone else speak on is the nature of the orders and ordinances. Looking at St. Pete order and the exceptions and Hillsborough's ordinance, and with its exemptions, essentially gives an individual the right to legitimately apply one or more of these exceptions or exemptions, thus rendering the orders and ordinances such as these virtually ineffective, because what you are left with is the people who would be wearing masks without any mandate. What I do find astounding is the number of people not using common sense based on the simple laws of nature. Over thousands and thousands of years, humans have evolved and lived in an environment containing literally immeasurable amounts of pathogens, and we have remained the dominant species. What we should be worried about instead is all the synthetic and toxic chemicals and pollution indoors and out, which are primary contributing factors causing such a high percentage of these immunocompromised population in the first place. The data that should be observed is actually the number of CV cases in those who have been wearing masks versus those who have not been wearing them. Where is that data in comparison? Are the local officials ready to carry the burden of injury and death due to the mask mandates? Are the local officials prepared to deal with the lawsuits that will be pursued against the county and the ADA violations that will be filed against local businesses? Please do not go along with these draconian and tyrannical measures. Vote no on mandatory masks.
Thank you.
ma'am. Let's see, Madam Chair, we've got about 5 more hands in the air here. We'll go to 2018. If you can go ahead and give us your first, last name, spelling, and address, and you'll have 2 minutes to address the board. Hello? Hello?
Hello.
Yes, ma'am.
Hi, my name is Allison Otamendi. I live in Tarpon Springs, Florida. And all I want to really say is that I'm hearing a lot of fear-based mentality, and I'm confused. I don't watch the mainstream news, but for something with a 0.1 to a 0.2% mortality rate, and that's warranting a mask mandate, where does it end? And where there is risk, there has to be a choice. This is not something that can be mandated. I want to thank the sheriff and Kathleen because they seem to have some common sense toward all of this. And also, they found that there was coronavirus in the flu shot. So how do we know that the push for the flu shot didn't put this in people? There's just too much unknown, too many variables. And Dr. Andy Kaufman, MD, says that on any given day in the general public, we have a 0.9% chance of dying just by living. And if this has a 0.1 to 0.2% mortality rate, what are we even doing? I really don't get it. Thank you.
Thank you,
for
ma'am.
your time.
Madam Chair, our next speaker comes in on the phone line, last 4 digits 5980. If you'll go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Mariel Willis, WILLLIS, Dunedin, Florida. I am 9 years old.
Okay, go ahead.
I believe that wearing a mask isn't that I don't think it should be that people all have to wear it because I feel that it makes people more participant. And whenever I wear a mask, I can't breathe that well, and my stomach starts hurting, and I get really hot, and it just doesn't make me comfortable. And I think that a lot of people get grumpy about it because whenever I'm hot, I get very grumpy. And you can't see people's smiles, which, especially when you're in a doctor's office, like getting something, like I had to go get my retainer, and it was kind of a little scary when someone was shoving a big thing in your mouth where you couldn't even see their smile. So I think it's a lot better that you should be able to choose if you want to wear a mask or not.
Thank you so much. We appreciate the call.
Thank you. Hey, Jewel, can we cut off people coming, any new people coming in? I mean, at some point, because this could go on all night. I mean,
I think you could. You have been pretty liberal with public comment. I think that if you wanted to establish a point in time and say only those on the line at this point, would be taken as speakers, I think that is a fair thing to do.
Okay. How about if we give them 5 more minutes if they really feel compelled to call us, and then we'll cut it off.
That works.
Thank you.
Madam Chair, our next speaker is Alex Eckelberry. Alex, if you go ahead and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Alex Eckelberry, ECKELBERRY, Bel Air, Florida. Just a couple of brief comments. I have studied and written extensively on the virus, and I'm not going to get into the mass discussion, but I'm concerned that on the subject of children, if you look at the Iceland study, that children are very unlikely to get the virus, and when they do, it is not a significant health issue. But also, surprisingly, children do not spread the virus. So that is a study that's easily Googleable by anybody, and I would be very concerned as a parent having children at any young age having to wear a mask. I think it's just unhealthy. And then also on the subject of masks during exercise and outdoors, bicycling, jogging, I believe that's not going to be the case, but I would strongly advise against that. There is one issue with this virus is that, like all viruses, dosage may play a big part. So walking by someone in Publix is not necessarily going to give you the virus. It is something that I think you can talk to a medical professional. Dosage may have a lot more to do with it. So in other words, being very close to someone and getting a lot of it. And that's why I think you see more people getting infected during mass gatherings and family activities, that sort of thing. That's all I have to say. Thank you.
Thank you.
Thank you, sir. Madam Chair, our next speaker comes on the phone line, last 4 digits, 7780. If you'll go ahead and unmute, give us your first, last name, address, and you'll have 2 minutes. And yeah, can you hear us?
Yeah, I can. My name's Lana, Lana, and I'm 11 years old, and I am in Dunedin. I think that people should wear a mask because if you're not wearing a mask, then the coronavirus spreads, then you get sick, and then they die. Do you want that? No, of course you don't, because then people will die. So that's why you should wear a mask and stuff.
Thank you.
Thank you.
Madam Chair, our next speaker is Helena, and I don't have a last name, so Helena, if you'll go ahead and unmute yourself, give us your first, last name, spelling, address, and you'll have 2 minutes. Hello? Helena? Helena? All right, we'll go to our next caller. Last 4 digits, 2856. If you'll give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Yes, this is Marcus out in Seminole. Basically, I wanted to just start off by saying those who would give up liberty to purchase a little temporary safety deserve neither liberty nor safety. To mandate masks on the citizens, that's showing a disease that's showing 0.1% to 0.5% mortality rate. That's the average flu for the year. Are we going to continue this for the next 10 years? Is that what this is all about? A mandate completely on control? And also with the concealed carry, is that going to be included in there? Is there going to be a stipulation that if I'm concealed carrying, I'm allowed to wear a mask? That needs to be specifically in writing. I know you said you talked to the state, but I don't take your word for it. I need to see that in a government document, because if I'm held liable for something, for protecting my family, and you come at me and say you were wearing a mask when you shouldn't have, that's a problem. And that's all I have to say. Vote no.
Thank you.
Thank you, sir. Madam Chair, our next speaker is Deborah Williams. Deborah, if you'll go ahead and unmute and give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Can you hear me?
Yes, ma'am, but you have to turn down your broadcast.
Is that better?
That's much better. Thank you.
All right. My name is Deborah Williams. I am a resident of Tarpon Springs, Florida. I have been here for about 4.5 years. We're in the 34689 zip code. I'm a mother of 2 children. And I also represent a pretty large group of citizens, parents, teachers who are advocating for our children's health freedom, which is a topic that we really need to address here. Especially, within regard to going back to school. We have a lot of concerns involving a lot of the policies that, some have brought up putting into place. And masking is one of those concerns that many of us have, especially for children. It just doesn't work. You ask any of these teachers, not just the parents, but you ask any of these teachers, and they will tell you that masking children will not work. It does not work. Talk to the teachers in the summer camps. It doesn't work, and it won't work. That's a very large point that I wanted to bring up, and I wanted to thank the chairman that also questioned the CDC on their suggested age of 2. And someone had mentioned that the CDC clearly doesn't have any children, or else they wouldn't be recommending that at all. And I think that if we are questioning that, suggestion from the CDC, we should also be questioning a lot of the other suggestions coming from the CDC. And I also want to applaud Katie Peters, who is also asking some very important questions. And I think we need to continue on with that and not just make these grand assumptions that, following these CDC
Deborah,
guidelines.
I'm sorry, your time has expired.
They are medical, not health. That's
Thank
a
you.
very important point. Yep.
Thank you.
All right, Madam Chair, our next speaker is Terry Cook. Terry, if you'll go ahead and unmute, give us your first, last name, spelling, address, and you'll have 2 minutes to address the board. And Terry, you're gonna have to unmute yourself.
Okay, can you hear me?
Yes, sir.
Okay, my name's Mitchell Cook. This is my wife's computer, that's why. I live at 3113 State Route 580, Lot 64, Safety Harbor. All this talk about wearing masks and feeling safe. I looked up some OSHA regulations and looked at all the different masks, and the surgical masks are good for about 20 minutes, and they're not used to filter particulates. They're used to filter droplets or splashes and things like that. And then you have people wearing the masks that Grandma or Aunt Sally made that don't really provide any protection whatsoever. As a matter of fact, they just accumulate everything from the air and you have it in your face all the time. And it's, people wear all these different masks and are not wearing the proper mask. If they want, it's a false sense of security for someone to be out there thinking, hey, okay, we're required to all wear masks, and they're wearing things that are not going to protect anyone. So it's sort of ridiculous, because you just have this variety of masks that people are wearing that have no effect whatsoever, or could actually be working in the other direction. And to the young lady that said that well, something's better than nothing is absolutely not true, because of the false sense of security. And for the person who said this is not politically, there's no political aspect to this. Every controversy in America that's ever happened has had a political aspect attached to it. So, and it's just so difficult for people to realize that if we're going to wear a mask, you need to wear the proper mask, and then who's going to pay for those?
Sir, your time has expired.
Thank you.
Okay, thank you.
Thank you. Madam Chair, our next speaker is Andrea Kugelman. Andrea, if you'll go ahead and unmute and give us your first, last name, spelling, and address, and you'll have 2 minutes to address the board. Andrea, can you hear us? Hello? Okay, we'll go to our next caller. Madam Chair, our next speaker is on the phone line. Last four digits is 3909. If you'll give us your first, last name, spelling, address, and you'll have 2 minutes to address the board.
Thank you. My name is Terry Weeks. I live at 7301 8th Avenue North in St. Petersburg. I'm a registered nurse. I also have a law degree. I was going to address the constitutional issue, but I think the excellent comments from Robert Salta and Judge Lebedev dispensed with any ridiculous idea that such a minor health and safety regulation is a violation of anybody's constitutional rights. However, I do want to say a couple of other things about health. Number one, there are numerous studies that show that the wearing of masks does in fact slow down the virus. Now listen, people, no, the masks don't protect you. They protect others around you. And if about 80% of the people cared enough to protect each other, we would slow this thing down. And we better slow it down or else we're going to have to shut down. Our economy is dependent on tourism. Who is going to come to Pinellas County? Who is going to come to Florida if we are the epicenter of this virus? Europe is thinking of closing its borders to Americans because we have done such a poor job. We used to get a lot of European tourists here, probably not anymore. Japan has announced that their coronavirus pandemic is effectively over. Why? Because a huge percentage, practically all of their citizens, wear masks. As far as death rates, that's only a minor factor. A lot of people may not die, but a lot of people are going to be permanently disabled. They've actually doing CT scans on asymptomatic patients, and even those patients, when they look on the scans, are showing lung damage. So you are having damage to your organs, even if you don't know it. Even people who are not hospitalized have been sick for months and months and still fighting debilitating fatigue, brain fog, shortness of breath. They may never be the same. So to say the hospital rate is not that high, the death rate is not that high, that is irrelevant. If you want to make this county work again, if you want to get everybody back to work and you want to keep the economy humming, show a little civic responsibility.
Ma'am, your time has expired. Thank you.
Thank you.
Madam Chair, we're going to try once more with Andrea Kugelman, who was in before the 5-minute time frame, and then she's our last remaining new speaker.
Hello?
Okay.
Andrea, can you hear us, Andrea?
Great. Yes, I can hear you.
Okay. Can you, for the record, can you give us the spelling on your first and last name and then address? Thank you.
ANDREAKUGELMAN. I live at 2219 45th Avenue North in St. Petersburg. And I'm calling because I think that everyone should be wearing a mask as part of their civic duty. And I think that it should be regulated by the government, and it should have been put in a long time ago by our governor and by the president, and none of those things have happened, and things have only gotten worse and worse. Many of the data that we're seeing that people are giving who are against masks are incorrect. The death rate is between 0.5 and 1%, not 0.1%. That's completely inaccurate. People are still getting sick. People are dying, and things are currently getting worse because the infection rate is going up. Masks are effective. It is proven in the news and has been proven by science completely, and everybody should wear one because we care about each other. Thank you very much.
Thank you, Andrea. And Madam Chair, that's the remaining people that were in before the 5-minute limit that we gave. So I think public comment can be closed.
That was the last one. They came back.
Thank you. Thank you, Andrea.
Okay. What do we want to do right now? Do we want to take a break? And yes, Commissioner Long, I promised I would call on you right after everyone was done.
Thank you, Madam Chair. And really and truly, I think for all of us, there's so much to unpack with all of the comments that have been made this afternoon. There's a couple of points that I would really seriously like to make before we get started on our own thoughts. And that is for all the folks that have been listening to us for the last several hours, I would like to extend an enormous thanks to all of the young people who chimed in, because truly they are the future for all of us. And having a grandchild who is 10, I really appreciate the comments that have been made by our young people, because sometimes, you know, out of the mouth of babes comes some very thoughtful comments with regard to how they want and what they want our future to look like. Secondly, I'd like to speak to the folks who spoke about how this has become so political. I can only speak for myself, but if you think for 1 minute that any partisan politics plays any part in my decision today, you could not be more mistaken. This virus doesn't give a damn about whether or not you have an R or a D about your name. I am very clear that our number one responsibility as an elected official in this county, which has almost 1 million people in it, is to protect the public health and safety of our community. This is very hard, and I can tell you that it has kept me up at night. I have lost sleep. The amount of stress involved in trying to make the right decisions for all of us is enormous. And I do think I can speak for all of us when I say that. For those people who have talked about how we are trampling on their rights, I would like to remind them that yes, we have implemented at the state level the requirement that we all wear seat belts. And we all are required to wear shirts, shoes, and pants when we go into a restaurant. There are a lot of these kind of decisions that are made in our society because that's what is the definition of living in a civilized society. We try to make the best decisions that we know how to make to protect the masses. Leadership is not easy, and it is not about making the decisions that are most popular. It's about making the decisions that are right for the most amount of people at any one time. And lastly, I'd just like to share with you some thoughts that I learned while I worked at Clearwater Central Catholic High School, and it was about courage. And the comments that were shared with me then, I think are appropriate for our conversation today. Courage is not the absence of fear, but rather the judgment that something is more important than fear. The brave may not live forever, but the cautious do not live at all. For now, we are going to be living as we work through this challenge to all of us, not just here in Pinellas County, but throughout the state of Florida, nationally and globally. We're going to be living the road between who we think we are and who we know that we can be. The key is to make the journey in a way that provides the best that our community has to offer. And so for all of those reasons and so much more, I will be voting yes to implement the universal recommendations that have been made by our county administration. And thank you for allowing me my comments, Madam Chair. That's the end. Thank you.
Thank you. I'd like to pause right now and see if you all would like to take a break and take this back up when we come back, or would we like to work through this? I know personally I need a break.
A break would be good.
Okay, good. 7:30. We still have a lot of business to take care of. We will not be taking any more public comment on this issue. So
7:30 is good.
All right.
Sounds good.
See you then.
Good.
Hello?
can hear us. Hey, Brian.
Yes, sir.
Hey,
I can't hear you very well.
We do. Okay. Well, let's do it then. Okay. I feel much better. I don't know about you guys. Commissioner Eggers.
Commissioner Eggers, you got to unmute.
But you knew that.
He said that quickly. He wanted to catch you.
Yeah, I've had that unmuted almost the whole time, and like I shouldn't have. So anyway, yeah, just a couple questions before, just maybe a comment or two. But did we agree that we would have a sunset date on this? That we would kind of periodically review this? Will this be reviewed weekly with our executive board? I just was curious about that.
So the county attorney can certainly speak to it, but she, why don't you go ahead and speak to it, Joel? But
The way this is currently written is that it will stay in effect for so long as there is a local state of emergency, unless you all take some sort of action to rescind it prior to that time.
So weekly, when we take a look at this and we take a look at numbers and see trending differently, we could keep the order going and just pull that out, perhaps. I mean, that piece.
Well, keep in mind, this is an ordinance. So you taking action each week on the local state of emergency is really independent of this. So,
but at that time, you could take an action to rescind that ordinance.
You would have to go through the emergency measure to again waive notice and do some of the things that you're doing here tonight. But the effective date and duration of the ordinance relies on the local state. But keep in mind, they're two separate actions.
Okay. Thank you. There was a couple of folks that mentioned the use of face shields instead of masks in certain places. Does this give us the latitude in certain instances to use face shields versus masks inside?
What I would recommend is if you all decide that you want to allow that we could modify the definition of, I believe it's face covering, to include shield. I'll defer to you all on whether you want to do that. I don't know if the medical experts have anything to add on that, but we could certainly modify the definition of face covering, which is, what describes the protection being put in place.
Okay, and then we'll get to that in just a minute. Maybe the other one. I just had a few other questions. Just want to make sure I know where we're at with our agreement here. We agreed any person under the age of 2 years old, we put that other language in that would be at the discretion of the parents. Is that something that
would
we
have
need?
to be an amendment.
Okay.
So so it was brought up before. St. Petersburg language. It says their language says if a person under the age of 18, that person's use of a face covering is left to the discretion of the person's parent.
Okay.
If that's what you're referring to, you would have to make an amendment to add that.
Okay, so if those kids are out there on their own, parents aren't with them, that's a kind of an open kind of. Yeah, okay. I'm not going to dwell on it. I do think the idea of having the parents' discretion, I'm not sure what the age should be. Maybe it's 13, 14. I don't really know, but I think the parents' discretion is important in that regard. So that's my thinking about it. I was just trying to make sure I understood 2C, where it says persons strictly adhering to and maintaining social distancing. So if people adhere and maintain social distancing inside, are we saying that masks are not required?
And the way it's currently written, that is correct. If they were in an area, and we were trying to think of, situations where it's not a grocery store and there's, you're over here and there's nobody else in this area, if a mask would be required. So that's the way it was written, to provide some latitude depending upon the situation.
Okay, and then you get into that whole measuring thing again. So, yeah, I'm just trying to make sure I get the subtle difference here. So,
right.
And then the other one was persons exercising while maintaining social distancing. I'm assuming that's mostly for the gyms or workout facilities, inside workouts, really, because we're not talking about anything outside.
We're not talking about outside.
That's correct. It's only, this is only on indoors, but yeah, and I'm not seeing where you're at, but
that's 2F.
2F.
Page 4. page 4?
Yes, right, exactly. So primarily at like a gym or something like that.
And then the last question I had was, what did we find? You said you were going to look at something on preschools and churches. Is there any direction for them? Are they still their social distancing? We're not looking at numbers. We're still looking at capacities there, and then social distancing for churches.
Churches would be included in the definition of indoor public place that is in this ordinance. So they would be covered by the ordinance and the mask requirement.
So so in an inside church, you have to have the mask on.
And the same thing.
If you go with the universal ordinance provided, yes.
And the same thing for the child care facility, correct, Joel?
Correct.
Okay. So I just wanted to make sure I got that. I don't know how everybody feels about it, but I think that the doctors, our doctors that have been talking to us, we've been hearing them at our weekly meetings. We've been hearing them today and tonight quite a bit. I listened, as I said, into the doctors that weighed in over in Hillsborough County, and obviously with the exponential growth, and I know that we've talked about that and how that really requires this. We got to start thinking now so that we're ready to deal with what's going to happen in 2 to 3 weeks. I'm not sure. I think I've got a pretty good feel that Dr. Cho said that that a lot of this uptick could be from phase 2. I mean, not knowing exactly when that date was, but we're talking 3 to 4 weeks. And so as we continue to do that, and we continue to have situations that have come up, maybe it was the outside, the protesting or whatever, augmented that. We haven't seen the results of that either yet, and nor have we seen the results of that uptick and what spread they might create. So I think there's a lot of concerns, and I think we need to act now. So I'm going to support the universal. I had originally looked at a different one, but I think we need to do this. I really want to monitor it closely. I certainly want to echo some of the comments that have been made that, our doctors are trying to educate and inform people, let people understand the way that they're looking at it. They've gotten no direction from anybody that's trying to uptick this or make it worse than it is. They are telling it like they see it, and we're relying on them. These are true professionals who not only care about their profession but care about this county and care about each one of you, especially those of you who called in tonight. I mean, all of you who called in tonight, really want to say thank you for that. It's really been an emotional time, and you could feel it. And I counted the numbers. I wrote notes down on every single person that called in, and we had about 60 seemed to be in favor, 40 against, and there was 3 or 4 that I couldn't quite tell what they were supporting. But there's a lot of emotion on this, and a lot of people that feel strongly about it. And at the end of the day, I think we do need to ultimately just think about outside of our box and think about other people. So I think there's a whole lot. I don't want to spend a whole lot of time on it. I did want some clarifications on the questions that I asked, but I'm going to support the universal policy. I'd like to see face shields be considered as an option, because I do think there are times when that does work, and I'd like to hear from the doctors on that. I mean, I can be flexible on that one. Certainly, the parent's discretion is important, and I do think that we talked about the sunset date. So I'm just want to hear the doctors on the face shields as a alternative for folks.
I'll take that one, Commissioner Eggers. In terms of, it's my understanding, and Dr. Jameson can clarify this, but or give his thoughts, but it's my understanding that the face shields aren't really interchangeable with the mask. A lot of times they're in combinations, and I think one of the advantages of having both, not that I'm advocating for both, is that it does provide the eye protection as well. But it's my understanding, unless Dr. Jameson feels otherwise, that they aren't as effective, and it's usually in conjunction with a mask.
Okay. Dr. Jameson? Is Dr. Jameson still with us?
Still here.
He's still on the line. He was driving the last time that we saw him, so he may just be unavailable at this moment.
Don't answer.
Are you able to hear me or no?
There you go. Hey, Dr. Jameson. Yes, we can.
Right.
Hey, sorry about that. So the face mask and the eye or the face shield work in slightly different ways. So face masks made out of cloth or fabric have two different ways that they can stop particles from moving. One is physical filtration, if it bumps into the fabric, and the other one is through electrostatic charge of the particle hitting the fabric. And the face shield just prevents the direct flinging of a particle out of the mouth. So they're not quite the same in how they work. The point of the face shield is more to protect your eyes because those are exposed even when you're wearing a mask. And the point of the mask is more to filter the particles coming out of you to whatever extent that particular mask can.
So yeah, so so you wouldn't want to substitute one for the other, but you could encourage people to use masks or shields if they wanted to, in addition to. That's not.
Yeah,
but you're not.
I wear both.
Okay. And then anyway, I don't want to dominate the time. I just need, there's some other questions that we just need to answer as we amend this agreement, and I just want to see if people are on the same page. So thank you.
Thank you, Commissioner Seal.
Thank you. Before I make my comments, Commissioner Eggers did point those out. I would prefer not to have 2C, the person strictly adhering to and maintaining social distancing. And I mentioned this earlier. The reason is you've got to make this ordinance easy to follow. And we have medical exemptions and ADA exemptions and other things, but it's like, how do you measure that? And then the other is 2I, which is patrons or customers in any indoor public place with the protected by a solid barrier such as a plexiglass shield. Again, how do you measure the 6 feet around there? It just seems impractical. I mean, if we got to go there, fine, but I think it just becomes very difficult to enforce. And I would also agree to do some kind of parental discretion. And then Jewel already covered earlier that this does cover a child care facility, so that adults would be required to wear masks there. So that's very good. So my comment basically is, I try to live my life in the golden rule. And that really has been important to me and to my family, to do unto others as you would have them do unto you. It's similar to love your neighbor as yourself. And as one of our guests who spoke today said, we needed to be united together to protect one another. And I think that is the most critical piece out of all of this. It may be that I am not being protected myself, but I'm protecting my neighbor. I'm protecting someone I'm encountering in a grocery store. Folks today talked about the numbers. The numbers prove that this is increasing and that we have to address it in a different way. I don't want to be back next week with doubling of the cases, with trying to figure out how the hospitals are going to handle sick patients. I'm grateful that we haven't had that many deaths, but it doesn't mean that we couldn't start to have more deaths as the number of cases increase. I also want to point out that we received a letter from the 3 major hospital systems here in Pinellas County, Baycare, HCA, and Abbott Health. They cited a study that was done by the Lancet. They looked at 172 studies, 16 countries, and on 6 continents, and their conclusion is that masks are worthy of wearing. And I think somebody kept talking earlier about science and scientific evidence. Well, this is based on COVID-19. And so they have been studying this for the last 3 and so months. And I think that speaks highly of itself. The medical community is also very, very concerned about this. As Commissioner Eggers referenced, this is an emotionally charged issue. As many people said, this is not a partisan issue. This is all about public health and public safety. And So I am definitely going to support it. And I respect each and every one of my fellow commissioners, our staff, and I especially respect the time that the public took to try to come in an over 5 hours period of time to give their testimony. So I'm grateful for everyone's thoughtful comments.
Thank you. Mr. Welch.
Thank you, Madam Chair. And I'll just echo my colleagues' comments. A couple of issues, and I think we were all looking at the same parts of this. I had some questions about 3.2C as well, that Commissioner Seal just spoke to, persons strictly adhering and maintaining social distancing, and I thought that might be, and I was thinking through an example, and maybe Barry can correct me if I'm wrong. I walk up to a Home Depot and I say, well, I don't have to wear a mask because I'm going to socially distance when I go in. I saw it as a loophole. And I did see in the St. Pete order, and I don't know if, Brian, you have that.
Yes, sir.
They qualified that with a number of people. If it's 10 or less, then you could default to that social distancing exception. And I thought that put some boundaries around it so it just wouldn't be ad hoc. So I would ask us to consider that or else take it out completely, I think, as Commissioner Seal said. The other thing that's in the St. Pete order that I didn't get a chance to send Brian is under exceptions, and it speaks to religious rituals. In other words, we know that singing is probably a great way to transmit the disease because you're, sending a lot of air out. And so if churches are included in our ordinance, St. Pete has an exception that says these requirements do not apply during a period in which compliance would interfere with the participation in a religious ritual. And I'm thinking that still will allow folks to take communion or sing and still be in compliance with the ordinance. Oh, he does have it. Okay.
Yes, sir.
You're fast. So that item F, if we could consider that just to make sure that churches that are covered now, they haven't been covered before by our orders, would still be able to practice those rituals temporarily and still be in compliance. And I would ask Jewel to tell me if my take on that is correct. Overall, I couldn't be more proud of our staff and partners and our physicians. This is absolutely not a power play or a partisan issue. I can guarantee the folks who are listening that none of us had this on our 2020 calendar, that one of our goals was to have a mandatory face mask ordinance.
Right.
While we were speaking today, both Leon County and Pasco County, which are totally different in terms of their politics, passed a mandatory face mask orders. It's no more partisan than when a hurricane is coming at us. We don't make partisan decisions. We make a decision based on the data, the trends, what the experts are telling us about public health and public safety. And this is the same way. I couldn't say it any better than our doctors have already said it. We are at a crisis point, and I don't believe we've seen the impact of phase 2, which was June 5th, which is barely 2.5 weeks ago. And the George Floyd protest started that same week. And a lot of those folks were wearing masks, if you go back and look at some of the photos. So I think, as Dr. Jameson has said, if you talk about a 3 to 4 week window, we haven't even seen that yet. Our folks are telling us what's happening in the ERs, telling us what happened in the hospitals. And we are compelled to act on this. And so I'm certainly going to support the universal ordinance. I think it's very well crafted. I think it has exceptions for folks that have health issues or claustrophobic or any of those issues. Our team has done a great job of putting together a responsive ordinance. I do think one thing we've heard is we have to educate folks so they don't have that false sense of security that, okay, I'm wearing a mask, now I can ignore everything else. We've got to continue to push that education and continue that enhanced enforcement on businesses that see what what's happening in their businesses is out of compliance. We've got to, kind of tamp down on that. And the last thing is the availability of the mask. You could just talk about that. In Pasco's press release, they talk about different places in their county where they'll make masks available. And I'd ask Barry to talk about what our plans are to distribute masks or acquire masks as we go on. But I support it if we can just look at those three options as we further the discussion, Madam Chair.
Okay, great. Commissioner Peters.
Madam Chair, I would have loved to have heard what Barry had to say before I do my comments. Well, he asked a question. I'd like to hear the answer.
Okay, fine.
Thank you.
Okay, so on masks, there's been a number of efforts regarding masks. Masks are not publicly distributed in all locations. However, we've had a few locations where we've got in masks. We've pushed them out to community partners. I know St. Petersburg has pushed out masks. We pushed out some this last weekend through community partners, through chambers, and through a variety of other means. As we get distribution in, well, we can enhance that somewhat. But I don't think the mask issue has been a problem. However, it's not. We haven't had like a public site that anybody can go to that we've set up for a long period of time.
Yeah, I'd like to see us do that too, if we can. Well, we can talk about that, but I'd like to see them more available. Those people who don't know where to get them, can't afford to buy them, whatever.
And I think I've said we have ordered and are actually purchasing a significant supply. So we, based upon the discussion last Thursday, we enhanced our effort on that.
Okay, Commissioner Peters.
Okay, so I have a couple questions before I make my comments. So Dr. Cho, I want you to clarify on the shields. And I want you to clarify for the people who have very clearly said they're afraid to wear these masks if they're wet, if they're wet and it's going to cause things, right? That they've quoted OSHA, which is the federal and the state law in the state of Florida. So they've quoted OSHA on the carbon monoxide and they've quoted OSHA on the dampness of masks. So you said you didn't think the shields were appropriate to keep in this ordinance, and I'm curious why. Given you have people that have claustrophobia, given that people believe that the carbon monoxide is an issue and people believe that the moisture is a problem, why do you think that it's not an appropriate solution?
All I mentioned, Commissioner Peters, was that it's not interchangeable in terms of the effectiveness. And I think Dr. Jameson talked about the mechanisms, difference between between having the mask and the face shields, the effectiveness of it using the mechanisms of having that barrier versus the face shield, which is essentially like a plexiglass. You're just getting the large particles, but it doesn't, again, in terms, I don't believe it to be interchangeable is all I'm saying.
So I guess my curious is, I mean, would you support if it was a shield? Because this was all about aerosol spray. Everything was about droplets and aerosol spray. It wasn't, because it doesn't transfer on surfaces. There's a lot of whole new information coming out. Now they're saying it's all about blood type. That report just came out like 10 minutes ago. So would you support a shield in lieu of a mask is what I want to know.
Again, all I'll say is a mask is probably more effective than a face shield. So in terms of what your level of comfort in terms of with that fact, and again, as Dr. Jameson mentioned, in terms of the mechanism, it just isn't as effective as a face shield. As a mask.
Okay, but well, that didn't answer my question. I understand where you stand on the differences, but would you support that in an ordinance? And if you don't want to answer it, that's fine. I understand. But I just want to hear yes, no, or I don't want to comment.
Well, I think my position is really just to inform and educate. And again, okay. I think I was there more to tell you the difference. It is not as effective as a face mask.
Okay, all right. So, so I guess my other question is, when we closed, we knew when we reopened that we knew that there would be an impact and numbers would spike. Was there any parameters set to determine when the spike was an issue, just out of curiosity? Because we expected this. We absolutely expected this. We had time to prepare to get PPE. We had time to prepare to get people out of the ICU. We had time to prepare to get hospital beds open, and hospital beds certainly were open since we weren't doing elective surgery or anything else. And people were afraid to go to the hospital. So we knew the number would spike. Were there any parameters about what the number would be, what the length of duration time should be, that the spike should be? I'm curious about all that because we didn't talk about that at all.
Well, I think one of the things we talked about was the percentage of tests that come back positive. And we said all along that if they came back more than 5% positive, that was a serious problem. And we're at.
I was directing the question to Dr. Cho, though.
I appreciate
all
that.
due
He
respect.
wasn't answering, and I remember us talking about that very clearly.
From a guidance standpoint, yeah, there is a number of guidance out there with reopening documents. As Commissioner Gerard mentioned, I think some of the reopening documents, as mentioned, the 5 to 6%. I think overall, it's really a decision really at the EPG, and it requires that discussion with EPG as well as the BCC. In terms of the numbers, obviously we look at those metrics such as the case count, such as the percent positivities. We look at, and the big concern and the reason we did the flattening the curve to begin with was the hospital capacity. So I think it's looking at multiple factors and really coming up with what our level is locally.
Okay, and thank you. I think this is important to talk about because you have a lot of people making assumptions, and I think it's important to talk about all of that. So I do have comments about some of the callers. And all of those that said we're not, other people aren't listening to scientists. And I just want to say that I believe that the people that wrote the OSHA guidelines and the people that wrote the CDC guidelines and the people that wrote the World Health Organization have lots of scientists that are giving the guidelines. So I do just want to make that comment. I also want to make comments about some of the nurses that said they wear surgical masks all day long and they don't have trouble breathing or wetness. That's not the same as a cloth mask. And a lot of the medical personnel talked about how they wear a mask all day, but they don't wear a cloth mask. And my issue is really the cloth mask. Clearly, you all know my issue. I've not been hiding the secret about my issue and the health and safety about wearing a wet mask for a long 8-hour period for somebody who's working outside, who's sweating and breathing all of that back in there and the moisture. So I just want to kind of go out and make comments about some of the callers. The wonderful young gentleman that called, young adolescent who called, who made the comment that the warning sign doesn't say that it'll take care of 100% of the COVID places. What it actually says, and I need this to be clear because we didn't read it all out loud, is this product is an ear loop mask, and this product is not respiration and will not provide any, doesn't say up to, it doesn't say, it will not provide any protection against COVID-19, the coronavirus, or other viruses or contaminants. So I just want to clarify for the record, the young gentleman that called in or the young adolescent that called in, I never said that the warning was it couldn't prevent up to 100%. The warning says it cannot protect at all on any level, can it protect against the coronavirus. And there's a big difference between up to 100% and at any level. And I just want to make that really clear. And again, I just many times I was listening to the nurses and the doctors who do not wear a cloth mask. And on the OSHA guidelines, again, scientists wrote these guidelines, says that carbon dioxide does increase within a cloth mask. So I guess my point is I really would support an amendment that says a shield would work in lieu of the fear and the moisture effect that can impede somebody's health from wearing a wet mask. And I know, Commissioner Welch said he wore a mask for 6 hours the other day and he didn't change it. And Dr. Jameson said the same thing. And just because you didn't change it doesn't mean you shouldn't have changed it. And there's a difference between what you maybe should have done and what you did do. And when it comes to moisture in the mask, the OSHA guidelines are very, very, very clear. So I just feel that we're discriminately picking winners and losers. We can have people go to a gym and not wear a mask, and we can have people stand in a choir in a church and not wear a mask and sing and shout and sweat and breathe heavily. And yet if I go into an alteration shop that 3 people might go into in a day, I have to wear a mask. So I have some issues with a lot of this thing, but I really do believe that we should leave the discretion to a parent. I have 2 grandchildren that are special needs, and those 2 grandchildren that are special needs will never wear a mask. And I think it is up to, or they wouldn't wear it for very long. So I think it absolutely should be up to the parents to wear a mask. And I also believe that we should allow for shields to be inclusive in a face mask. And I don't see that there any reason why. I also want to make a comment about H1N1. When that came in, there were signs in every single bathroom and every single business in this county. And I have yet to go into a bathroom where I have seen the same efforts on the hand washing signs and the hygiene signs that I saw on H1N1, and we have not seen that. I also would like to address the concealed weapons permit. Although I called Marion Hammer, who I believe is the utmost expert on when it comes to concealed weapons, I think that the last caller was right, and that we really should have Jewel or her team look into that in writing and where it says that. There clearly is fear. I had many people texting me today, and as long as there's fear, I would like to see our legal staff at least get in writing where she is correct. And if you need to call her, I have her phone number. That's no problem. I think that's pretty much all I have to say on that. I will not support this, but I would absolutely, if you're going to go through, I would love to see a motion, and I'm happy to make the motion if somebody would second it, that the parents have the discretion and that a shield would be a substitute instead of a mask for those that have anxiety, those that fear the wet, damp mask. I think it's a great alternative solution. It would stop the spray and the perspiration that comes out of the mouth. So I would make that motion for those two things, and if either one of you would support that, I think that would be a welcome second.
If I can interject, we do need to take the motion to waive the notice requirements and find that an emergency exists for the immediate passage before we take any action in regard to the actual ordinance.
Okay, thank you. Yes, Commissioner Welch. Oh,
Are you ready for the motion to waive the?
Commissioner Long, did you want to comment on that first?
Yes, I did, Madam Chair. I just wanted to, number one, acknowledge, excuse me, that we do have the business community folks who have chipped in considerable dollars to provide masks to our community. And I think that that deserves a huge acknowledgement and big thank you from all of us. And secondly, to Barry, I would like to know, at what point does this ordinance take effect?
So the expectation is that we would hear back from the state rather quickly. So you could choose tomorrow at 5, you could choose the next day at 5. I mean, I think it's up to you, but a time certain, I would suggest that we go ahead and put a time certain in there for the effectiveness.
Thank you, Madam Chair. And I have one, follow-up, if you might allow. What is the mechanism that we will use in order to inform our citizens if in fact this were to pass this evening?
Our plan would just be to, well, first it's going to be out in the media and stuff. We can do any kind of follow-up. Certainly the information is going to be out. If you want us to do individual letters, it's very hard, obviously. We can certainly do that to businesses, a little more difficult for the general public. So from that standpoint, we can certainly do any direct correspondence with businesses, distribution lists for that. But other than that, it would just be through word of mouth.
And one last question, Madam Chair, if you might. And how will this affect our many municipalities in this county that are having ongoing council meetings within their communities with their elected officials? Will it apply to them?
Under the way it is written, it does not apply to the municipalities, and that's part of the reason that each municipality is kind of handling their different situations. We discussed that earlier, and whether or not you waive that for the governmental entities or not. The only reason on the governmental entities, you have a lot of different types of camps and things like that. Most have established procedures, if not all, under that. As I said before, if you want to include all municipalities, you can simply take that provision out if you don't want to exempt them.
Commissioner Long, to be clear, this is a countywide ordinance and it would apply within the municipalities. We've just exempted the government facilities and put the obligation on the actual municipality to deal with their own facilities. But within the municipality, it would apply. This is a countywide ordinance.
Commissioner Justice?
No, I'm fine. I'll wait till after we do this part.
Okay. I had a couple of issues myself. The total exemption for kids, for children under 18 seems a bit broad to me. I mean, I don't know about you guys, but I was running around by myself with no parents by the time I was 10 or 11. I had kind of a permissive family, but but by 12 or 14, most kids are on their own. And frankly, I wouldn't trust, we can't even trust the adults to put masks on by suggestion. We're certainly not going to see kids doing it. So that's, I'll get to you in a second. Let me see. To Commissioner Peters' issue about the shields, frankly, I'd much rather see somebody wearing a shield than absolutely nothing. I mean, I don't think it's going to provide a whole lot of protection to the person standing in front of you, but it beats just having nothing on your face, I guess. And I have some issue also with singing in church. I mean, we already know that that's a terribly, it's a great way to transmit the disease to everybody around you. I mean, I don't have any problem with people having their religious rituals, but I think when we know something is going to cause a problem, that we shouldn't exempt it just because it's religious. I don't know if that makes any sense. Commissioner Justice.
Thank you, Madam Chair. Are we going to take up the waiver first?
Yes, we are.
Before we get into the meat of all the amendments and everything, that was what I was going to ask you.
I just wanted to make sure I got to say something because I never do. Yes, so we almost had a motion from Commissioner Welch.
I will restate that motion to waive notice.
Okay.
Need to say anything else, Jewel?
Is that a second?
And to find that an emergency exists that justifies the waiver.
As our counsel has stated, that's the motion.
What she said. Commissioner Seal, was that a second?
Yes.
Okay, thank you. All right, we have a motion to waive the requirement, the notice requirements for this. All in favor, please raise your hand, say aye.
Aye.
Or not. Opposed? Was that a yes or a no, Commissioner Peters?
That's a no.
Okay, so motion carries 6-1. Okay. Next issue. Yes, Commissioner Justice.
Thank you, Madam Chair. Now if we're back.
If
we're back on the bill. To use Tallahassee speak, we're back on the bill. I would agree with you. I think I don't know about the difference on a face shield. I think if they're wearing that, if they need to wear that as opposed to the mask for whatever reason, I think that's a step in the right direction. I'm probably a little bit more lenient than you on the for children. I don't think we want store managers or police stopping kids from doing. I think that just sets up a. So I'm fine with the way St. Pete did that, the way the sheriff suggested, and I think that the strictly adhering to the distancing that's in 2C. There's opportunities in public offices where it may be that makes a lot of sense to where if you have a set number of people in an office and there's enough distance, that they don't have to be wearing the mask all day. I think that makes actually a lot of sense. And I think at the end of the day, we're trying to get to people to voluntarily go along with this. And appreciate the sheriff's input. And I know a lot of people beat you up today because I think they thought your opinion was different than what it was stated at the beginning of the meeting. So I hope they'll go back and re-examine that. But I got to tell you, when I heard St. Pete, when I heard the mayor of St. Pete was doing the second level of the enforcement last night, I think I kind of felt like a lot of people, like, you know, a little apprehension. All along, this entire process, this county commission has tried to be the least restrictive possible when putting in parameters for safety for the people of Pinellas County. Whether it was our beach openings, our Safer at Home Act, only closing the businesses after the governor rendered them non-essential. Every step of the way, we've tried to do that. None of us have wanted to get to this point of having to require the face masks. You've heard that in the conversations in all our meetings all the way along. The fact that we are at the point where it's going to pass tonight tells you that we're hearing the numbers, we're talking to the experts, from enforcement, from the administration, to medical examiner, to EMS, to ER, to our director of public health, every single one along the way. We're not paying them to go along with us. They've been dragging us along in some ways. So it is the last tool we have in the toolbox, and I will be supporting that move tonight. Thank you, Madam Chair.
Well, me too. And I just wanted to tag on to some things that Commissioner Long was saying before. You know, we've been here for 6 hours talking about this week. And last week, I don't know how many hours. And over the last 3 months, I don't know how many hours we've spent talking about this and trying to figure out what the best thing to do was. For those of you who wrote in or called in and said, I'll never vote for you again, or you'll never get elected again, you know what? If I don't do what I think is the best thing for my community, I don't deserve to be here. And you can threaten me all you want. And I'm sure that goes for the sheriff and for all the rest of us sitting here. We're not here for our own good. Commissioner Welch.
Yeah, Madam Chair. We heard that with fluoride and with term limits and with green light. I don't think folks vote on a single issue. And as many people as we heard tonight, we received hundreds and hundreds of emails, and they probably were 60-40 in support. I stopped counting at about 300. And
we're over 1,100 now.
Yeah, we appreciate everybody that weighed in, but we've got to do what's right based on the science. So I just want to ask if we, going back to the social distancing, the item C, if there is support to on section 3.2C, we talked about persons strictly adhering and maintaining social distancing. If there's support to substitute St. Pete's language, which essentially says the same thing, but it qualifies it with a location that has 10 people or less. And again, I'm sorry?
I was just going to add the specific language in case, because it's not up.
Okay, well, while he's pulling that up, I just want to explain again my thought process that if somebody walks up to a Publix, they could say under this, I'm going to social distance, so I'm not wearing a mask. This language would pull Publix out of that because there are more than 10 people in there. I just see that as a loophole that we could close if we use St. Pete's language. Brian, do you still have it?
Yes, sir. Bring it up here.
Okay, so we have several changes that have been proposed, and probably need to go through them one at a time.
Sure.
Yeah. Okay, let's start with that one since we just talked about it.
And Commissioner, this is the one that you had sent me earlier, correct?
Right. And you notice I had to scribble on it, Barry, because they did not scan it as text. That's St. Pete did not scan it as text. But that section 5B essentially says what our section C says, but it would limit it to places of business that have 10 or less people in it. I'd be more comfortable with that one if there's support for it.
I could go along with that.
Madam Chair?
And too.
I can't see you all, but yes,
Question?
go ahead, Commissioner Justice.
Is that 10 people in an office, or is that like I'm walking into a office building, but there's only going to be 5 people in my sub? You know what I'm trying to get to is,
all right.
And again, I don't think we're going to be like going around with the counter or anything, but
I'm more, yeah. My concern was more on the other side, not having somebody walk up to a Home Depot or a Publix and say, "I'm just."
Keep in mind that the restriction only applies in what a defined term, indoor public place, which is a location to which the public has or may obtain legally permissible access. So, you know, many office buildings, I mean, even my office here in a public building, the public doesn't have a right of access to my office, even here in a public building. So I would say most office settings, this isn't necessarily going to apply to. So keep in mind, this is geared towards places that the public has a right to access.
And that was my concern, a large retail place.
Right.
I wanted to close that loophole.
So Commissioner Gerard, from an enforcement standpoint, I would really encourage you all to leave this provision in, even if it's watered down a little bit to where Commissioner Welch suggests. You have a lot of small businesses out there, a lot of small retail shops, tailors, shoe stores, those kinds of places. And, you know, a lot of them are having people where they are spread out. They're at different ends of it. And I'd ask from an enforcement standpoint that you do include it. I know Commissioner Seal has some concerns about it in mass, but this again is a compromise. It's a happy medium. And I would ask for us that you consider doing that.
Are you talking about the way that he's asking the change, or the way it's already written?
No, the way he's asking the change, compromise, you know, and I think that Commissioner Welch's suggestion compromise, it's a happy medium. It gives us a tool that we could use, and it isn't full blown. And some of you have expressed concern about it the way it is now. This brings it down, but it still allows flexibility.
Okay.
So I would move that as an amendment, if that works, Madam Chair.
Yes.
Okay.
I agree with that.
And I'll second it.
Thank you.
Okay. All right.
If I could make a suggestion.
Sure.
So that we don't get into a position where we may need to take public comment on individual votes. If I could suggest that you all reach some consensus on the things that you want to change. I'm making a list of it. I just don't want us to get kind of caught up into the, you know, do we need to take comment or not, as particularly if you all are reaching consensus on these items.
Okay.
So I'll withdraw
Sounds
that.
good to me. Okay.
I'll withdraw.
Do we sort of have consensus on that one, though?
Think so.
Yes. Okay.
Can you restate exactly what it is so I know the language? I think it's good for the people to hear the exact language.
Substituting what we had on the screen before from St. Petersburg for
the language would state these requirements do not apply if less than 10 people are in the location and the people in that location maintain social distancing. For purposes, there it is.
Okay.
Thank you. I appreciate it.
Okay. Next issue, face masks versus shields, or shields, or shields as a secondary. We heard that.
Sorry. I'm sorry. I apologize.
Okay. How does anybody feel about that one, about having shields as an alternative?
Just a question. Could it be something like, if for whatever reason a mass use is exempted, then a shield would be an acceptable substitute?
Well, yeah.
We can do
No.
that.
I'm saying no. Okay.
No.
I'm
Okay.
trying.
Yes, Commissioner Seal. Yeah, I hear you.
Commissioner Akers, while I would like to do that, I think Jill would advise us that that would create ADA problems. It could create, you know, the other exemptions. If we say instead, of a mask that I don't know, Jewel?
I think probably the cleanest way for you all to address this, if it's your desire, is we would modify the definition of face covering to just include the shield as an appropriate face covering. And then essentially all the other exemptions that apply would also apply here, including the one that's for ADA purposes.
Okay. That sounds acceptable. Okay, as far as a time certain to have it take effect, we need to have that in there. Yes, Commissioner Seal.
I would like tomorrow at 5 p.m. Tomorrow, June 24th.
Sounds good to me.
Works.
Okay. Okay, what else did we have? Yes.
So
Sure.
the second item, did you call me Madam Chair?
Yes, of course I did.
Okay. So the second item I brought up that you referenced was the religious ritual.
Yeah.
And let me just add to the church. My church is all virtual until through July, and a lot of churches are. But the few that I've seen either have very few people spread out in the choir stand, 4 or 5, maybe 10. So they are socially distancing. They're not.
Yeah.
They're not on top of each other.
And
So
after I said that, I realized they had to be socially distancing anyway.
Yeah.
So.
But
Okay.
the sheriff had a suggestion. Maybe we add these requirements do not apply during a period in which compliance would interfere with participation in a religious ritual, and then add something that says, social distancing requirements must be maintained or something like that. So we're saying, you can sing or do communion, but you still have to adhere to social distancing. I think that would, again, be a good compromise.
Yeah, I do too.
Okay.
So Jewel, the changes, was there anything else?
There's the age group. The
age.
Yeah, did you all address the age? That was going to be my question.
I may be the only one that has concerns about that, but whatever. I guess if the parents are insisting on it when they're around, maybe the kids will comply when the parents aren't around, like kids always do. Welch.
We're doing so well, Madam Chair, but just so a 15-year-old goes to Walmart and they say, my parents say I don't have to wear it, so they can go in.
Yeah, well,
the way that would be written. So
you could just as a
that's what I have a
suggestion.
problem with.
You could do it as a suggestion when they're when they're with their parents or something to that effect.
Right, Commissioners, what I had looked at was the language from the St. Pete Ordinance. It says a person is under the age of 18, except that person's use of a face covering is left to the discretion of that person's parent, guardian, or accompanying adult when the minor is in the presence and accompanied by their parent, guardian, or accompanying adult.
Right. So
I
what does that mean when they're not in the company of their parent or guardian?
Well, then they would have to wear a mask, but the problem, and presumably a child who's small enough not to wear a mask wouldn't be out by themselves.
Right. And honestly, I think 2 years old is too young to be requiring. I mean, I would say 5 or 6 at the very youngest. That was the other issue I had with age. Mr. Peters, you had something? I think.
Thank you, Madam Chair. So I think as long as they're I think the St. Pete language is good because as long as it's in the presence of the parent, so the parent has the discretion. So if the child has severe anxiety, if the child has autism, we don't have to ask if they have autism. If they're in the parent's presence, I think that's the right way to go. So I think St. Pete language is really good. And to your comment about, they're not with a parent, well, anybody, whether you're 15 years old or 30-year-olds or 60-year-olds, you can say, I have trouble breathing, and you are not required to wear a mask. So, I just think, if you're worried about all that, I think anybody can say, I have trouble breathing. We don't have to prove it with a doctor's note. So I think you just leave it with the parents, but I just want to make that comment, just because they're not with a parent, they could also say they can't breathe really well and they have trouble breathing or they have asthma. and they don't have to prove it. And so same kind of thing.
Okay. So it doesn't matter how old they are, if it's all at the discretion of the parents.
That would be my recommendation. Yes, I would
Okay,
agree.
I mean, if that's what we're doing, then we can take out A there. Right?
Well, I was going to substitute while I'm drafting this to kind of meet what you're saying. I was going to substitute any person under age of 2 years old would be replaced with a person is under the age of 18, except that person's use of a face covering is left to the discretion of that person's parent, guardian, or accompanying adult. And now this is the part I'm not clear on. What I think I'm hearing is this exception is only applicable if the minor person is in the presence of the parent, guardian, or accompanying adult. Is that part correct or not?
Well, no, because then you're saying that they have to have it when their parent's not around, I think.
Well, unless a different exception applies, like Commissioner Peters was saying, if they have a medical issue or something like that, it doesn't matter how old they are.
What does she care? She's not going to vote for it anyway.
Commissioner Long, you're
Thank you, Janet.
on a live mic. Okay, but I'm still a little confused about that because
that was just what I thought I heard. I can take that out.
Yeah, I think it's easier to just take it out.
Yes, ma'am.
If we're not gonna, okay. So Jewel, given what we've said and come to consensus on, we haven't changed it too much to actually vote on it, have we? Okay, good. Alrighty then, Commissioner Eggers.
Yeah, just again, I understand the excitement. Excitement's the wrong word. Trying to get this thing implemented quickly. I'm just thinking about the businesses that wake up tomorrow and they're being told by the end of the day today. I know I brought up, Sheriff didn't come out and excitedly say he wanted to put signs up again. So I'm thinking that's probably not on the top of his list, but we got to give these businesses time to put together their own, whatever they're going to do. And I think maybe tomorrow's a little quick. That's all I'm saying. I'm thinking maybe Thursday at 5 or something. Just give a little bit more time to the businesses. I'm not trying to nitpick this thing, but I think tomorrow is just, too quick. I mean, get the paper tomorrow morning and read about it, or they read it online tonight, or it doesn't give them any time. So I would just give them an extra day at least. So no big deal.
I would say we're days behind, if not a week behind everybody else doing this, and they didn't get any notice there either. So,
Well, okay. So you know what the notice they got there? Was it less than a day? I don't know.
Really, you know what? I don't really care that it's less than a day. I think it's time.
Well, I do. So I'm just one person.
I'm just disagreeing with you.
Okay, that's fine.
I think Pasco was immediate.
Yeah. Okay. And Leon.
Pasco was immediate. They did an executive order from the administrator,
right?
And it was immediate effect.
Most of them haven't even had all this discussion about it. They've just put orders in place. Okay. Do we have a consensus on the timeline then? Tomorrow at 5, did we say? Okay. All right. Okay. Yes, Commissioner Welch.
Thank you, Madam Chair. What did we decide on the age?
We're just taking it out or we're putting in that parents will make that decision for their children.
Okay, so the St. Pete language, basically.
Yes, it's the St. Pete language.
Okay.
Okay. All right. Is that it?
I think so.
I will entertain a motion then. I would be happy to make the motion, but I would like to have Jewel review the changes so that we are all clear.
Yeah, here's what I have. So we're changing what would be an exemption for anyone under the age of 2 to the St. Pete language that we just discussed, that would put it at the parental discretion for basically for minors. And it's the language that Brian had put up. We are modifying our social distancing exception, which is currently under section 3 2C so that it will apply, that it will only apply when there are groups of 10 or less. So that we cover Home Depots and the like. We are inserting an exemption, the St. Pete language, for religious rituals, so long as they can still maintain social distancing. We are going to modify the definition of face covering to include the use of face shields. And we will make the effective date and time June 24th at 5 p.m.
Okay. Is there a second?
I move.
Yeah, I have a motion from Commissioner Seal. Do I have a second?
Second.
Thank you. Commissioner Eggers.
Yeah, just want to make sure I'm clear. So churches they'll make their own decision about whether people will be singing. We're not going
to be social distancing.
Yeah, but they have to socially distance, but whether they choose to allow singing or not will be up to the church itself.
Yeah, we didn't say anything about singing.
I understand. I just want to make sure
religious rituals, right?
Yeah. If you consider that a religious ritual, I just wanted to.
Covers a lot of territory, actually.
Sure.
Yeah. Okay. All right. Thank you.
Anything else? Okay, we have a motion from Commissioner Seal, second from Commissioner Welch. All in favor say aye or raise your hand, whatever.
Aye.
Aye.
Aye. Opposed? Do we have any opposed? No? Okay. Motion carries unanimously. We still have a lot of business to take care of.
We still have an agenda.
Yes, we do.
Wait, Madam Chair, I'm sorry. I thought we were voting on the amendment, and that's my fault. So I really would like to change for the record that if we were voting on the whole bill, that's
we were voting on the whole thing.
Okay.
Okay.
And I apologize for that. So please strict that and change the record for a
Sure.
no. And I do want to make one statement. I'm sorry, I was reading something, I didn't realize it. I did want it on the record that I do support masks. This isn't about that. I do support masks. What I do not support is mandating masks, and I just wanted that to be clear.
Okay, thank you. Item 22, Habitat for Humanity.
Item 22 is a contract for sale for the purchase with Habitat for Humanity for the sale of 27 vacant parcels located in the Danville neighborhood.
Move approval.
Second.
I'm sorry, who was that first? Welch? Yes, okay.
Justice.
Welch,
Justice.
yes. Okay. Okay, we have we have a motion from Commissioner Welch, second from Commissioner Justice. Commissioner Long, did you have something you wanted to say?
I did, Madam Chair. I just wanted to know, could someone please clarify? The question has been asked of me. Is our ordinance now effective on June 25th or tomorrow?
Or
Jewel?
June 24th at 5 p.m. tomorrow.
Thank you. Thank you very much, Madam Chair.
Okay. We have a motion by Commissioner Welch, second by Commissioner Justice for item 22. All in favor, please raise your hand.
Public comment. Public
Madam
comment,
Chair, we can
Madam
do
Chair.
public comment.
Sorry.
At this time, if there are any members of the public that wish to comment on agenda item 22, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone.
And if it's anybody from Habitat, don't take the call because they'll just be cussing us out.
And Madam Chair, there are no members of the public that wish to speak on this item.
All right, thank you. I apologize to Habitat for Humanity. I think I told them it wouldn't be later than 6-ish. Silly me. All right, all in favor, please raise your hand. Okay, item carries unanimously. Item 23.
An agreement with Southern Fall Guard Detention Equipment for the county for jail F wing. These are sliding door retrofits.
Approval.
Who said that?
Commissioner Welch.
Okay. Okay, we have a, y'all are getting wonky. We have a motion from Commissioner Welch, second from Commissioner Seal. All in favor, please raise your hand.
Public comment.
Comment.
At this time, if there are any members of the public that wish to comment on agenda item 23, please raise your hand virtually in the Zoom meeting or hit star 9 on the phone.
Thanks for keeping me in line, Brian.
No problem. You're in the clear, Madam Chair. Go ahead.
All right. Okay, all in favor, please raise your hand. Again. Commissioner Peters? Thank you. Item carries 7-0. Item 24.
This is a resolution expressing support with Beckwith Electric as a qualified applicant for the economic development ad valorem tax exemption.
I'm with it to make that motion. To that motion.
Do I have a second?
Second.
Okay. Yes, Commissioner Seal.
If you recall, I do need to recuse myself from voting on a particular matter since my spouse does business with this company.
Okay. Do we know how many, I just have a question about it. Do we know how many of these we've actually done in the past? I know most of them are usually state 0. This is the first one. Oh,
We've
I know
sent them forward to be negotiated, but nothing's come back to us. Any approval? I asked that question a couple meetings ago.
Oh, all right. I wasn't listening. Okay. All right. We have a motion from Commissioner Peters, second from Commissioner Welch. Do we have anybody who would like to speak to this?
At this time, if there are any members of the public that wish to comment on agenda item 24, please hit star 9 on the phone or raise your hand virtually. And Madam Chair, there are no members that wish to comment.
I think we wore them out today.
Yeah.
All in favor, please raise your hand.
Whoops, sorry.
6-0 with 1 abstention.
Correct.
Right. Okay.
Thank you, Madam Chair.
Right. Item 25.
This is an agreement with the Florida Department of Children and Families for the Criminal Justice, Mental Health, and Substance Abuse Reinvestment Grant. This is $400,000 per year over 3 years for a total award of $1.2 million. It's 100% with no local match.
So moved.
Okay, we have a motion from Commissioner Justice, second from Commissioner Welch. Do we have anybody who would like to speak to this issue?
At this time, if there are any members of the public that wish to comment on agenda item 25, please hit star 9 on the phone or raise your hand virtually. And Madam Chair, there are no members of the public that wish to comment.
Okay, anybody have any questions? All right, all in favor, please say aye.
Aye.
Aye. And that was Justice and Welch, in case you missed that. Item 26.
This is the issuance of a certificate of public convenience and necessity for provisions of the helicopter ambulance service in Pinellas County. And they're listed down in your bullets.
Move approval, Madam Chair.
Second.
Okay. We have a motion from Commissioner Long, second from Commissioner Seal. Do we have any questions?
At this time, if there are members of the public that wish to comment on agenda item 26, please raise your hand virtually in the Zoom meeting and hit star 9 on the phone. And Madam Chair, there are no citizens that wish to comment on this item.
Okay. Okay, like I said, Long and Seal. Please raise your hands for aye.
Aye.
Commissioner Justice, are you there? Thank you. Item passes unanimously. Item 27.
This is a third amendment to an agreement with Life Safety for the next generation 911 networking services. This is the first and the final term extension. And this addresses a number of the things related to our 911 system, our PSAP, and the connectivities.
All right. Do we have any questions? Any motions? It's too early to go to sleep. I need a motion. Thank you. All right. We have a motion from Commissioner Seal, second from Commissioner Welch. Do we have any
This time, if there are any members of the public that wish to comment on agenda item 27, please hit *9 on the phone or raise your hand virtually in the Zoom meeting. And there are no citizens that wish to be heard on this item.
Okay, Commissioner Seal and Commissioner Welch, all in favor, please say aye. Raise your hand so I can see it. Thank you. Motion passes unanimously. Item 28.
This is the second amendment to an agreement with Covanta Projects for our waste to energy facility. This second amendment adds 9 new boiler tube projects to the project.
Okay, any questions?
Move approval.
Do I have a second? Thank you. We have a motion from Commissioner Welch, second from Commissioner Peters. Do we have anybody who would like to speak to this issue?
At this time, if there are members of the public that wish to comment on agenda item 28, please raise your hand virtually in the Zoom meeting or hit *9 on the phone. And Madam Chair, we do have one member of the public that wishes to speak on this item. We have Anita Holyfield. Ms. Holyfield, if you go ahead and unmute yourself and give us your first, last name, spelling, address, and you'll have 3 minutes to address the board.
My last name is spelled Holifield. My first name is initial V, then Anita, and I just want to ask that the commissioners consider continually having second amendments to existing contracts, and just be aware that sometimes they're viewed from the public as the commissioners approving a contract at a low bid and then adding amendments to increase the amount of the contract. So I just ask that in the future, when you are looking at second amendments to contracts, that is not a situation where you are extending a contract and not allowing other people to bid. Thank you.
Thank you. Just as an explanation, this is the company that operates our waste to energy plant, and it would be difficult to have another bidder and they're doing what they're going to be doing, but I appreciate those comments. Okay, we have a motion from Commissioner Seal, second from Commissioner Welch. All in favor, please say aye.
Aye.
Aye. Thank you. Item carries unanimously. Item 30.
29.
Yeah, that's what I meant.
This is second amended consent order between the County Utility South Cross Bayou Advanced Water Reclamation Facility and the Florida Department of Environmental Protection. This is a result of the lost power that we had a while back. So this corrects that issue. It's $9,000 consent order.
Thank you. Do we have any questions?
Move approval.
Okay.
Move approval.
Okay. We have a motion from Commissioner Welch, second from Commissioner Eggers. Do we have any callers?
At this time, if there are any members of the public that wish to comment on agenda item 29, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, there are no members of the public that wish to be heard on this item.
Okay, thank you. Okay, all in favor, please say aye or raise your hand or something. Thank you. Motion carries unanimously. Item 30.
Item 30, 31, and 32 all we're related to Career Source, and then actually 33 is appointments. Mike Meidel's on the line if you care to have any specific things. The first one is an agreement with the Florida Department of Economic Opportunity. The second one, memorandum of understanding between Career Source and the Pinellas County School District. And the next item is the program year, the planning budget for the Career Source.
Okay.
Move approval.
Are we approving all three of those?
I would suggest at the very least that you take public comment on all three of them at once.
Oh, of course. Okay. Do we have anybody who would like to speak to any of these first three? The agreement, yeah.
So at this time, we're talking about 30, 31, and 32.
Yes.
Okay, at this time, if there are any members of the public that wish to comment on agenda items 30, 31, or 32, please raise your hand virtually in the Zoom meeting or hit star 9 on the phone. And Madam Chair, we do have one member of the public that wishes to speak on this item.
Okay.
We're going to caller 5980, last 4 digits. If you can give us your first, last name, spelling, address, and you'll have 3 minutes.
Hi, this is Samantha Willis. I live at 260 Grove Circle South, Dunedin, Florida. And I was curious about what you guys are talking about the 3 items, because you mentioned school board and money, and it's just not enough in depth enough for the public to understand exactly what you're voting on to have an exact comment. And I'm just curious if you could go into more depth, please.
Yes, we can. For some reason, because the it's kind of a funny relationship that we are considered the what is it? Chief
elected official.
The county commission is. And somehow we have to be in the middle of every agreement that WorkNet or CareerSource has with anybody. So this agreement is actually between CareerSource Pinellas and the state of Florida Department of Economic Opportunity. This is their agreement, or their annual agreement, that allows them to operate as the workforce board. The second one is an MOU between CareerSource and the Pinellas County School District. We're only in the middle of it because the state says we have to be, but we're not really a party to this agreement. And the third one is the planning budget for CareerSource for the next year, and that is something that we have approval over. I don't know if that makes any sense. It never made any sense to me, I'll tell you that.
Well, I guess what my question is why, what are those services and what do they provide? And I guess, what are their affiliations?
CareerSource Pinellas is the designated workforce board for Pinellas County. They do job training. They actually administer the, I can't remember the name of it now, the unemployment system, and as well as job training and retraining and placement. Every county in the state has such a board, and every one of them. Excuse me?
She says she understands.
I understand.
Oh, okay.
I understand.
Okay. All right, great.
So did we get the caller's name for the record, Kat? Did you get that information?
I have Samantha Willis.
Okay.
Yeah.
Okay, thank you, Miss Willis.
Okay. Okay, well, let's take these. Can we take them all 3?
I think you could, yeah.
Okay. I forget whether I had a motion or not.
For all 3, Madam Chair.
Okay, and a second? Someone? Second, please? Thank you. We have a motion from Commissioner Welch, second from Commissioner Steele for 30, 31, and 32. All in favor, please raise your hands. Thank you. Item carries unanimously. 33 is appointments to the board, and we don't have any new appointments. These are reappointments of people that have been on the board and are up for reappointment this year. There are 3 people that are dropping off because they had prior commitments or whatever, but there's nobody new coming in yet.
So Commissioner Jarrett, just a point of clarification from the clerk's office. So we have 33 is actually approval of 5 new business appointments, and then 34 is the reappointments.
Oh, I'm sorry.
So, and there's actually 2 ballots for agenda item number 33, and with the chair's permission, I can walk through a process that might work from the clerk's end, if that would be something that would be preferable to you.
I think that would be great if you did that.
Okay, great. So we have 2 ballots for agenda item 33. Normally, if we were in person, I'd pass out the ballots so that you could vote on them. For your reference, the ballots are listed as attachments on the agenda items. For agenda item number 33, there are 2 ballots. Again, the applicants, there's a replacement worksheet ballot
that replacement worksheet ballot has two names for two individuals, one who is replacing a community college seat and one who is replacing the Pinellas Opportunity Council seat. For this particular ballot, it's choose 2 out of 2, so I would recommend a voice vote for that. And then I can kind of talk about the process for the second ballot.
Okay.
Move approval.
Second.
Thank you. Okay, for the first one, we have a motion from Commissioner Eggers, second from Commissioner Seal. Do we have any comment on the item?
This is this is 34?
33.
33, I'm sorry. So if there are any members of the public that wish to comment on agenda item 33, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone.
I just sit.
Say what?
It's okay, Barry. He wasn't muted. I think we're in the clear, Madam Chair. There are no members of the public that wish to comment.
Okay. Well, we can, since we have a ballot that's 2 out of 2.
Madam Chair, could we just read the names? Just
Yeah, I'm trying to find it.
Okay.
Yeah.
Sure.
Kat, could you do that?
Yes, I'm happy to do so. So one is Michael Ramsey. He's replacing Andrea Henning from St. Petersburg College. And the other person is Patty Sawyer, who's replacing Carolyn King from the Pinellas Opportunity Council.
And Patty Sawyer is works for Habitat, I believe.
POC.
Yeah. Oh, POC. Okay. She was at Habitat.
Was it? Yeah.
Yeah. Okay. Do we have any other questions about those two? Do I already have a motion? I do. Okay. I think I have a motion from Commissioner Welch. It's getting late. And a second from Commissioner Seal. All in favor of these two new appointments, please raise your hand.
Madam Chair, I'm sorry. I have Commissioner Eggers as the first on that motion.
Oh, okay. I don't know what, okay. I was looking at the wrong note here. And hey, as long as you have it, that's great. Okay.
There's a typo.
Let's vote again. All in favor, please say aye.
Aye.
Thank you. Thank you. Motion carries 7-0. Okay, so how do we do item 34?
So we still have one more ballot on item number 33. That's going to be a little bit of a tricky one. So for this particular ballot, it's choose 5 out of 6.
Yeah.
So it'll be an attachment. It's called applicant's new worksheet ballot. So this is to select 5 business applicants. If you select 5 out of the 6, and then the person with the lowest vote will get a 1-year term, and the other 4 will get a 2-year term. So we're gonna try to work through this together. So my recommendation, as far as voting goes, is to roll call each of the commissioners and to have them list their affirmative votes for individuals that they would like to appoint, and I will keep track of those votes as we go along. And then if we need to come back to see who would get a 1-year and who would get a 2-year term, we can do so at that time.
Okay. This should take a while. All
I
right.
can list the names if you'd like as well.
We have the names. Does everybody have the list of names in front of them? Okay. Well, you go right ahead then and poll the board.
All right, great. Commissioner Seal.
Okay. Andrea Sinek. Michael Matthews.
Michelle.
Rebecca Arvin. And Yvonne Alvarez.
And one more.
Chris Owens.
All right. Commissioner Eggers.
Chris Owens, Andrea Sianek, Rebecca Arvin, Yana McReynolds, and Yvonne Alvarez.
Commissioner Justice.
Chris Owens, Andrea Sianek, Michelle Matthews, Yana McReynolds, Yvonne Alvarez.
Commissioner Long. Oh, you're on mute, Commissioner Long. I'm sorry.
Okay, Chris Owens, Yvonne Alvarez, Rebecca, Michael Matthews, and Andrea Sianek.
All right, Commissioner Peters.
Chris Owens, Andrea Sinak, Michelle Matthews, Rebecca Arvin, Yvonne Alvarez.
Commissioner Welch.
Owens, Sianek, Matthews, Arvin, Alvarez.
And Commissioner Gerard.
Owens, Sianek, Matthews, Arvin, McReynolds.
All right, and let's see here. I'm just going to total them up here. So I have, as far as the highest votes go, the following 5 individuals were selected. So I have Chris Owens, Andrea Sianek, Michelle Matthews, Rebecca Arvin, and Yvonne Alvarez. And then from those, it looks like 1, 2, 3, 4, 5. The individual who would be getting the 1-year term is Yvonne Alvarez, as she had the least amount of votes out of the individuals. So.
Okay. Perfect. You did that so quickly. All right. So I think we have a slate. Can we have a motion?
So moved.
Okay, we have a motion.
Second. Second.
Now you're in a hurry. We have a motion from Commissioner Welch, second from Commissioner Seal. Do we have anybody from the public would like to speak to this, Brian?
If there are any members of the public that wish to comment on these appointments, please hit *9 on the phone or raise your hand virtually in the Zoom meeting. And Madam Chair, there are no members of the public that wish to comment.
Okay, well then all in favor, please raise your hand. Item carries unanimously. Thank you. Okay, where am I now?
34.
34. Oh, okay, these are the reappointments. And as I said, there are 3 people who dropped off, which is why we had to go put some more business people on there. 4 people, I'm sorry. And the rest have been good and loyal board members. So I would recommend that we reappoint them.
Move approval.
Second.
Okay, we have a motion from Commissioner Eggers, second from Commissioner Long. Do we have anybody who would like to speak to this issue?
If there are any members of the public that wish to comment on agenda item 34 in the appointments, please hit *9 on your phone or raise your hand virtually in the Zoom meeting. And Madam Chair, there are no citizens that wish to be heard on this item.
Okay, thank you. All in favor, please raise your hand. Thank you. Item carries unanimously. Item 35.
Commissioners, item 35 is the 4th amendment to the agreement with Paramedics Logistics Florida. This is for the requirements for our Sunstar ambulance services.
Move approval.
Okay, yes.
Second.
Thank you. We have a motion from Commissioner Welch, second from Commissioner Long. Do we have any questions? Yes. Commissioner Eggers.
Yeah, there's a $20 million increase over 3 years. So the goes from well, whatever. If we could just have a brief explanation.
You bet. Jim,
it's a large contract, so.
Yep, absolutely. This is a big contract. Jim Fogarty's on the line, and so if you could, Brian, let Jim in.
Yep.
He can walk through this contract.
Jim, go ahead and unmute yourself. There you go.
Good evening. The question was the nature of the $20 million increase in the contract. The nature of that increase. Hang on a second. Let me.
This is about.
I mean, just so the public knows, it is a $191 million contract for 3 years. This is for our paramedic service. So it's about 60 65 million, 63 million a year, but there's a $20 million increase over the 3 years. That was the question.
Right. So the contract has a 4% CPIU inflation. It anticipates the growth of emergency transports over the course of the contract by 4%. It increases the medical supply, consumable medical supply cost, and then also it anticipates certain additional services, which includes the critical care transport, additional one critical care transport unit. It adds a logistical supply person, and it adds a special events coordinator to the contract, which don't exist now. That's roughly $300,000. And then it removes the SWAT program, which has been transferred to the sheriff.
Oh, okay.
Yeah. And again, Jim, those are projections, so you're paying for the actual cost, and those are projections within the contract period if those increases are actually necessary.
That's correct. The CPI hasn't been 4%, but it can go upwards to 4%.
And Jim, question.
Yes, Commissioner Eggers.
Yeah, and I had asked a question when we were preparing our pre-meeting about the intra transport between a hospital, from one hospital to another hospital owned by the same organization. In other words, and that's not allowed either. And so I was wondering kind of where, what situations, what kind of numbers are we talking about that it so dramatically affects the value of the agreement?
Well, the numbers that you had requested, for instance, the transports between, say, Advent Health Systems, the hospitals that are part of that system. In 2019, there was about 992 of those transports. Those are the inter-hospital transports from one hospital to the other. The Bay Care system had roughly 2,400. The HCA system had just under 4,000 interfacility transports.
So that value of those transports with our current system, or with our current costs, I mean,
right. So as an example, if you look at HCA in 2019, that was about $2.65 million in terms of the invoices that were sent to that HCA corporation and all their hospitals. And that's a mix of bills that was sent to the hospital and to the patient's insurance carrier and providers as well.
And that was for the intra transports?
That's correct.
Okay. Okay, thank you.
Okay, any other questions? Do we have any comments from the public?
At this time, if there are any members of the public that wish to comment on agenda item 35, please hit *9 on the phone or raise your hand virtually. And Madam Chair, there are no citizens that wish to comment.
Thank you. Are you keeping tabs of how many times you've had to say that today?
I can say it in my sleep, Madam Chair.
All right. Well, we have a motion from Commissioner Welch, second Commissioner Long. All in favor, please raise your hands. Thank you. Item carries unanimously. Item 36, Supervisor of Elections.
This is a budget amendment for the supervisor elections. This has with response to mail ballots for the primary election.
Move approval.
Do I have a second?
Second.
Thank you. Are there any questions? I'm really glad she's doing this. All right. Do we have any items from the?
At this time, if there are any members of the public that wish to comment on agenda item 36, please hit *9 on the telephone or raise your hand virtually in the Zoom meeting. And Madam Chair, there are no citizens that wish to comment.
Okay. That being the case, we have a Welch and Eggers motion. All in favor, please raise your hand. Thank you. Item carries unanimously. Item 37. County Attorney has a few things here.
Under item number 37, I recommend the board approve staff's recommendation in regard to the proposed settlement.
So moved.
Okay.
So just so I'm clear, that you're approving this, the recommendation, which is
Correct.
again.
Approving the staff's recommendation on this, which I spoke with each of you individually about.
Okay.
Do I have a second? We have a motion from Commissioner Welch. A second from somebody? Commissioner Seal, thank you. Do we have any? Well, we don't do comments on attorneys' items. Okay. All in favor, please raise your hand. Thank you. Item carries unanimously. Item 38.
Under item number 38, I'm recommending that you provide authority for us to initiate litigation. This is a case of housing discrimination that was investigated by your Office of Human Rights.
So moved.
Second.
Okay. We have a motion from Commissioner Welch, second from Commissioner Long. Do we have anybody from the public who would like to speak to this? Oh, never mind.
Not on this one.
Okay, I'm tired. All in favor, please raise your hand.
Aye.
Okay, item carries unanimously. Item 39.
Under 39, I recommend that you give us authority to file suit in the case referenced. This is a code enforcement matter.
Move approval, Madam Chair.
Second.
Okay, we have a motion from Commissioner Long, second from Commissioner Welch. If there are no questions, all in favor, please raise your hand. Item carries unanimously. Item 40.
Under item 40, this is a resolution where I'm recommending you adopt. This is a request from the school board for the board to place a referendum question on November's ballot. This would be to continue the 1/2 mil levy that has been in place for some time now. I did request from the school board that they have someone available to answer questions. I understand he's still around. I almost regret having made that request at this point. But I do understand Mr. Hendrick is still around if you have any questions.
Wow.
Well, I think we owe him the question. I mean,
We'll get him on the panel now.
Commissioner Peters.
Wow.
Yes, I understand there's one change relating to charter school. I just wanted to explain it so the citizens understand it.
Mr. Hendrick, can you hear us?
Yes, I can. Thank you.
We apologize. Did you hear that question?
I did not. He was making me a panelist and it turned
Okay.
up real quick. So I caught the very end. I'm sorry.
All right.
So the question was, I understand there's a change to it, although it kind of re-ups it. There's a change associated with charter schools. Can you explain the change that was made?
Sure. Per the legislation in the state legislature, any countywide referendum would also now have to include charter schools. So a proportionate share of any referendum dollars collected would go to charter schools, and they would be obligated to report on their spending in accordance with the language. So 80% would go to teacher salaries, 20% to programs, and our independent citizens referendum oversight committee would review that every quarter as they do the spending for the rest of the schools in our school district.
Oh, I think somebody left the door open.
Okay.
Thank you. I appreciate it.
Do we have any other questions? Well, we apologize, Mr. Hendrick. Yes, Commissioner Eggers.
I just want to make it clear. I was curious. The state statutes direct us to basically pass this along. It's not our decision. We don't have latitude on this.
You really have very little discretion under the state statutes, but the Board of County Commissioners really is the only body that has direct access to the ballot. And that's why this comes to you. I think it's every 4 years that we place this on the ballot for the school board. And you would be adopting a resolution to do so.
Well, this 1/2 mil levy has certainly been well received by the public. So, but okay, thank
Move
you.
approval, Madam Chair.
Thank you.
Second.
Okay, we have a motion from Commissioner Long, second from Commissioner Seal. Do we take comment on this one? No?
Jewel?
I would suggest you go ahead and open it up for comment on this one.
Okay. If there are any members of the public that wish to comment on agenda item number 40, please raise your hand virtually in the Zoom meeting or hit *9 on the telephone. And Madam Chair, there are no citizens that wish to speak on this item.
Okay. Well, all in favor then, please raise your hand. Thank you. Item carries unanimously. Kat, you got the motion? Okay.
Yes, I have Long and Seal for that.
Right. Okay. Madam Attorney, do you have anything else?
No, ma'am.
Mr. Administrator, do you have anything?
I've got like 14. No, I'm kidding. So I do have a couple items. First, you did previously approve a June 30th virtual meeting. That way we can extend emergency order. Well, we will, as we get in now, the governor has extended the ability to hold virtual meetings through July. We will also need a July 7th virtual meeting to be able to, again, extend the emergency order. So that would get us to the already pre-planned July 16th meeting. I want to get clarification that that will be an in-person meeting because obviously we have the next item we're going to get to is the public hearings, and those public hearings will need to be advertised.
Right. Okay. And it's a big room, so we can get far apart. All right, that was it?
That's all I have.
Okay. Yes, Commissioner Justice.
Just as an FYI, the governor did extend his executive order through the end of July for those public meeting exceptions.
Okay. Item 43, appointment to Solid Waste Technical Management Committee.
Madam Chair, this is also another ballot for this one. So this one's a little bit easier than last one, I promise. So we have 3 names for the Solid Waste Technical Management Committee. It's to appoint 1 applicant. There is 1 name of an individual who is not eligible. Again, this is for agenda item number 43. The attachment does have a ballot on there for those of you who are viewing it electronically. There are 3 names. Hannah Joseph is the individual who's not eligible, and then 2 other names, Tracy Meehan and Kurt Salek. So again, I would recommend a roll call vote for this to select the name that you would like to move forward with.
Okay, you can proceed with that.
Commissioner Seal?
Sorry. Tracy Meehan.
Commissioner Eggers?
Tracy Meehan.
Commissioner Justice?
Tracy Meehan.
Commissioner Long?
Tracy Meehan.
Commissioner Peters?
Tracy Meehan.
Commissioner Welch?
Meehan.
And Commissioner Gerard?
Tracy Meehan.
Motion carries unanimously.
Okay, terrific. All right, we have a new business item. Commissioner Eggers, MSTU requests.
Yeah, I think as you guys have gotten used to seeing the FIXA board, which consists of Palm Harbor Recreation and Palm Harbor Library, and East Lake Recreation and East Lake Library, part of our MSTU. You have an annual request from the monies that we make available to our MSTU partners. And the East Lake Library is looking for a $25,000 item for security gates, readers, module checkout, self-checkout. East Lake Recreation is looking to upgrade the soccer fields for $30,000, up not to exceed. Palm Harbor Library, upgrading library entrance and carpeting not to exceed $25,000. CSA Palm Harbor, install electric gate to Palm Stansel Park entrance not to exceed $15,000. They've all been vetted through the management team, and after these requests, there still is available of 390 unallocated is $390,000 in that account.
Okay.
So I'd look for approval for those four essential projects.
Second.
Second.
Okay, well, we have a motion from Commissioner Eggers, second from Commissioner Welch. Do we have anybody who would want to speak to this issue, Brian?
At this time, if there are any members of the public that wish to speak on agenda item, which one are we on? Sorry.
44.
44. Please go ahead and hit *9 on the phone or raise your hand virtually in the Zoom meeting. And Madam Chair, we do have one member of the public that wishes to speak. This is Krista Dasher. Krista, if you'll go ahead and unmute yourself and give us your first, last name, spelling, address, and you'll have 3 minutes.
Krista Dasher, CHRISTA Dasher, DASHER, like the reindeer.
Yes, ma'am.
Just a question on the CSA gate to entrance of Pop Stancil. Where is that going to be located? Because there's actually Pop Stancil borders both 8th Street and Florida Avenue. So where would we be installing a $15,000 gate?
I will see if any of Nancy McKibben or Tom Almonte, Andrew, anybody there that online that could answer the specific location of that.
Barry, do you know which staff member would be most appropriate?
Well, I'm looking. I don't think any of them are on the line. So, and I don't have. They're not here tonight, so I can't answer that question.
Can we take in the projects? I don't have the project details here because there's.
Yeah, we'd be happy to follow back up with you. We can get your name and number. We'd be happy to follow back up.
Okay, but regardless, and the vote would still go through regardless if you pass that, correct?
Yes, but if you have strong feelings one way or another about where that opening is, please let us know right now.
Well, and remember, ours is a funding piece. It's a decision of their local board, so you'd have an opportunity to even discuss it with them directly.
This is at, I'm being told now,
what are we trying to stop with the gate? Do we have that answer? Car traffic, boat traffic?
Madam Chair, my understanding is that it's the 8th in order to stop the overnight parking. That's the goal.
Okay.
Okay.
Thank you very much.
Thank you, Ms.
Thank you,
Dasher.
Commissioner Johnson.
Commissioner Peters.
If her concern was that we block a driveway, can we ensure that we don't block a driveway unless that's the whole purpose? That's what I don't understand since you brought it up. I mean, is the driveway the problem with the overnight parking? Is that what we're intentionally trying to block? And does she have an issue with this blocking that driveway? I think that's what needs to be answered.
Ms. Dasher, I'm sorry. If you go ahead and unmute if you want to respond.
It's not really a driveway. I just don't understand the logistics of it. That section that they're blocking off has maybe 8 parking spaces and a turnaround. A lot of people drive, that's a whole golf cart community. So a lot of people drive and kind of loop through there and have foot access also to the dock that's out there in the water. I just didn't understand the necessity for a gate. And I've lived here for 4 generations. There's not that much overnight parking that would necessitate it in my mind, but it doesn't block anybody's driveway per se. It just kind of cuts off a main road.
Commissioner Peters.
Barry, would there be an issue time-wise if we just waited till we have the answers on that? Or is it time sensitive and we have to move it through?
No, it's a funding request. This is Commissioner Egger's funding request to you.
So
I am. Listen, if the questions can't be answered, I think that's a fair question and it can't be answered. I think the only thing I can think of is that, all I heard is that there might be some inappropriate night activity. They're trying to keep people out, after hours, that kind of thing, issues that might come with that. But that's all, that's the only detail I have with it. So,
So would it be a problem to postpone it for the next meeting, that we actually have a vote taking place? Is it
So-
that time sensitive?
I am assuming that we've waited, and I've tried to get everybody to wait, these four to wait later in the year so others can have a chance for, so I'm gonna assume that we can wait another month, but what I do know is between, the night activity, any drug activity, any vandalism, it's directed at that. I can certainly try to get more details, but I don't know how much more details you're gonna get on those issues, but I will certainly bring that back. I could bring the CSA, CSA back in July if it makes everybody else comfortable. But it's not unlike most county parks that you don't have access after hours. So.
All right. Commissioner Long?
Yes, Madam Chair, I certainly will defer to Jewel on this question, but I am concerned in terms of delaying the vote tonight to ensure that we will meet the supervisor's requirements for getting this on the ballot. So maybe if Jewel, you could just weigh in to make sure we're not messing anything up there, that'd be great. Thank you.
Different issue, Commissioner Long.
What?
That's a different issue. We've passed the supervisor one.
Okay.
I'm comfortable bringing it forward tonight, but if the board wants to wait, I can pull that one and bring it back. So it's really your all's choice.
Commissioner Justice?
These, we all know the FIXA board, and we know that they bring these things after a lot of deliberation. This has already been worked out with a lot of our administration staff. I'm comfortable moving forward, and if there's a really strong opposition that builds, we can deal with it. But this is not a haphazard issue brought forward. I'd be very comfortable voting on it tonight with Commissioner Egger's support.
Yes, so would I.
So I still have a motion out there.
Right, we had a motion from Commissioner Eggers, second from Commissioner Welch, I think.
The second from District 7 stands.
Right then. All in favor, please raise your hand.
Aye.
Thank you. Item carries unanimously. Okay. So that's it. We're fine.
Yeah, well, yes, but you do have, so we have item 45 through 49, and George, correct me if I'm wrong, but they take action to defer those to a future meeting.
Oh, okay.
And we wanted to ensure that would be, because of public notice requirements, to the July. Della stole the note.
If we're certain that we're going to be deferring these to, I think it's the July 21st is when we meet again. What I would recommend is that you go ahead and make a motion to defer them all to that date, because when we include a date certain, you do not have to re-advertise the items.
Okay.
Madam Chair, I would like to move that we defer it to our meeting in July, if that's appropriate.
July 21st, is that what you're saying?
July 21st would be the regular meeting.
And that's all four issues, all four items.
And there's actually a fifth one for if we include the CPA.
Okay, all five of them then.
Okay.
I'll second
To be
that.
clear,
Thank you.
are you doing the 6 p.m. public hearing agenda of that meeting also? It's usually good to have the time on it.
Good question.
So that would be.
Probably.
That meeting is currently scheduled for 2 p.m. So I think the question is, are we going to have the public hearings at 6 p.m. like you normally do with your live meetings, so that we can schedule it for 6 p.m. time certain on July 21st?
Yes. Great. Okay, Commissioner Eggers?
And it will be a live meeting. So, and you advertise it as a live meeting, correct?
If that's an agreement, then we will advertise it as an in-person meeting.
What will be happening? Just to be clear, if you all take action on these 5 items to continue them to July 21st with the public hearing to be held at 6 p.m., what I'm referring to are the legal notices that you have to place in newspapers. Those will not need to be rerun. So the applicants, particularly on the vacations, save that expense of having to pay for another ad, or the county, whoever pays for it. The actual notice of your meeting is a little bit different. That's something that just gets posted to our website, but that will certainly be clear. That notice on our website will certainly be clear that that would be a live meeting. Yes, correct.
The advertisement was for that other location, not for virtual.
To confirm, Commissioner Eggers, the advertisement was a combination of both virtual and in person.
Okay.
And we'll need to take a look at the governor's order. I know that there was one issued today. I haven't been able to read it because I've been here with you all. But what the order that extended through the end of June required is that the public be allowed to participate both virtually and in person. So we'll take a look at that and make sure that we're providing for public, access in the manner that's appropriate. But so your meeting as advertised will certainly comply with that order, because if we're required to do both, we're obviously going to do both. And I see that Don is sending me a message that it looks like it's going to be the same. So you will be providing for public comment both virtually and in person. So the legal notices that get placed in the newspapers, we will not need to rerun, but the public notice of the actual meeting, which is something that just appears on your website, will have all of the information and details on how the public can participate, the location, the details, the time, etc.
Hey,
The mute button is really useful.
all right, we have a motion and from Commissioner Long, second from Commissioner Peters, to defer 45 through 49 to July 21st. All in favor, please raise your hand. Do I need to take comment on that?
Jewel? You're muted.
Why don't we just open it up for one comment on all five, since it's a single
All
vote.
right. If there are any members of the public that wish to comment on the deferral of our public hearings, agenda items 45 through 49, please hit *9 on the telephone or raise your hand virtually in the Zoom meeting. And Madam Chair, there's nobody that wishes to speak on that deferral.
Okay. Well, all in favor then, please raise your hand. Last one of the night. Thank you very much. Item passes unanimously. And thank you. Yes, Commissioner Justice?
Thank you, Madam Chair. I just want to thank you for your steadfast leadership today, but also all our support staff that had a very long day, and the unflappable Mr. Zumwalt. So thank you to all of our good work.
Thank you, sir. Appreciate it.
Ditto.
Keep us on track, Brian. Yes, Commissioner Peters.
Thank you, Madam Chair. I just want to make a comment. There is a very significant increase in our overdose numbers. Our 911 calls and our deaths are at this point, I think in a 6-week period, we beat 5 months of last year. So we have a severe drug problem on the street, and I think it's important that we not lose focus on some of the other issues that are going on in the community. Our Baker Acts are also skyrocketing, and we're having issues placing people who are Baker Acted if in fact there's some suspected COVID that goes with it. So I just think if there's things that we can do and kind of get backtrack on the messaging for mental health, I think families need to be aware that people really have a lot of anxiety and there's a lot of risk out there, and it shows in the numbers on our Baker Acts and our overdoses. And I'm extremely concerned on the overdose numbers, given that, like I said, in 6 weeks, we had more deaths than we did in 5 months of last year. So it's a serious issue, and I think people need to be aware that there's a real problem with the drugs on the street. Thank you.
Thank you. Anything else? All right. We are adjourned. Thank you.
Thank you.